to the Catalan Institute of Oncology, your house. We start with the inaugural speakers. Dr. Lilia Olivier, Director of Smoke-Free Partnership, please. Sorry.
Lila?
Lila?
Yes. Good morning, everyone. It's a pleasure to be here today. I represent here the Smoke-Free Partnership. We are the coalition of over 50 organizations that work on tobacco control advocacy at the EU level and European level. It is indeed a pleasure to be here because the focus of our symposium today is a tobacco-free generation, tobacco-free Europe, tobacco-free world. And in the light of the European Cancer Beating Plan, we have a unique momentum to create and drive and support the political will to make sure that all of the policies that can be implemented and should be implemented according to the FCTC are implemented. And we will be also presenting today the results of the tobacco control scale that will actually show that we can do much better. And well, that's the plan and that's the goal of all people who are in this room, to make sure that by 2040 we will have a tobacco-free Europe and tobacco-free generation. Thank you.
Thank you. Dr. Angela Ciobanu, Office WHO European Office.
Yeah, thank you very much. Dear Minister, dear Director, dear Adriana, dear colleagues, really, it's a great pleasure to be today with you. And it's an honor for me to open the 6th Symposium on the tobacco control this year in the hybrid format. And first, I would like to thank Catalan Institute of Oncology of the most active WHO collaborating center for organization of this event. I also would like to thank all experts, participants, partners in the area of tobacco control for their dedication, perseverance, and the hard work. We have really advanced in our fight against tobacco, and it's hard to imagine that once we lived in a time when tobacco smoking was a norm and was viewed as not viewed as a harmful habit. It was even promoted by the doctors, nurses, whom we trust. And since then, we've come a long way. We have collected all the evidence that demonstrated tobacco use harms nearly every organ of the body, causes many diseases and deaths, and reduces the health of the smokers in general. We have a powerful tool. We have the WHO Framework Convention on Tobacco Control that become one of the most rapidly and widely embraced treaties within the United Nations. Many countries of the world adopted strong comprehensive tobacco control legislation, and a big number of people are protected now by tobacco control measures. And we have really come a long way. And we could think that it only gets easier from here, but it's not true. That the tobacco industry has not given up, and now they are falsely presenting themselves as a part of the solution to tobacco epidemic. And the wide range of the novel and emerging nicotine tobacco products are now on the market, and the industry presents their products as safer alternatives. Among them, the electronic cigarettes, heated tobacco products, they are gaining popularity worldwide, especially among the adolescents and young adults. The diversity of these products and their design feature characteristics made it very difficult for countries to regulate them and monitor their use in the population. There are many barriers in the area of tobacco control, but we should not give up on our vision, and we have to accelerate actions toward the achievement of the WHO European region free of tobacco-related morbidity, mortality, and addiction. Today, we'll discuss the state of implementation of the tobacco control policies and how we can shift to tobacco endgame, and how we are building capacity to strengthen tobacco control measures. In challenging times, and with limited resources, we must rely more than ever on the experience and lessons learned from one another and support each other. We are committed to a shared goal, and collectively, obstacles can be overcome and creative solutions can be found, and to come closer to our vision. Thank you.
Thank you very much. Adriana Bianco, FCTC Secretary.
Thank you very much. Good morning to everybody. Really, it's a pleasure for me to be here with you. Dear Minister, it's a pleasure to see the high-level importance that this issue of tobacco control has for Catalonia. So it's very, very pleased to see you here. Really, talking about endgame seems like something that we never thought before, because we, at the best of our best illusion, we were thinking how we can control this horrible epidemic. But now it seems that we are at a point that we can begin to dream about really ending the problem and not just controlling it. And I'm very happy to be with you, because while the FCTC is a treaty that is, of course, done and subscribed by countries, the participation of the civil society from the very inception of the FCTC has been really basic. We probably will not be where we are without the work of the civil society. So the academic part of the civil society is also what have helped us, because the FCTC is an evidence-based treaty. Without you making the evidence, we will not have advanced so much. So I don't want to take more time. I really want to thank you, everybody, and it will be a pleasure to be with all of you during this event. Thank you very much.
Thank you, Dan. Well, it's my speaking turn now. Again, welcome to the Institute. Here we dedicate ourselves to prevent and treat human cancer. You know that after the COVID pandemics, we have to deal with the cancer pandemics. In this institution, every year we see increase in more than 5% total cases of cancer patients that we assist. This is really unbearable if we do not do actions to stop, to intercept cancer evolution. And the easiest, more cost-effective strategic activities to intercept cancer is all the anti-tobacco policies. That's why we feel this is such an important honor for us to host for the 6th time this Catalan Institute WHO Symposium. I will switch to Catalan with your permission. Des de l'Institut Català d'Oncologia,
Catalan Institute of Oncology, we absolutely support the Health Ministry with any action that is leading to mitigating the cancer pandemic. Within this regard, and in the context of today's symposium, I would like to highlight that we absolutely support the law and project to limit and control the use of tobacco outdoors, in restaurants, and at hospital facilities and school facilities. The Catalan Institute of Oncology also participates with our tobacco unit led by Esteban. We collaborate with many actions, with many strategies. We coordinate along with the healthcare department, the Catalan network of smoke-free hospitals, which has led to very interesting events. We also participate in the control of anti-tobacco measures from the European governments. The Spanish government should also take an extra step, and I would like to encourage that, because we still have some pending topics like neutral labeling, for example, or the increase of taxes. We also welcome any other action which tries to finally end tobacco smoking. We know more than anyone that cancer will not be controlled if the current epidemic continues in a time of population aging. I would like to finish by thanking you all, thanking the professionals all over the world who are fighting the anti-tobacco struggle. This is one of the fights that is more significant, and I am therefore very grateful. Thank you so much.
And it is my deepest honor to present you the Ministry of Health of Catalonia, Dr. Manel Balcells.
Bon dia, thank you very much.
Good morning, thank you very much.
Angela Ciobanu, Lilia Olefir, Adriana Blanco. It's a pleasure for me to welcome all the participants, both online, I think 200 people more or less, and in this conference room, 50 people, I think, in the 6th ICO Symposium on tobacco control. I thank you very much, organizers, for inviting the Department of Health of the Government of Catalonia to be part in this symposium. But I also want to thank all the colleagues of the Tobacco Control Unit of ICO to have worked to offer us this symposium. And I said before, it's a pleasure to me to continue sharing with them and with all for you the hard work in tobacco control. Estic convençut.
I am convinced that this symposia, is of course so important. We are all convinced that controlling tobacco is paramount. It is one of the priorities of the Catalan government, and it is one of the specific plans that we are launching. Basically, to control cancer, but also mental health and heart disease. In Catalonia, 1.5 million people are still smoking. Even if the prevalence of smokers has been reduced, the number of smokers is quite stable since 2017. This is a huge drama for our country. Prevention and control are priorities, but obviously our strategy has to change. Not just with tobacco control, but we have to switch to the end game. And we have to protect spaces and make them smoke-free. This is a priority for us. We are committed. And with the development of these measures that you are well familiar with, to increase the protected and smoke-free spaces outdoors, in bars and restaurants, in the schools, and considering to limit tobacco in other spaces. And we are, of course, very aware of the challenges that electronic cigarettes pose, and also the toxic damage of tobacco. We really want to ensure that everybody has access to treatment, and we want to reduce tobacco smoking. From the very beginning, in the year 2012, there have been some things that have changed. And we need to now start thinking about the end game of tobacco, but we have to use a bigger strategy. And of course, you are here today to exchange ideas and discuss how we can do that. We have also seen that in this symposia, for the very first time, we are presenting the results of this tobacco control scale, where experts have been working, evaluating performance in 37 European countries. This scale is a tool to quantify the application of tobacco control policies at a national scale, and is based on disease policies and the recommendations of the WHO Framework Convention on Tobacco Control, so as to prioritize country policies. This scale has been updated because it was launched 15 years ago, and it has been updated. And we would like to thank the authors for a very reliable work that provides us with evidence to the community working for tobacco control. Thank you so much for all the work you did, and we really wish you all a very fruitful symposium. full of discussions and with a high level of presentations. I am sure that this will help us continue working together. And in our case, in Catalonia, we really want to create a smoke-free society, considering the appalling consequences of tobacco, especially when it comes to cancer. So thank you all. Have a wonderful symposia, and I really hope that we can apply your conclusions very soon to our countries. Thank you so much.
Good morning. Vols posar alguna cosa? Good morning. Thank you very much. Thank you very much to the authorities also for their welcome. And now, thank you very much to all of you here in the conference room, and also the more than 150 people theoretically attending on streaming, because I didn't check, but I will check in a while. So thank you very much. It's my pleasure also to, well, to give the floor to the conductors of the symposium. We will have Dr. Joan Soriano from Hospital La Princesa de Madrid, and also working in with us in the tobacco research group within the Theater of Respiratory Diseases here in Barcelona. And also my colleague and friend, also like Joan, Cristina Martinez, who is a researcher here at the Catalan Institute of Oncology and assistant professor at the University of Barcelona. So they will be introducing the different sessions. As far as I remember, we have 4 sessions, yes, and the presentation of the tobacco control scale at the end of the day. The idea is to have a forum in which the speakers, to whom I thank also, coming to Barcelona, coming to normality, more or less, after these terrible years with the pandemic. I believe it's incredible to have you all again here and to be able to share experiences and to have the opportunity to hear you. So the idea is to create a forum with the discussions between the members of the sessions, with the public here in the conference room, and I believe also that we are able to receive comments from the audience that will be screened and given to the table through the 2 YouTube channels, because we are on streaming both in English and with interpretation, translation into Spanish. So thank you very much to all of you. I believe that this is a great occasion. It's the 6th symposium. This means that we started to do this activity as a collaborative center of the World Health Organization 10 years ago, and we are very, very happy about this. So thank you very much to all the attendees, to all the speakers, and all the people who is also attending from their offices, homes, or perhaps in a train, I don't know. Thank you very much, and please, Joan and Cristina and Joan, the floor is yours.
Good morning to everyone again. As Dr. Professor Esteban Fernandez was saying, both Dr. Martinez and myself, Joan Soriano, will be the masters of ceremonies. So we will be the ones introducing each and one speaker. In this occasion, I will be the assistant of Dr. Cristina Martinez, because she will be presenting, and I will be with the very useful task of being timekeeper. So especially speakers, you know your allocated time. You will receive gentle reminders from myself if you overextend yourself, and also I'll be manning the Q&A and especially the questions from online. So please, Cristina.
Thank you very much, Joan. Good morning, everyone. Buenos días a todo el mundo. Bon dia a tothom. We are very happy to be here again in this symposium in person again, because the last one that we have 2 years ago, it was an online one. So those that you are attending here in person, use your presence here to ask the questions that we will try to address to other speakers. And also those that they are at home or wherever they are, please also send your questions, because we will be happy to pass these questions to make the discussions more lively. But to start with, and to be on a schedule, I will say that it is my pleasure and a real honor to start this symposium by introducing the first speaker, Dr. Ruth Malone, to all of you. Dr. Ruth Malone is Emerita professor at the Department of Social and Behavioral Science at the University of California, San Francisco. Since 2009, she has been the editor-in-chief of Tobacco Control Journal. She is internationally well-known for her research on tobacco industry, particularly revealing the strategies that these companies have used in undermining the public health and tobacco control policies. She is currently leading 2 endgame-related projects to which she is fully dedicated, but she started to write and research this topic more than a decade ago. So she is the pioneer in the endgame strategy. So we cannot have a more authoritative voice today to enlighten us on how we should move forward our community from a tobacco control position statement to a tobacco endgame one. I hope that you enjoy her talk as much as I enjoyed her classes years back in San Francisco. So, Dr. Ruth Malone, the floor is yours, or maybe I should say the screen is yours. Ruth, we cannot hear you. Could you say hello, just in case? Hi?
I'm so sorry. Can you hear me now?
Yes. Crystal clear. Okay.
Okay, thank you so much for that nice introduction and for inviting me to this wonderful symposium, which is just such wonderful evidence of leadership in Spain and elsewhere in Europe and all over the world. And I'm very disappointed that I'm not there to be with you in person and see some old colleagues there. But unfortunately, I broke my arm about several weeks ago, and I'm still really in the very early phases of rehabilitation with that, and it was just a little too much to travel. So you are there in Spain where this is very early for you. You probably haven't had enough coffee yet. And I am here in San Francisco where it's midnight. So between the two of us, we'll probably be bleary-eyed, but I hope to move the talk along and get it off to a good start for your wonderful day session. I'm going to really be talking about the shift to tobacco endgame and why I believe that it's really happening now. I would like to first acknowledge my colleagues, Drs. Libby Smith and Patricia McDaniel, who work with me here at UCSF and have for many years been part of our conversations on developing ideas about endgame and who are working with me on an endgame project now funded by the state of California. Let me just say a little bit about what I intend to cover here. I'm going to first contrast tobacco control versus tobacco endgame, realizing that some of you have probably heard some of this before, but others may be new to it. I think it's really always important to kind of remind ourselves what we are doing here when we talk endgame. I'm going to talk about some of the assumptions we definitely need to change if we're going to move in this direction. Discuss some endgame policies. I think many times people think endgame, that's sort of a pie in the sky, turn the faucet off, it's all going to go away at once. And we all know it's not going to be like that. So it's really, but it's a matter of the focus. Is the focus really planning for an end, or is the focus planning for more control? Some strategy and messaging thoughts, and then I'm going to end by a little pep talk about why I believe we really can do this, why we can achieve a tobacco endgame. I first used the term endgame in this editorial in 2010 to describe several papers that were in this particular issue of the journal that were really getting at deeper supply side type policies, addressing some of the underlying things that keep the epidemic going. And for some reason, I don't think I had ever used the term before. I hadn't seen it used before, but for some reason, as they do in the world, sometimes a word just captures a moment, and all of a sudden there were a bunch of endgame meetings and conferences and summits and plans developed all over the world. People began to have conversations about endgame. Now, what that meant was different, sometimes in different places. Sometimes it meant just a lot more tobacco control. But it's really, in the last 5 years or so, I would say, it seems to have accelerated in some new and really, I think, very exciting directions. For example, the American Heart Association has a whole tobacco endgame initiative now, and is really taking seriously the idea that this is something we want to promote. They're focused on youth, but there are other things in the works. Of course, ASH in the United States has been leading the Sunset Project aimed at encouraging, facilitating, phasing out the sale of smoked tobacco products. The WHO has, of course, been involved with these case studies on tobacco endgame strategies and how to develop and evaluate them. Recently, I saw something in the Johns Hopkins Public Health Journal from Joanna Cohen about phasing out cigarette sales and how to think about this in terms of the tobacco endgame. So you just see more and more discussion of it all the time. It's no longer a fringe thing to talk about endgame. It really is part of the mainstream discourse. So, but what do I mean when I'm talking about endgame? We developed this definition for a report we did years ago for Cancer Research UK, but I think it's actually held up pretty well. Endgame policies are designed to change permanently the structural, political, and social dynamics that sustain the tobacco epidemic in order to end it within a specific time. And it's really important to pay attention to this because this is a real distinction between endgame and tobacco control. Tobacco control is about, some of tobacco control has touched on endgame initiatives, but we here, when we talk about endgame, we are really saying what is keeping the thing going underneath. It's not just that kids start to smoke. It's not just that people have trouble quitting because they're addicted. There are bigger system things that are perpetuating this. And how do we get at those? And isn't it time that we start doing that? So structural dynamics, I'm talking about things like how there's an unequal distribution of burdens of tobacco We know that some populations have higher rates of smoking. Well, sometimes that's related to the fact that there's a greater number and density of tobacco retailers in disadvantaged neighborhoods, for example, as shown on this slide from San Francisco. That's one of what I mean by structural dynamics, an example. Of course, the political dynamics I think we're all pretty familiar with, and these are really nicely addressed in the FCTC, for example, by Article 5.3 and other provisions that really deal with the industry. We know that even at the local level, we see industry lobbyists, allies, front groups, and there is the industry that we don't see, the behind the scenes that we don't see, but there are political dynamics that we need to address. We need to make the industry even more radioactive than it is. Social dynamics. I know that, oh, excuse me, I went a little too far. I know that in many countries you no longer have these power walls, but even without that, there is still a social dynamic of acceptance that this is a normal thing to sell tobacco products, to sell products that kill people when used completely as they are intended to be used. That is a social dynamic that we somehow really have to shift. We have to do more to say this is not normal, this is not okay. We can't just keep doing this forever because we've been doing it a long time. Sometimes we really have to change. So, as you know, many countries have set endgame goals, mostly tied around the idea of less than 5% by a particular year. Very ambitious goals in some cases, but I feel fairly certain that some of these countries probably will come very close to making their goals. California in the United States is probably going to make its endgame goal by, I think it's 2035, although the United States adjusted its goal upwards after it figured out it couldn't do it. But these countries are all focused on really calling out the idea that they want to achieve an end game. But again, I want to problematize just a little bit too much focus on smoking prevalence or tobacco use prevalence, because as we have seen in some places in the past, tobacco prevalence can drop and then it can rise again, depending on what the industry does, other kinds of circumstances that influence health behaviors. So we need to really think about this a little differently in terms of these systemic issues. To me, this is always the driving question. Why is the single most lethal product, consumer product ever made, still sold on virtually every street corner, like it is a normal thing, like it's candy or pudding or whatever? Why is it still happening? And I know when many people start out in tobacco control, this is a question they ask: if it's that bad, why do they still sell it? And then it takes a while to figure out that it's this huge web of stuff that perpetuates it. So we need to change some of the assumptions that we make. We need to change this idea that these are normal consumer products. And we've come a long way towards doing that with a lot of policies. But I think one of the things we still have more work to do on is to link those in with helping people understand what the tobacco industry has done. Because the more people understand what the tobacco industry's role in this has been, the more they begin to see, oh, this isn't just like candy. This is like something else. Another assumption that needs to change, and one that I started out in tobacco control with, was that people have always used tobacco and died from smoking. And in fact, historically, this is not true. I like to show this fairly old slide from the United States, but it applies in other places as well, just to show that lung cancer, the cancer that we most closely associate with cigarette smoking, really was virtually non-existent before the early part of the last century. The cigarette rolling machine was invented in the late 1800s. And then shortly thereafter, there was the rise of the commercial cigarette industry, and they basically invented modern advertising and aggressively promoted use of these products. And then you see about 20 years out after the per capita rise in cigarette consumption, the lung cancer death rates going up. So this really is an industrially produced epidemic of cancers that we face worldwide that we shouldn't have to be facing. This is a preventable form of cancer that has actually been made worse, as some of the work more recently has shown, by some of the engineering changes made to the products. Quitting smoking is an individual issue. That's another assumption we need to change. This is something that my team has been doing a lot of thinking about. Why do we always put all the burden of quitting on the person who became addicted to tobacco and is trying to get free? We need to quit at a societal level. Governments need to quit tobacco. Politicians need to quit taking tobacco industry contributions. The planet needs to quit tobacco. We don't need all that tobacco product waste in our oceans. The industry needs to quit tobacco. They may claim they want a smoke-free future, but it sure is awfully far out, and they keep fighting effective tobacco control policies all over the world. So we all know in public health that behavior changes as you create healthier environments that make it more possible, that nudge people towards making it easier. If we want somebody to stop doing something, we don't sell it on every corner. We start doing something to make the environment healthier so that it makes it easier and supports them in what they're trying to do. So I want to just talk about some policy approaches to endgame. Regulating the product is one, taking down the levels of nicotine so the products are less addictive, getting rid of flavors, regulating the users through smoke-free policies, which we've done a great deal of, and that is part of denormalizing the product and the use of the product and having it no longer be seen quite the same in society. But I want to talk a lot about a direction that I think we have not gone far enough, and that's regulating the retail market. Now, I know you have done some more of that in other countries than we have been able to do in the United States, but I still think we have a long way to go because there are still far too many tobacco retail outlets, and this is a problem. Now, another thing that we can do, of course, is to reduce affordability, and we all know that raising taxes is an important piece of that. But as we approach endgame in some countries with low prevalence rates, we have to start seeing there is a limit where taxes are going to not help us anymore, where we really have to start getting underneath all that. So I think raising taxes is almost always good, but I do think there comes a point in societies that have moved pretty far down the tobacco control path where if you're really talking endgame, you can't just keep raising taxes forever. You're going to be creating the problems that you don't want. So I am very focused now on thinking about reducing retail availability, banning vending machines in places that still have them, retailer-free buffer zones around schools and playgrounds, that sort of thing, minimum distance between retailers, capping the number of tobacco retail licenses, assuming people have tobacco retail licenses, which is an important consideration. And I've been thinking a lot about how about thinking about incentive programs for retailers who commit to ending sales. Retailers adjust their product lines all the time. I mean, that's what businessmen do, or businesswomen, when they are running a business and they're selling less of something, which they are. In places with dropping prevalence, they are not selling as much tobacco as they once did. Isn't it important to start the conversation now about planning for a time when they will not be making any money from this? How are they going to manage that transition? Isn't this something we should be helping think about? Could there be incentives to help them move in that direction. Reducing the number of available licenses, obviously banning the sale of flavored products, banning sales in particular types of retailers, so perhaps not all retailers at once, but perhaps you don't need to sell it in pharmacies or grocery stores or particular kinds of retail stores. Limiting sales to tobacco or adult-only stores, although if that is pursued, one would certainly want to also limit the number of those stores allowed so you don't have a proliferation. And banning sales of all tobacco products. And again, all these with stars, at least one jurisdiction in California has adopted these policies. Just as a reminder, I draw a lot on California because we are working here, and California has made a state program commitment to work on endgame and support communities working on endgame policies. So it's a very exciting time in California to be working. And since California is a hugely diverse state, the size of many countries, it's an important leader, I think, in the endgame movement, even if the United States is somewhat behind. But in any country or community or place you're working, it's really about starting the conversation. It's about saying, this is a conversation we ought to be having. I remember years ago in tobacco control, this was just sort of, you just couldn't even talk about some of these ideas. It was just seen as too crazy. Well, it's time now to start having these conversations because it's about planning. It's about saying, look, if we really want to bring this to an end, how do we do it? So there are certain ways I think we can start that talk. And one is to say, you know, people made this epidemic. We can unmake it. This isn't something that came in on a mosquito. This was something that was industrially produced, caused by the most lethal consumer product in history. We can undo this. We've lost too many loved ones, and particularly in communities that are marginalized and still have higher rates of tobacco use. We are losing our wise elders. This is a social justice issue, absolutely. And we also know that tobacco companies are now targeting new generations. So they want the next ones coming up behind, but they're targeting them in new, different ways. A level playing field. Other dangerous products that we see are phased out or strictly regulated. Why is it that the tobacco industry continues to forever get a pass? Why have we decided that just because of historical accident or precedent, this should continue forever? We don't say, well, let's have lead paint forever, or let's give people a choice of whether they want lead paint or the not leaded paint. We just say, no, this stuff is dangerous. Take it off the market. Other products have to meet safety standards. The same should hold true here. Finally, the cigarette century is over. This really is not a normal product, a normal business, and it's time to plan and prepare for the transition to a time when this just isn't done anymore. Now, we recently published, well, it's been about 3 years ago now, Libby Smith and I published a paper on phasing out sales of cigarettes, and if you have not seen that, we take up some of the arguments about why this won't work and is a ridiculous idea. We haven't wrestled them all to the ground because not enough places have done it yet, but I think it takes up some, it discusses some of the reasons that I think it possibly really could work down the line in certain places. And part of this, again, is about having the conversation. So this is open access. It's at Tobacco Control. If you are interested in more about this idea, which I think there's a lot more to be written about it, but just wanted to call your attention to it. Would that be effective is a question. Would phasing out cigarette sales or combustible tobacco product sales or sales of tobacco altogether be effective? Well, we have a good body of research, and I'm really encouraged in the last few years. There's been a lot more research on the retail environment. Outlet density does increase the odds of smoking uptake and use, and being near a retail outlet is associated with relapse among quitters. I mean, it only makes sense. If you're trying to quit something that's addictive, but it's there right in front of you, easy to access, like a normal thing, it makes it harder to quit. And 70% of smokers want to quit, and 90% regret starting. I should say people who smoke. I'm trying to break myself of this habit, and see here it is on my slide. We've been having discussion about how smoker as an identity is stigmatizing. And we are on the side of people who are addicted to tobacco and want to get free. And the remaining smokers, the literature suggests, are softening, not hardening. They're not getting more addicted and more determined to continue. As the environment around them changes, they are more likely to want to quit and to make quit attempts. Retailer reduction is associated with reduced purchases. Eliminating in-store promotions reduces attractiveness. You may not have those in some of your jurisdictions, but it's really about denormalizing both the product and the industry. And if you say you can't sell this anymore, there's nothing more denormalizing than that. Beverly Hills in California in 2020 passed the first U.S. ordinance ending the sale of tobacco in that city, which went into effect in January 2021. Manhattan Beach did the same, also in California, implemented at the same time. In neither city has the sky has not fallen. No retailers, as far as I have been able to determine, have gone out of business. The retailers are not happy, they didn't like it, but they have adjusted. And they have gone on and they are selling other stuff. And some of them remark that they actually are not unhappy because there aren't a bunch of cigarette butts out in front of their stores anymore. We just did some interviews with retailers in those cities that we're going to be writing up. But this is an example of, these are places that have really led on this issue. Now, these are not these are small cities. They are fairly wealthy cities with low smoking prevalence to begin with. So it's somewhat low-hanging fruit. But somebody has to lead, and they decided to lead. And I think it's been an exciting thing. We are expecting that there will be more jurisdictions and some larger jurisdictions in California following in the next few years. Now, in Brookline, Massachusetts, they have taken a somewhat different tack, which is to implement the tobacco-free generation ordinance, stating that anyone born after January 1st of 2000 can never legally be sold tobacco products. So this is really sort of an aging out of tobacco users. It's a slow process. I think it has pluses and minuses, but it's going to be very interesting to see how it plays out. I think the important thing here is that these jurisdictions are taking risks with policies that have not been tried elsewhere because somebody has to go first. They are saying this is no longer, the status quo is no longer acceptable. We're going to try something new that gets at the structural, political, and social dynamics that keep the epidemic going. So it's really, we're going to be learning a lot from these communities that are enacting these new endgame policies. Now, of course, New Zealand has recently announced an endgame, very ambitious endgame plan, as we know, the Smoke-Free 2025 plan. Very exciting, building on Maori leadership, includes reducing nicotine in cigarettes, the tobacco-free generation proposal, a dramatic reduction in the amount of, and the number of retailers, which I'm going to be very excited to see how that goes and what they do. I think that will be challenging, but I think it could be a very important measure. Now, in the case of New Zealand, they're separating regulation of sales of combustible products from vape products, and we'll see how that goes. Different countries are taking different approaches there. I wanted to just point out, though, that while it may seem a wild thing to talk about phasing out sales of cigarettes, there is some support for this idea. In California, pretty consistently over a 3-year period, the California Tobacco Control Program Media Evaluation Survey found almost 70% support for the idea that cigarette sales should be phased out completely over the next 5 years. Now you could say, well, that's California and, you know, they're kind of unusual, but the rest of the United States, the data was not that much different. So there is a baseline of support there of people who are like, yeah, we're ready for this, you know, it could happen. In Ireland, this year, 83% in an Irish survey said tobacco product sales should be phased out. And the one that really caught my eye is that the bottom one here, the number of places that can sell tobacco products should be reduced by 95%. 59%, well over half, agreed with that statement. So that tells you there is baseline support out there. And these are for about questions that we've never really messaged. We've never had a media campaign trying to get people to phase out sales of tobacco or saying that we should cut down the number of places it was sold. And people are already there with support. So I think this is a really, and there are other studies that have been done in other countries showing pretty high levels of support for tobacco control measures. Sometimes even among smokers, there is high level of support because they want to quit. So like everything in tobacco control that we've ever tried to do, people say you can't do it. You couldn't possibly have non-smoking sections even in restaurants. You couldn't ban smoking on airplanes. When people started talking about that, it was suggested that there would be fights on the planes, and Lord knows, planes would be falling from the sky. You couldn't have smoke-free workplaces, and you could certainly not have smoke-free bars or smoke-free pubs in Ireland. It wouldn't ever happen. It just couldn't happen. But all these things did happen. And so when we think about endgame, I think we have to remember this. We have to remember that we have laid the groundwork that has led us to this point, where finally I think we can start to talk about how do we plan it? What do we do next? And more than 70 years after the publication of this seminal Dahl and Hill paper definitively showing that lung cancer was caused by cigarettes, I think it's really time that we said we are going to end this thing once and for all. So thank you for inviting me, for having me, for staying awake despite not having enough coffee. And I don't know if we have any more time for questions, but thanks so much.
Thank you very much, Ruth. It has been a pleasure to listen to you again about how to end with the tobacco companies' strategies. And also, I am pretty sure that many of our audience has been enlightened, and also we have new arguments to introduce right now in how to do advocacy work in order to start to work in endgame strategies. So it's time for questions. I think that it's very late for you, Ruth, but I'm pretty sure that someone in the audience, either in person or online, have questions. Do you have?
While the microphone is traveling, I tell you, Professor Malone, that this was awesome and that all systems are working. We heard you loud and clear.
Yes.
And the YouTube channel is working both in English and with our wonderful translators also in Spanish. We are receiving also some questions, but this will be after the first question from the audience.
So I have a question for Ruth. So there's a difference.
Please present yourself if you can, because maybe she's going to identify. Please present yourself. We have forgotten to say that. Present yourself and where you belong from.
So my name is Luc Joosens from Belgium. So my question is to Ruth. She made the difference between tobacco control and the end game. In my perception, the end game is tobacco control. It's a way to make progress on tobacco control. And I believe it is an illusion to think that if we have less than 5% smokers, it's an end game, because it will be always some kind of population who smoke more, and you will always have the risk that after a while it becomes popular again. So I'm not sure that it's a very good strategy for tobacco control, but I'm not sure that it's an end at itself.
Okay, thank you for the question. It's very clever. What do you think, Ruth?
Well, I think, Luke, that you were making the same point that I made, which is I don't think prevalence is really an end game either. I mean, I think that is a safe thing for countries to point to and say, here's our end game target. I mean, they have to have something. But I agree with you. You could have 5% prevalence in a whole country and have, 25% prevalence in a particular population. So in California, we have been really emphasizing that we bring everybody along together. Now, that may not happen exactly as we would like or as evenly as we would like, but the effort is to put a lot of more resources into the communities that have higher rates of tobacco use to really find out what they need to help reduce tobacco use in those communities, like some of the initiatives that have been led by the African American Tobacco Control Leadership Council have really helped problematize and change the view of tobacco use in the Black community in California and nationally for that matter. But I think we're actually in agreement. I think endgame is really about believing that the epidemic, I'm not saying that nobody will ever smoke, that we are going to hunt people down if they're having a cigarette in their backyard, and I think that's an important thing. It's not about people using this product. It's about, do you still have an industry continuing to promote it at this level, at this scale, with this much power, and with this widespread retail availability? To me, that's the conversation we need to have. What does it mean to end the epidemic? It doesn't mean you don't have a case here and there, any kind of epidemic. But it does mean that you don't have it at scale the way we do now.
Thank you, Ruth.
But I think...
Yeah, and please finish your argument, yes. Finish your argument. And we have a couple of questions more that we want to raise, but because we are short of time, we want to do these 2 questions because you are here with us, but finish your argument and we are going to pass these 2 questions to you. Have you finished your response to Luke?
Yes.
Yeah, okay, excellent. So now we have the questions.
Ruth, we have 2 questions from the chat room. One is easy to answer. It's from Manfred Neuberger. You have beautiful slides. Will you post them in the website of the symposium?
Yes, do you give us a permission?
Yes.
Excellent. You will have.
And the second is from our friend Sean Sample in Scotland. He is asking, should policymakers look at banning smoking within any inside space?
Well, I certainly do think that smoke-free indoor spaces are really important. I mean, I think, certainly in California, we're also looking at it in multi-unit housing, for example, where people are being inadvertently exposed to it from their neighbors' apartments. So, I mean, that's, that seems to me to be fairly, maybe not easy to achieve, but low-hanging fruit, building on our smoke-free policies in other places. So, yes, I think we should. But I think I always want to bring the emphasis back to how does it advance the end game? How does it disrupt what the tobacco industry wants to see happening? And the tobacco industry wants it to continue to be normal, to do it wherever you are. So, yes.
So excellent. So I think that we have had a very enlightening conversation with you. You have given us a lot of arguments how to change the idea of tobacco control to a tobacco endgame strategy. And I think that the harder is going to be to find tobacco products in the market, the easier it's going to be that smokers quit or even the kids start to smoke. So I think that we all need to change our argument, also shift to the tobacco aim strategy. And this is the purpose of this symposium. In fact, the title of this symposium is From Tobacco Control to Tobacco Endgame, and this first session we have had with Dr. Ruth Malone is going to be like it's going to open our mind in order to think about the correct things to do in the policy making level. So thank you very much, Ruth, for your time. We hope all that you have a very fast recovery from your arm, and next time have you here if possible. Okay, thank you very much.
Thank you for having me. I'm so sorry I can't stay for the other sessions. But I have to go to bed now.
I know. Go and rest. Thank you very much for your time. We really appreciate your time, and we know that you are early bird. So go to bed. Thank you very much, Ruth. So we continue with the session, okay? So right now I invite to the panelists of the next session of this that come to the table, please. The next session is Together Towards the Tobacco Endgame, and after Dr. Ruth Malone's recommendations on how to work on tobacco endgame strategy, we are going to have 4 panelists that are coming to the table, who are going to provide examples of how they have implemented endgame strategies. I'm going to present of each of them. They are going to have like 12 minutes, more or less. I'm going to do it from the following order. Yeah, I'm going to be here, no problem. I'm going to do it from the following order. I mean, Akaki Zoide first, then Allen Gallagher, Ohana Olilla, and Raquel Fernandez. And I'm going to present you whenever you are going to talk, okay, in order that the audience could remember more or less your background. So each of them are going to have like 12 minutes, and we will reserve some time for the discussion together at the end of their contribution. Please reserve some questions for the time of the debate. And as we have already said, Joan Soriano is going to be in charge of the chat, and he will share with us, with the table, the questions. Please be active, and we will try to conduct the discussion taking into account your comments. So the first speaker is Akaki Zoide, who was the former member of the parliament in Georgia. He has over 25 years of experience as an international expert in public health and health policy in a higher level policymaking capacity as Deputy Prime Minister of Georgia from 2001 to 2003. He was responsible for overseeing the health and social sector reforms in Georgia and the adoption of a package of groundbreaking new generation tobacco control legislation. For the latter achievement, he received the WHO European Region World Non-Tobacco Day in 2018. He was advisor of the United Nations organizations, including the WHO, World Bank, etc. So we have here a very experienced policymaker with us who has acted as a key person to generate a non-tobacco generation. Aki, it's a pleasure to have you here, and the floor is yours. We are all ears to listen to your experience as a policymaker. That is something very precious to have in this symposium.
Thank you so much, Christina, and it's my honor to address this distinguished audience of relentless fighters for the public health and against tobacco industry. Just to present, how can I, sorry?
What?
My presentation?
It's not here?
Sorry. Yes. My apologies. So I think that why Georgia example, I would say it can be typical in the sense that, It have been happening in some countries or may be happening in other countries of European region or even in EU. And while many people will think that endgame is really too far, too unrealistic, unlike some countries that are already discussing that very seriously, there are also other countries in the European region that think that this is still, they are grappling with the problems of controlling this horrible tobacco epidemic and trying the nicotine use epidemic and trying to overcome even that the progress of increased prevalence or increased use of nicotine, especially, for example, among younger generations and so on. So for them, it may seem a very unrealistic and very distant future, but I think Georgia example might be a good demonstration that even in a situation that where it appears to be very grim, very unhopeful, there's always an opportunity. And if you continue to prepare, continue to push, continue to consistently pressure the politicians, policymakers, communicate to public, bring this issue again and again in the public debate, that once, at some point, the window of opportunity will appear and you should be ready to jump in and really make a qualitative policy shift that I think happened in Georgia. That's one lesson I think that could be taken from this experience that I'll present today. But there is also at the end another lesson that I also want to stress. This is just few data on Georgia. It's 3.7 million. It's a small country, but quite good. Everybody's invited. Very interesting to visit. GDP, it's now a lower middle income country with life expectancy 73.5 and with health expenditures that are below the European average. What we had, when said situation is grim, yes, situation was very grim until 2016. You can see global prevalence, Georgia, it was 33 in general population of tobacco use, 12th in global ranking, and among males, 6th in global ranking because up to 60% of Georgian males had smoked. Another, active smoker, but 2/3 of the population was exposed to the tobacco smoke because all the, and tobacco-related death, I would say, double as much as the share of mortality, of general mortality associated tobacco use globally. In Georgia, it was every 5th and not every 10th of death, annual death related to tobacco use. And you can see tobacco smoke-free and smoked places, public places, and you can see only a few places where people can breathe freely, while all the very important places were full of smoke. Alarming trends in increased underage smoking on the rise in 2016, with the mean age for starting regular smoking decreasing from 16 years to 13 years, which was, I would say, the most alarming factor in here. Futile attempts for policy and legislative action since Georgia has adopted, especially since Georgia has ratified the Framework Convention on Tobacco Control. In 2010, the first attempt was made by Ministry of Health to try to adopt all the recommended empower measures, but it was eviscerated within the government even and has never reached, in its initial stage, never reached the parliament, and it was adopted, and it was the typical tobacco industry favorite legislation that allowed smoke-free places in the public hospitality industry, institutions, and so on. And 2016, 13, 16, another attempt, but there was very strong opposition from the Ministry of Economy, Ministry of Finance, Business Ombudsman. The Parliament tried to, with the civil society involvement, two members of the Parliament initiated the legislative change of the comprehensive package of laws, but it was successfully blocked by the tobacco industry lobbyists in the Parliament. And you can see tobacco stakeholder mapped by 2016. You can see in red are those that are the most powerful, obviously in many countries, including in Georgia. And you can see most of them were opposed. And even the stronger Ministry of Health, who was a strong stakeholder, was only moderately supportive. For the reasons we can, those that had participated in that discussions and very important battle in Georgia, as we call it, uphill battle, know why. But and you can see that the also tobacco industry, beyond the usual suspects, used some small retailers associations, association of vapor lovers, union of smokers' rights, which were created ad hoc once a legislative initiative has been initiated in the parliament. So what happened? What happened with the policy shift? Why, when the situation was so grim? And I think this is the situation in many countries right now with tobacco control, that you have a major political opposition and major policy opposition to the changes required and justified by some kind of mystical economic benefit considerations for the country. And what happened? Convergence of several factors. That's the window of opportunity that I was saying. New parliament was elected, which had some need for progressive reforms in general, not just in public health. Some of the medical professionals, public health-minded medical professionals, which is also not so frequent because medical professionals tend to concentrate on individual medical problems and not on the public health problems, were also elected, and also public officials and the younger generation of politicians that were more aware and more attentive to the kind of public health and general public good considerations. Tobacco industry lobbyists were fortunately not elected. Changes in the government also result in alteration of their policies, and the influence of Ministry of Economy has weakened. Not the Ministry of Economy opposition, but their influence has been weakened because the Minister of Economy became a prime minister, so he cannot side unilaterally anymore the economic considerations, also publicly. Healthcare became a political priority, and emergence of policy advocacy in the parliament, as I mentioned. I just want to stress these couple points and the zombie, as I call it, zombie arguments, because you kill them, you eliminate them in one country, and they are reanimated in another country. I mean, you really distract them with scientific evidence, with communication, with right messaging, but you go to another country, they're talking about the same thing, like it has never happened. So, and you can see that what arguments they were like, basically. The basic idea was that the world will end, especially for you as a government, okay? And it was beginning, proliferation of illicit trade, usual thing, plummeting budget revenues, political crisis, government will fall. Tens of thousands of jobs lost in retail and hospitality business because of smoke-free, because it's as if Georgia is a tourist destination and tourists are coming to smoke in Georgia. That was the only reason why they were coming to Georgia, because Europe had very strict laws. That's, I'm quoting one of the arguments presented by one of the tobacco industry lobbyists. And so the tourist industry will be ruined. Millions of furious smokers faced with inconvenience, violation of their rights, and expensive tobacco, rising public outrage, government will fall. Okay, the poor smokers will suffer because there will be tax increase. Impoverished. Government, of course, will not fall because the poor does not matter when electing the government, but however, please be fair with the poor people and be solidarity, express some solidarity. Anti-constitutional, which is the usual argument. And finally, just not fair. Please allow us to kill the people. So that was the basic argument in summary. Critical factors, I think, that we ended up with. This is the Georgian parliament when adopting the first law on the first hearing. And we finally managed to convince all these people that they put the no tobacco signs, yes, and they building a strong coalition, uniting all supporters, consistent intensive public communication, scientifically based arguments, transparent public discussions within showing who is who, because yes, of course there are backstage discussions, but you need, even the backstage political discussions are influenced, how you present that all to public and how you communicate to all the public. And if they see that they are Okay, that they are losing politically some of the important messages, like they are not protecting future generations, they don't care about children, they may be more receptive to any major change. And timely support from FCT Secretariat, WHO, Lungman Philanthropies, I think all these converged in the critical factors in the success. And just a few slides, I know that it's last minute, but this is adopting legislation is just halfway. I mean, what has been the major, I think, achievement in this case, it was enforcing, the actual enforcement of this legislation, which required equally energetic efforts for another year and a half, which was time for entering most provisions in smoke-free, advertisement provisions into force. And you can see intersectoral enforcement work plan, about 80 meetings, and we, a coordinating body, was in this case Parliament Committee, took the role of coordinator and tried to organize all this communication plan, intersectoral involvement, and you can see highly visible public communication campaign. And I think a very important component of that, recruiting civil society to monitor the enforcement of the law through the public funds, by so-called contracting from the state budget, civil society organizations, volunteers, students, medical students to do that. And the results after 4 years, just a year of 3 years of full-scale implementation of this law, you can have that positive economic gain. No disaster scenarios of ruining the economy and retailers have realized, on contrary. The people were done. This is the last slide. And also positive health and environmental gain. You can see that decrease in acute subarachnoid hemorrhages, acute myocardial infarctions, 20% decrease in the first year because of the passive smoking reduction, and sustained public support, including the smokers. But as a warning, this story is told with documentary that is available here, Uphill Battle, on that site, in short WHO-produced documentary on Georgia case. But what happened basically last week, this is another lesson, which is you never need to be complacent and self-satisfied. And you need to persevere, and you need to never, because our opponents are really persistent, and they're coming up with new ways to challenge the existing policies. And what happened in Georgia? They passed the postponement of the plain packaging after the battle, because they managed to organize a support, and without public hearings and everything, they managed to go through with that initiative. However, there is still a hope that President will veto it, and in this case, this another hurdle on the process of tobacco control will not happen. But in general, okay, be persistent, also after the adoption of the law and after success achieved. Thank you very much for your attention.
Thank you very much, Ataki. It has been a pleasure to listen to you, how to end with the zombies and be always watchful, because they can reveal. I mean, they can be alive again. So thank you very much. We are going to have the next presenter, who is Alan Gallagher from the University of Bath. He is a researcher fellow. Now we are going to pass from a policy maker and also high-level representative in the government to a researcher in our table, who is a member of the University of Bath, UK. Alan has a BA and Master from the University of West Scotland, and he has a PhD from the University of Bath. Alan's primary research focus has been to explore contemporary tobacco industry involvement in the illicit tobacco trade. He has experience on this topic at the European Parliament, and he has also contributed to describing the UK situation in the World Bank Global Review of the illicit tobacco trade. So, Alan, the floor is yours.
Hi, everyone. It's great to be here today, just for the purposes of keeping things on tape.
Probably the mic you need to be closer. No, it's already pressed. You need to be closer. Yeah, a bit louder. Oh, no, now.
Well, now,
Yes.
okay, great. Yeah, that's definitely louder than it was. Okay. I was going to say in the purposes of time, I won't mess around. I've already messed around a little, so I definitely won't mess around anymore. So yes, as the Alan Gallagher Research Fellow from the University of Bath, just want to quickly thank Professor Anna Gilmore for her contributions to these slides. And today I'm going to talk a little bit about advancing the tobacco endgame amidst industry opposition to it. So just firstly, conflict of interest declaration, perhaps obvious, but the Tobacco Control Research Group doesn't accept any funding from tobacco companies or other commercial organisations whose interests are not aligned with improved public health. And this slide, which will be available afterwards, has information about the funding we do receive. So, the slides, the formatting is not quite working there, but that's okay. So I promise this is actual text in the version I had. But yeah, so this should say, what is STOP? So STOP is an acronym standing for Stopping Tobacco Organisations and Products. It's a global tobacco industry watchdog launched in 2018 via funding from Bloomberg Philanthropies. And for one text that's on there is it's dedicated to rigorously exposing the tobacco industry's the cliffhanger of it is efforts to undermine and influence tobacco control policy. And so I'm from University of Bath, which represents the kind of academic research side, and we work with the Global Centre for Good Governance and Tobacco Control, who represent kind of advocacy side, as well as the union, who work with the wider Bloomberg Initiative, and Vital Strategies, who are the kind of communications arm of STOP. Okay, thankfully these slides have got rid of text, so just giving that STOP as a tobacco industry watchdog, I think it's really useful to think about this concept of an end game from the perspective of the tobacco industry. I think it's clear to see from that, and Ruth touched on that whether the industry are like it or not in terms of consumption of traditional combustibles, an end game is approaching in terms of globally we are seeing declines in cigarette sales. And so top left here we have up to 2018 showing that global decline. This is excluding China. This has started to even out a little bit. Someone's being called. This has started to even out a little bit, but last year's WHO report on global tobacco trends is showing that we're still predicting a significant drop in tobacco consumption. This is playing out also with recent data from the US, where we've seen a drop by 7.6% between 2020 and 2021. So really some significant numbers there. So what I want to move on to now is really, in response to this, tobacco companies have adopted both new and familiar strategies to attempt to ensure that they have a continued sales and they have a continued business in this kind of increasingly anti-tobacco market. And so how have they done that? Well, they've essentially co-opted the idea of the end game to some degree by saying that despite this being a problem that we caused and continue to drive, we're actually also, of course, part of the solution. So we have Philip Morris funding the Foundation for a Smoke-Free World, as well as the Unsmoke Your Mind campaigns. And then similarly from British American Tobacco, we have A Better Tomorrow. So this idea that the industry is part of this solution. Yeah, we were wrong in the past, but we're doing much better now, essentially. And I thought I'd include kind of a country example on the right-hand side here, which is, I believe is a smoke-free place sign from a football field, and this was actually part of an initiative funded by PMI. So again, this idea that PMI is actually trying to co-opt policy measures in terms of tobacco control. But of course, what I think is interesting about this is that the fact that the sign is itself shaped and designed as a giant cigarette perhaps says something in terms of how committed they are to that. So lots on here, but I just wanted to talk a little bit about some academic perspectives in terms of how we assess the industry's efforts, because it's one thing to say the industry's bad, ergo we have to dismiss them, but I think it's worth considering as objectively as we can how credible their arguments are. And so with that was a recent paper which aimed to do that, and it essentially puts forward 4 different criteria upon which to test kind of the industry's efforts and credibility in terms of reducing tobacco consumption. The first of these is, do any tobacco companies give a commitment to try and end sales of conventional products within 5 years? On that, the answer is no, we haven't heard anything in terms of, we hear a lot in terms of a generic, they hope to phase out cigarettes one day, but nothing in terms of a committed timeline in the way that we heard from Ruth earlier, where countries are giving clear indications. We haven't seen that from tobacco companies. Next is evidence to try and reduce uptake, and I think, and also to not obstruct tobacco control policies. And in both of these fronts, of course, the tobacco industry are continuing to do that, as we just heard a little bit about in the previous presentation. The last one is a little more interesting. So this is a replacement of conventional tobacco products with acceptable alternative products or services. As many of you in the room will know, in terms of what is an acceptable replacement, if you will, for tobacco, that's kind of an ongoing debate. But what can be said here is that if tobacco companies were solely or primarily or at all interested in public health before anything else, the types of products that they would be moving towards would be both tobacco-free and nicotine-free. But that's not what we're seeing. We're seeing them move into still tobacco products, so heated tobacco products, for instance, which are not yet independently established as reduced risk products. So we are seeing, again, that they're making efforts to blur the line here, but not actually being part of the solution. So just to sticking with kind of this academic approach in terms of what is it the industry are really doing then, our research group did a paper looking at long-term policy influence strategies by the industry. And we used two examples. We used the example of harm reduction and the example of illicit trade, essentially finding that in both cases we're talking about an issue created by the industry that the industry is now trying to present itself as a solution to. So with illicit trade, we were contributing to it for decades and now claim to be trying to resolve it. And with harm reduction, of course, they've caused the harm and are now claiming to be trying to reduce it. So on the first of these, it's really about norm shaping, and Ruth's presentation touched on this, how it's not just about policymakers, it's about people in everyday life and their perceptions of the industry too. And PMI know this very well. The internal documents from 2014 reveal that they had a clear strategy to appropriate harm reduction language in order to renormalize the image. And so they're ultimately working to be seen as part of a solution, and that includes in terms of endgame. Additionally, there's controlling data in science. I've just used examples from PMI here, but you can see there's many of them. So we have the PMI Science website, which is largely industry-funded research on PMI products. We have a Foundation for a Smoke-Free World, of course. We also have PMI Impact, so that's a similar initiative, but in relation to projects on illicit trade. And so these are all examples of the industry's age-old strategy of trying to control the scientific agenda via funding large amounts of research. The last one is, again, an age-old strategy that we're still seeing more and more, and that's the increasing use of third parties. And again, if we come back to those PMI documents, we can see third-party coalition building in order to create an alliance of credible messengers. And I think probably the obvious example of that in terms of endgame discussions would be PMI continuing to be the sole funder of the Foundation for a Smoke-Free World. So just in terms of the bigger picture then, I think it's worth thinking about what more can we do? How do we kind of address this? Because the industry are a real threat here, as always. And I think part of that story is looking at this in terms of it's a bit of a violent analogy perhaps, but in terms of a war versus battle. So the idea is that within kind of tobacco control, we've been really good in terms of fighting the industry at national level and countering that policy influence where we can. And again, we just heard a little bit about that in the previous presentation. But this is all largely responsive in nature, whereas with these endgame discussions, the industry have come out and taken a clear stance in terms of trying to present themselves as part of a solution. So in order to kind of win that overall war, if you will, we have to achieve global support. And part of that is showing that the industry are not actually part of the solution. And so that requires us being a bit more proactive and actually trying to predict what the industry will do next and counter it as early as we can. Oh, we've got some funny slides again. I'll try my best to do just some pictures, but essentially this is supposed to demonstrate how STOP will be trying to address that via 5 different categories in particular. So one of those is pointing out the industry's efforts to hook new users. One of those is looking at bribery and corruption within tobacco companies. This next one here, you can't tell just from the image, but that's in relation to COVID-19 and kind of industry's efforts to use that for corporate social responsibility. Then we have environment and sustainability arguments in terms of the industry, again, proposing to be part of a solution there, despite the fact it's contributing to it. And then lastly there we have sabotaging health policy, perhaps a more obvious one. So it's just a quick example then of some of the work that STOP has done on some of these topics. So one of those is the various work we've done in relation to PMI and harm reduction. So we've done a number of reports and policy briefs, and most known as Addiction at Any Cost, Philip Morris International Uncovered, which essentially looks at those leaked documents that I referred to and breaks down how their interests in harm reduction are largely just about improving their reputation. And part of that, of course, again, is the Foundation for a Smoke-Free World, an organisation we've looked at closely, including looking at the tax returns and going through where is that money actually going. And from that, we've had a lot of success in terms of we've actually had people withdraw from Foundation events upon hearing that PMI is a sole funder. And yet we've also found that when Foundation launched, a whole part of that was that I was going to diversify its funding sources. It starts with PMI, it's not going to end there. Give us money, we'll do lots of research. And then years later, it's still, to our knowledge, solely funded by PMI. So I think on that front, we've actually done a good job in terms of tackling a really big threat in the Foundation by calling it out. And I think we need to be doing more of that if we're going to succeed in terms of moving forward in Endgame. Similarly, we've also done work in terms of allegations of bribery and corruption. So various STOP reports and working with journalists, including BBC Panorama, led to us doing a number of pieces looking at nefarious activities of British American Tobacco across Africa. So this includes suspicious payments to government delegates to get access to privileged policy documents, for instance, as well as repeated surveillance of competitors in order to try and undermine them. And lastly, I just want to briefly touch on the Global Tobacco Industry Interference Index, which is a STOP output which has been annual for the past 3 years, which essentially looks at the extent to which governments are succeeding in responding to tobacco industry interference. Just on the bottom right there's some text in relation to Spain. I just wanted to flag this because in our most recent report, we found some positive news there in terms of Spain moving in the right direction by the Public Health Commission of the National Health Service putting in an agreement with health authorities to recognise the importance of Article 5.3 obligations. So just something positive there from perhaps a bit of a depressing presentation. So just to sum up then, the tobacco industry will continue to protect its commercial interests, and these are going to be opposed to a tobacco endgame. And in order to do that, they've worked to shape our image to try and co-opt and undermine the concept of a tobacco endgame. Again, we've got the Foundation and Better Tomorrow as examples. And so in response to that, we can't just continue to fight the battles, we also have to try and win this war, and that requires being more proactive and taking the industry's arguments and narratives on directly in order not just to create policy change, but also societal change and gain more support for the idea of bringing an end to tobacco. And organisations such as STOP have a key role to play in helping address this, I think partially because of the combination of people involved. So again, we have an academic background there, but we also have advocacy and country level links. So it really, I think, appeals in terms of giving policy makers the information they need, but also in terms of giving the public the information that they need to. So that's it from me. Thank you, everyone. And I'd just like to dedicate this presentation to the memory of TCRG's sorely missed colleague and friend, Dr. Mateusz Zatonsky, who we sadly lost earlier this year, and who much of the work covered today in my slides would not have been possible without his contribution. So, yeah, thanks.
Thank you. Thank you very much, Alan. And also, to make this nice remind to your colleague and our colleague Matthews, who we lost some time ago, but it has been an early loss. So thank you also because you give us like the evidence, I mean the research evidence that you are like gathering with your group, but also probably your slides have been also hacked by the tobacco industry, so you need to see and check whether this happened to you. Okay, in any case, we are going to pass to our our third presenter, Hannah Olila, who is a senior researcher, specialist working in the Finnish Institute for Health in the field of prevention of tobacco-related harms. Her research focuses on the patterns and prevention of tobacco and nicotine use among the youth, and she has participated in the development and evaluation of tobacco control initiatives in Finland. She is currently leading part of the European Joint Action on Tobacco Control 2, by describing the best practices to develop an effective and comprehensive tobacco endgame strategy. So you have about 12 minutes in order that we have like time for the next presenter and have some time for discussion.
Okay. Thank you very much. And first of all, thank you for the organizers for providing the opportunity to tell more of the Finnish approach. And I will also, in the end, talk a little bit of the current EU-level collaboration as part of the Joint Action on Tobacco Control 2. In this presentation, I will go shortly through the Finnish definitions and the progress that we have, also the key elements and the challenges what we have encountered. Start with the definition. I think Finland was the first country in the world to actually have this objective in the tobacco control legislation in our Tobacco Act. I hope we get more countries to join us, but I think we still are the only one. Here it's how it reads currently. So in this Tobacco Act, in the general provisions in the beginning of the act, we say that the objective of this act is to end the use of tobacco products and other nicotine-containing products that are toxic to humans and cause addiction. And to achieve the objective referred to in this subsection 1, this act lays down measures to prevent people from taking up the use of tobacco products and developing nicotine addiction, to promote the cessation of the consumption of tobacco products and similar products, and to protect the population from exposure to smoke from such products. So as you see also from here, we are not only focusing on tobacco, but we also include other nicotine products. And in practice, we first started with this more general definition without not having yet established timelines or prevalence goals, but these have been developed along the way. And we started with tobacco only in 2010 when this was introduced to the Tobacco Act. And later in 2016, we have broadened it to other nicotine products. In 2014, we introduced the definition and of the time frame and prevalence goal in this ministerial governmental action plan, Roadmap to a Tobacco-Free Finland. We had a very ambitious prevalence goals as 2% or less daily tobacco use by 2040. But then in the next bigger Tobacco Act revision in 2016, as we broadened the goal with the nicotine products, we also revisited this prevalence goal and time frame, and this was changed as less than 5% daily tobacco or non-medicinal nicotine use by 2030. So we put the timeline a little bit earlier, but changed the prevalence goals to be little higher. And how did we then arrive here to actually setting this tobacco endgame objective in the Finnish legislation? This started out actually as quite simple steps and simple questions. In one of the national tobacco control conferences, which took place in 2006, we had there a keynote speaker, chair of the Finnish Parliament and a former Prime Minister, who asked, what is your ultimate goal? Why don't you aim at tobacco-free Finland by 2040? And this was taken quite seriously. First concrete steps were then following in 2008, when this establishment of Tobacco-Free Finland network took place. And this has been really important in Finland in moving this agenda and these steps forward. So this consists of NGOs, governmental institutions, health professionals and networks, municipalities and researchers. It's an organized partnership between the NGOs and government, and this network really coordinates many actions. It also is very important in communicating the benefits of tobacco endgame in Finland and advocating for policy changes. And this network is being coordinated by Action on Smoking and Health of Finland. The network has two subgroups to support comprehensive approach and also evidence-based approach. There is an expert group on cessation, and then there is a scientific advisory board as well. We have moved the tobacco endgame measures forward in Finland through different working groups and roadmaps. The first one was prepared in 2008 as an intersectoral working group where the chair was from Ministry of Health, and this mainly proposed changes to tobacco legislation. The next one was in 2014. This was not a working group as such, but there was a roadmap prepared by the tobacco team in the Ministry of Health, and this included legislative changes and other measures as well, targeting this tobacco-free Finland. The latest one has been in 2018. This was again an intersectional working group, and here the chair was from the Confederation of Finnish Industries. This made proposals considering legislation and again other measures for prevention and cessation. And there usually are some questions asked about, well, isn't this chair from the Confederation of Finnish Industries problematic in terms of tobacco industry? But actually this person has no ties to the tobacco industry, and he's very pro-tobacco control, and it's a very good channel also to communicate between the different sectors in Finland. And the latest working group has actually been set this year. It's just now preparing its report, which should be published in January next year. And this will hopefully include again many new measures to move this tobacco endgame forward. And this current working group has been tasked to focus on especially these themes that are shown on this slide. They have been asked to assess the current status and make proposals regarding the regulations related to nicotine products. And this also includes nicotine replacement therapy, which in Finland is sold over the counter. And to assess the current status and make proposals regarding smoke-free multi-housing units. And I think one of the good, somewhat newer arguments related to this, what we have been discussing in relation to this working group, is that how come we are able to provide a very good protection from exposure to tobacco smoke in workplaces, but we are not able to provide the same level of safety in homes. So I think this has been also a very good new argument to discuss this topic. And the last task has been to assess and make proposals regarding increasing the minimum age of tobacco and nicotine products sales from 18. The tobacco endgame in Finland has been part of this step-by-step approach. We have a long history in having a strong tobacco control legislation, starting from the 70s, and it has been gradually tightened. And the endgame objective has then fallen quite well as part of this longer process. And as most recent legislative changes, we have had the revision of our Tobacco Act this year, and we have adopted plain packaging, so that will come in force next year. And that will include not only tobacco, but also e-cigarettes and e-liquids and their refill containers. And we also adopted smoke-free playgrounds and beaches as part of this latest revision. Regarding the current progress, we have done quite well, especially in the youngest populations there, especially in these boys who are around They are around 14 to 16-year-olds. They are almost at this 5% level, so we have done very well there. For the working age population, it's still over 10%. It's now at 12%, with the most recent data from 2020. And especially for men, the decrease has been somewhat slower in the recent years, so there's definitely much room still to improve. The biggest challenges are maybe not related to smoking so much anymore, but we are also having challenges with snus, as it's very easy to import cross-border from Sweden to Finland. With e-cigarette use, we have also had very strong regulations for those. These were implemented in 2016. So we got, for instance, the flavor ban, age limit, vaping ban in no-smoking areas, point-of-sale display and advertising ban, and retail licensing for these products. And we have really seen decrease among the use of these products among youth, which is really good. But of course, we are now encountering some challenges with these new types of e-cigarettes with the disposable ones, which are also on somewhat gray area in our legislation as well. But for adult population, the e-cigarette use has also been rather uncommon, around 1% throughout the whole surveillance time. If we then go to the key elements in the Finnish approach, this can be, for instance, summarized this way. We have a very clear goal, as the objective is in the Tobacco Act. It has also protected us a lot from the distraction concerning the regulation of, for instance, the novel nicotine products. And it's very good that it's a specific time frame, so it's a measurable goal as well. It's been also vital to have the involvement of key stakeholders. This intersectoral collaboration has been really important, and this strong and organized network has really been able to keep this on the agenda and also in a positive way. Regular monitoring and review of progress. As I said, we have had these working groups and roadmaps and surveillance and research. So there are some structures to take this forward every few years. Political and public support. Nowadays, it's there. It hasn't always been there, but the attitudes have changed a lot with this gradual step-by-step changes and approach. And nowadays, we have support from all political parties. And also, I want to emphasize international collaborations, the structures that come from the FCTC, from the EU level regulation, and the support from the expert groups and the joint action. And also we have a lot of collaboration on the Nordic level as well. But we also have our own challenges. While this aim is widely supported, it's more difficult to agree about the means. Of course, it's a so slow process, and we would like to get there much faster, but these changes take time, of course. We are very good in regular monitoring, but this is also not the same as a true impact assessment. So we would need to invest much more also in the evaluation. As mentioned also earlier in Professor Malone's speak, the differences in the population groups, this is also something that we see, so we would need to be able to address this better. We have insufficient cessation support and campaigns, so this has been under-resourced also in Finland for a long time. And then, as I mentioned, the snus and novel snus-like nicotine products, which are also attracting new population groups and new customers. And monitoring and preventing tobacco industry interference as well. We don't have a strong industry presence in Finland, but of course they are trying to find their ways. And one of the examples was a part of this single-use plastics directive part. But we were able to, luckily, not have that to go all the way to the end. Then just a few words about the EU-level collaboration to take this on a little bit broader level. So Finland is also participating as part of this international collaboration to the work package of this EU-funded joint action on tobacco control 2. We are leading this work package, which really focuses on these tobacco endgame strategies and tries to provide some tools for the countries in this region to really move these forward on their national agendas and legislation. We have 21 organizations here from 13 EU member states with different tobacco control contexts. Here are just briefly shown our objectives, what we are working with in this project. So we are really identifying, assessing these strategies and policies. We are exploring the best practices in these, and then also promoting these to really help countries develop their own approaches to this. And as the results from this, we are producing different reports starting next year. The first one will be in March, a report of tobacco endgame strategies for the European region, and then recommendations for research on forward-looking tobacco control policies and tobacco endgame strategies. And then finally, in the last year of the project, we are also building this online toolkit, where we hope to present different case studies, how to move these tobacco endgame goals and strategies forward in different contexts in Europe. These were all I had. I hope I kept the time. Thank you very much for your attention, and happy to answer any questions.
Thank you very much, Hannah. Yes, I think that we are going to have some time for the discussion. And our next presenter is Raquel Fernández. She has a degree in journalism, and she has been the president of nonfumadores.org since 2005. She has been dedicated to empowering citizens to protect the right to a smoke-free environment, and also to pressure legislators to advance in the implementation of tobacco control measures, focusing on preventing new generations from starting to smoke. Under her leadership, nonfumadores.org has become one of the main stakeholders of tobacco control in Spain, and the organization received the World Non-Tobacco Day Award in 2022. So today, nonfumadores.org, led by Raquel, continues to work to advance the agenda of a smoke-free and nicotine-free future, using the Endgame 2030 declaration as its main roadmap. So thank you very much, Raquel, and thank you for leading this important strategy in Spain, and let us know more about it.
Okay. Will you let me to remove my mask?
You can remove it.
Thank you. Well, hello to everyone. It's a pleasure to be here, and thanks to the ICO for inviting me to present you the Spanish Tobacco Endgame Declaration. Well, first of all, I would like to contextualize the regulatory situation in Spain regarding tobacco. Our first Spanish tobacco law came into force in 2006, and it was the biggest step in public health in Spain. It was approved with the support of all political parties in the Congress, and it was a great success due to the support of civil society, that it was finally empowered to, to achieve their rights. Well, 5 years later, the law was modified with a main introduction, which was the ban of smoking in indoor hospitality business. And later on, we had the transposition of the European directive in 2017, 3 years later that it was due. It was a last opportunity to introduce new measures at the national level to fight tobacco. But instead of that, the only mandatory issues of the European directive were incorporated in the Spanish legislation. Those were the regulation of e-cigarettes with a health focus and the increase of the size of the health warnings on packs. And since then, we had nothing. While the tobacco industry, we know it moves in the fast track, introducing into the market its novelty products. The control regulations in Spain are stuck in the reality of more than 10 years ago. So it is true that there is a document called a Comprehensive Tobacco Control Plan, It has been prepared by the technician of the Ministry of Health with the contribution of from all tobacco control organizations and the health departments of the regional governments. But the truth is this document is actually hijacked in the office of our health minister. And she has been in the office for 2 years and now is running for the, to be mayor of Las Palmas City Hall. That's in the Canary Islands, where the tobacco industry is more powerful in Spain. It has a big influence. So there has been attempts to move forward by the tobacco control movement. That's going to start in 2018 with Madrid Declaration for the Health and the Advancement of Tobacco Regulation in Spain, where it was talked about, the measures included were the ones that we all know: the raise of taxes, the stand of smoke-free outdoor areas and indoor private areas like cars, plain packaging, cessation policies. It also addresses the advertisement and promotion in novelty products, the legal equalization of novelty products with burning tobacco, etc. All these measures were meant to stop the impact of tobacco industry on health mainly. Then in 2020, we have 2 meetings. When I say we, it means all the tobacco control organization, with the former Minister of Health, Salvador Illa, who promised to move forward into tobacco regulation, but then he also left the office to run for the Catalan elections. That was really a pity. Probably the worst thing that happened regarding tobacco control in Spain. And during the COVID pandemic, we pressured a lot at the national and regional governments to ban smoking in restaurants, terraces, as a measure to prevent coronavirus infection. Well, that was one of the excuses, since we wanted to go ahead with tobacco control initiatives. So we released the manifest to urge the Spanish government to declare the hospitality business smoke and vapor-free spaces, supported by 38 organizations. And we actually got that 7 local governments, communities, banned the smoke in terraces as a COVID measure, but unfortunately, since the Ministry of Health at the national level hasn't keep going with that policy, even though it was told that it was going to be done, this measure only remains in 2 of them. Well, in December 2020, we finally released the Tobacco and Game Declaration 2030, and for the first time, we talked about measures to stop the tobacco industry from doing business. And that's what it changed. And actually, we have released just last week a review text of the manifest of the declaration, and now we have also the support of the National Committee for Tobacco Prevention organization. So we are more supporting the document. So our endgame declaration is a roadmap with a main objective of making tobacco consumption disappear from Spain, Spanish society, by achieving a smoking prevalence rate of 5% or below by 2030 and a rate of 2% or below by 2040. To this end, the 62 signatories of this declaration urge the Spanish government to establish the foundations for the first smoke, nicotine, and tobacco-free generation and reach the end of the tobacco epidemic by 2030. So it's a call on the government to incorporate in a comprehensive tobacco control plan, the one that I already told you that is drafted, but it's not released, the short, medium, and long-term strategic elements that appears in the endgame declaration. So regarding the short-term measures proposed in the endgame declaration, it's obviously smoke-free areas, the expansion, to have more, especially outdoor, the terraces and public areas like outdoor shows, university campuses, outdoor transport, bus stops, beaches, swimming pools, entrance to buildings, residential buildings too. It's the first time that someone talked about this, and it's quite important. It's a growing problem. So regarding the new products, tobacco and nicotine, we asked for the legal equalization with burning tobacco at several levels with identical restrictions on consumption, marketing and limitation on advertisement, promotion and sponsorship, and obviously taxes. And not only in new products, we also asked for the raise of taxes in tobacco products, since Spain has one of the cheapest prices in Spain. Obviously, we require the plain packaging, and regarding the points of sales, we are demanding the elimination of the sale in vending machines, in hospitality business, in gas stations and convenience stores, and that it's only sell the tobacco and nicotine products in tobacco stores. It's important to check the age of all buyers. We have a lot of minors buying tobacco, and to obviously eliminate in the point of sales the tobacco advertisement and promotions, and that includes even the bottom of the vending machines. Regarding advertising and promotion, it is need to control, to be controlled in audiovisual and theatrical productions and through influencers in social networks. And obviously, there is a need of aid for tobacco consuming cessation. But now, let's go to the midterm measures, and this is where this is the game changer, the measures that will change the game in the sense that we demand that the industrial and professional transitions of the tobacco sector that what Ruth was talking about before, both in the distribution and of the agricultural sectors. In Spain, we are still growing tobacco and manufacturing it. So also, and this is very important, this is in the direction of New Zealand, the progressive abolition, I like to use this word, of the sale of tobacco by increasing each year the minimum legal age to buy tobacco for those born after 2007. So obviously there's also need for more public investment in research in both prevention and consumption of pathologies derived from exposure to smoke-free and tobacco use. When you get the slide, you can click on the link so you can go to the tobacco endgame. It's in Spanish and English. The English is the old version, but it has hardly changed. So this is how we see the endgame. We go from measures to denormalize, like smoke-free areas and the legal leveling of, to equally legally tobacco and new ways of consumption. Then we go to measures to make hard the access, like tax increase, plain packaging, and the eliminating of points of sales. And then there go we, industrial and professional reconversion of the tobacco sector, first tobacco-free generation, and endgame by 2030, like Finland, Denmark, Ireland, and UK. So let me walk you through what's the strength and weakness of the Spanish panorama regarding endgame. As a stress, we find social awareness and support has grown since the COVID pandemic regarding public health. There is a great consensus among the tobacco control movement. As I told you, 62 organizations have signed the endgame declaration. And there is a great determination to advance in terms of tobacco control by the team of the General Directorate of Public Health of the Ministry of Health and its smoking prevention unit. But we have weaknesses too, like the instability in the head of the Ministry of Health. We had 4 ministers in the last 4 years. There is a lack of political will and leadership towards the endgame strategy. We have very coward politicians more concerned about not taking steps that hinder their political ambitions than in safeguarding public health. And there has been a breach of the commitment of the Spanish government to review its anti-tobacco policy. But we have opportunities like the international context of new endgame policies such as in New Zealand and Finland, the European beating counter plan, the transposition of the European directive banning flavors in heated tobacco that could be used to introduce new measures. And that comprehensive tobacco control plan that I already told you about, that it has already been drafted and consensual by tobacco control stakeholders, but is still awaiting to be released by the health minister. And obviously we have the threat of the interference of the tobacco industry, all the aggressive campaigns by them in the media and social media to introduce tobacco, novel tobacco products in the market, the pressures from the Confederation of the Hospitality Sector, which act like front groups, we all know them, the pressure also from the Spanish agricultural sector, especially in Extremadura and Canary Island, another front group, and then the misinformation from RICS reduction from groups. There we have industry and all its allies. As a conclusion, let me tell you that in Spain, we're still far from implementing the endgame policy because although there is a great consensus among tobacco control stakeholders regarding the necessary measures that need to be taken to reach the endgame, we do not have politicians willing to implement it since they are more interested in their political ambitions. There are a few communities, and I'm talking about national level, okay? So therefore, we will need to get a push from Europe in the shape of a new directive, possible. And in that regard, we have registered the in the European Commission's a citizens' initiative named Call to Achieve a Tobacco-Free Environment and the First European Tobacco-Free Generation by 2030. Which address, among other things, the need to progressively abolish the sale of tobacco and nicotine products to citizens born since 2010 in order to achieve the first tobacco-free European generation. Regarding this initiative, we haven't started collecting the 1 million signatures we need. That will start in the end of January, beginning of February. We will have 12 months to reach this goal, and all European citizens can sign. So we will need the support of all of you to disseminate the initiative, and there you have a link that goes to European Commission webpage where you will find the details of the initiative, and when, as I told you, it will be ready to sign in the beginning of the year. Well, thank you very much, and I'll be there for your questions.
Thank you very much, Raquel. We really appreciate that you have summarized very well the situation in Spain, and we have a roadmap, a very good roadmap, but probably we have difficulties in implementing it. So we are lucky because we are in a table about how to be and work together towards the tobacco game, and we have here like one politician, two researchers, and one watchdog representative that they are working in the same field, but in the different, perspectives. So probably we can conduct the first part of the discussion by describing more or less what kind of things can we do in order to open the ears and the eyes of the politicians that, for example, in Georgia has been possible to implement this engagement strategy. You have said already that we need to be very persistent and drill and drill and drill and drill. We know already that. We have been doing that many years. But from your perspective and other perspective also of Hannah, that in Finland, they have been able to implement this in Finland and also in Georgia, and also Alan as a researcher, and our colleague from Spain. What do you think it's necessary to still doing in countries where we have the willing, some societies we have the willing, we have the knowledge, but it's very difficult to implement this at the political level and to move forward and implement these measures in order to reduce the burden of tobacco. So probably we can start here and you can start doing a discussion. I don't want that this is like a response. I would like to have a conversation with you guys.
Okay. It's a difficult question, I mean, in terms of how to engage politicians, I mean, and policymakers. You need to convince them that there is a gain. Yes, I mean, everybody knows it's a great population and public health gain if we achieve tobacco end game. But you need to convince them there is also personal political gain, because there are only few altruist politicians, and some of them, and the best case scenario is when you have a wonderful public health goal, and at the same time it might bring some political benefits to a person. And that's how the political champions are groomed. And that's how you can, because yes, I mean, you can have one or two Don Coyotes that are basically battling the windmills, but those kinds of politicians, unfortunately, are not the ones that make a major policy change. Or they can inspire, but they will not. You need some additional components. I think the first is, and it's through targeting, targeted communication, clearly showing that, for example, protecting the children. It's not about postponing or introducing some kind of plain packaging. It's about protecting the children. And it's about the future generations, your child, your grandchild, and the grandchild of your constituencies. So that's the idea. Try to convince them on that, and try to, through public debate, it's convince them positive, not shaming, but positive encouragement in terms of that. This is the way you can go ahead. That's one. The second, I would say that it should be delivered in a language understandable for politicians. And those research, I mean, there is notoriously problematic to translate research in policy. And one of the key barriers is really to delivering, yeah, policy briefs are fine, but you need even to go further and try to give them the message that they need in order to be able to translate that. And these messages might be like we did in Georgian Parliament. It was like on the level of the 8th grader. There were questions and answers about the most difficult questions about most, like, notorious myth promoted by the tobacco industry, and the answers and evidence presented in a language that is very plain and understandable, and with key messages that they can use then and convert in political messaging within their own party or somewhere else. And third, of course, I mean, yes, if those politicians change frequently, and that's the key problem usually, because institutional memory is fine, but once one politician leaves the arena, then it's difficult to groom the new one. So that's where persistence comes in. You need to identify again and again in new generation, new parliament, in new parties, the ones that will be there. That's, I think, the part of the work that the advocacy coalitions can do. Thank you, over.
Thank you very much, because you have said very important things. I mean, we already knew that it is important that introduce this in the agenda, and the fact of having people who are interested is important, but it's also important to convey our message in an understandable way, because sometimes we don't do that properly. So thank you very much for the contribution, but also I would like to ask you, probably to the rest also, that now that we are facing with new tobacco products, I mean, the things are getting much more difficult. So I don't know what is the situation, for example, in terms of research that you are using this, your research guys in tobacco control, like saying that this business, the tobacco industry business, is continuing because many people probably are quitting smoking, like normal cigarettes or combustible cigarettes, but this a new epidemic about new products. So can you share your research or your...
So I'll try and be brave here and try and answer both of the questions in one there, in terms of the first question around kind of policy impact and how to achieve that, and also then the point there in terms of the new products. And I think I'll answer it a little bit, being a bit cheeky and perhaps disagreeing with the premise of the first question. I think you said something along the lines of, we know enough already, so how do we make it happen in countries? But I think there are various ways in which we don't yet know enough, and I think that applies both to end-game policy measures, but also with regards to, again, we're still investigating the harm of these products. We don't have enough independent evidence, certainly in relation to heated tobacco products at all. So I think there's a real need still to be building that evidence base in terms of doing that in the end game. I think Ruth's presentation touched a lot on how that's starting to happen. So we are now starting to see, she called it kind of low-hanging fruit, but we are now starting to see places where we're in a position to be able to introduce policies doing so. And I think that's really useful for policymakers, because then if those are effective, that's the model that can then be sold to other countries as well. And I think in that front, what's really important is that those policies work, I think. So in terms of it, Ruth spoke a bit about denicotinization, for instance, in New Zealand, and I think that's a really interesting concept. But there's also then questions around that in terms of to what levels, what level of nicotine is the perfect amount to achieve the progress that we want. And these type of questions, I don't think we have answers to yet. And I think it's the same in terms of kind of some of the newer products that we're seeing. So that's one step, is continuing with the research so we can have those answers. And then I think there's also the point that was being raised in terms of then giving that to policymakers in the right way. And even policy briefs can be just not the right way to do that. And we try and think of different ways of doing that in terms of just, we have a website, Tobacco Tactics, and that's, can just be a paragraph or two on an organization, which, someone can just Google and then it gives them that information that they need to make informed decisions. So I definitely think that's important. And then there's also a point where I think in terms of policy windows as well, and really thinking in advance in terms of outputs and how to tie them into specific policy instances, because as it was mentioned, policy turnovers are very fast, and you can build up connections with people over a number of years, and then those people aren't in government anymore, and you have to start from scratch. So it's really about predicting those moments when it's not just about getting information, it's ensuring that information can actually have a policy impact. So I think that's kind of the main thing I'd say. I'm happy to speak more in terms of the views on kind of different products, but I think my presentation spoke a lot in terms of not viewing the industry as trustworthy when it comes to working towards ending tobacco. Philip Morris continues to be selling more combustible products than any other company, but is also most active in terms of these narratives and arguments around working toward the smoke-free world. So I think it's definitely an inherent contradiction there.
Thank you, Alan. I don't know if you, Hannah and Raquel, you want to add something at this regard? Okay, go.
Thank you. Yeah, very, very good, important points already raised here by the previous panelists. If I say a little bit also regards how to get these things to the policy agenda and moving things forward, I think the timing is also key there. Making this information easily available, making these proposals easily available. For instance, in Finland, the working groups work so, or their schedule is so that, for instance, we will be having elections next year. So now that this working group leaves its report in January, there's a set of proposals ready for the next government to start working with. So it's also making this easy to actually keep it on the agenda and move the proposal forward, and not to sort of go into the period where the new government is like starting from scratch. But they have a set of clearly defined and well also evidence-based proposals to work with from the beginning. So that's also to add on that, to making this more easy for the policymakers. And also I think in the policy, or in the tobacco endgame, it's also very important to remember that it's like it won't ever be one size fits all. So all the countries need to find their own ways for it. For some countries, it's really about moving forward the basic FCTC measures, the requirements and the recommendations. But for some, it's already going much more forward and addressing a broader scope of the product. So I think that's also very important to also communicate to the politicians. So they don't need to go to the really high-end goals and really tight timelines and so forth, but really find the ways that work in their own country. And then with regards to evidence, I think Alan already mentioned most of the things that I also wanted to say with regards, but I would also say that the importance of the national regular monitoring and also trying to promote the national evidence and the national research, for instance, on the costs to the country, to the society, because I think politicians are also very interested what is the situation in our country, and not so much interested in listening to what happens in other countries. So that's also very important in terms of getting the messages through. And then I think also in relation to this science and evidence that is being now heavily produced by the industry itself. In that regards, the Article 5.3 preventing the industry interference, having strong measures in place, I think that's also very important in order to actually fight these industry-produced evidence and their arguments. So I think that's also one point there. But these were my points to add to the previous ones.
Yes, excellent. So Raquel, one question about your experience, I mean, about the endgame, and I would like that you answer the question and you comment your experience, but also, do you think that in Spain we have started late? Have we started this movement a bit late in comparison with our colleagues here?
Yeah, we are late comparing with them. We are farther than them in the way, but we still can achieve it later on, but we will. But I think that one of the main problems we have is, or one of the goals we have to achieve is we need a bigger army. We are just in the health field, but we need allies. We need to get the media in our side. We need to get another movements in our side. We have to reach environmental movements like Fridays for the Future. They are the keys. We need them on our side. So we have to approach them and go all together to talk to politicians. This is one of the things that we have been doing a lot lately, in the sense we have been talking to politicians a lot through letters and sending things, maybe online. We need to start again to see them in the same table, because the message doesn't reach the same way if you sit together. Unfortunately, in some cases, it's impossible because they don't open it's very sad. They open the door to the industry, but they don't open the door to us. For example, our health minister, we have been asking her for the last 2 years to meet her, and no response from her side. So this is, and obviously we need more resources. I mean, and I'm talking about the advocacy point of view. The data you researchers provide us is really, really important for us to do our advocacy work. But most of the times, all the work we do in advocacy, most of the time means 99% of the time, it's not paid work. So that means there are no people enough willing to be doing a full-time job and not being paid for it. So that's also one of the main problems we do have. Anyhow, we are still here. We'll keep keep being here, and we really need to think in reaching other parts of society to support us in the fight, and to convince politicians to think differently.
Thank you, Raquel. I think that we have some questions from the audience, but it's clear that we need more evidence, more research, communicate better, to be persistent, more money. So these are the things that we lack. Probably during this day-to-day, we can discover how to get these things, because they are really important. But we have some questions from the audience, no?
Indeed, Chris. Esteva and the organizing team here at ICO will be very pleased that we already had a peak of 15 countries connecting in the live streaming. Wow. There are many congratulations already to the Georgia and the England, UK stories. And there are 2 questions that I selected. Especially also, many people ask about the slides. I remind that the slides in PDF will be available at ICO-WHO Symposia.net. There are 2 questions that I selected. One is to Dr. Hanna Olila. It's from Manfred Neuberger, and he's asking, did you use cotinine, at least in a subsample, to validate your finished results of reductions in prevalence of smoking and vaping?
Well, for the prevalence, this regular monitoring, we do not have these biomarker samples. But of course, in some of the studies that have been conducted, where it's possible to also collect the cotinine samples. Of course, I think there has been some underreporting, but it's not like huge. But I think the overall challenge with these population surveys and this is the response rates. Of course, we would need to also have much better monitoring and other resource tools. And we have also been now making some proposals to actually start utilizing more of the actual industry data. We are a little bit behind in utilizing that, so that we would be able to actually have more better, how would I say, more the actual sales data to be utilized in more comprehensive ways. But also regarding this cotinine, I think we've also had very interesting proposal to actually include that to our wastewater surveillance, which is run by our institute, and it has been utilized to follow the prevalence of illicit drug use. And it would be possible to also collect cotinine in that. So that's actually being now discussed in Finland, whether we would use that to strengthen and provide more comprehensive picture of the population level nicotine use.
Thank you. And the second question is to Alan. It is again from Sean Semple, and he's saying that in the UK, we regularly have survey questions testing opinion from the population. He's saying, is one way to engage policymakers and politicians to track this public opinion on tobacco because they also vote for that?
Yeah, I think that's a great point, and it's something that STOP has thought about in terms of not just ensuring that the kind of research our research group produces is kind of solutions focused, but also that it's engaging with that question in terms of norm shaping and not just appealing to policymakers, but as I said in my presentation, appealing to the wider public too. So I think there is definitely more of a need for that. I will say though that there is also an inherent risk with it, because it's essentially what the industry do to make up for the fact that they don't necessarily have that independent evidence base. So instead they will do kind of questionnaires that are very wordy to give the answers that they want, and then try and create this impression that public opinion is on their side. So I think absolutely we should be looking to do it, but it's a question of making sure we do it in a way that shows how we're taking it, a more balanced methodology than say the industry do when they do questionnaires like that.
Thank you. Chris, no more questions.
Yes, so we are going to end the table because we have the rest of the day. I want to congratulate and thank the panelists because they were like very in the point. They were like giving their responses very well in the point, and they were sharp, and they also gave us ideas in how to improve in our way to moving forward to the tobacco game. Thank you for your presentations, and we continue the sessions, okay?
Thank you. Thank you very much.
Thank you.
Do we have
Tenemos 2 minutos.
¿Tenemos 2 minutos ahora?
Siempre hizo el baño.
Venga, corre, corre. Tienes que salir a la vuelta por allá.
Es muy lejos.
Pero más rápido, más rápido. No es aquí.
As an announcement to those that are following us online, we have had like 3 minutes for logistic reasons, but we are going to retake the session in 3 minutes, okay?
start. To Esteve and the organizers for this excellent symposium. First of all, thank you very much for the title of the symposium. I think to talk about the name, From Tobacco Control to Tobacco and Game, is really a big success. I think it's very important to talk about this. But also, thank you very, very much for the title of this second session, that for me is essential. It's very, very important. Tobacco control policies, taking stock, and next step. I think really it's time to take stock, to stop, to see what have we been doing till now, what have been our successes, our failures, what have we been doing, and how can we shift from here to the tobacco and game. It's very, very important. It's really essential, and I think it has been a very, very good election. We have also a fantastic group of speakers today. I think it's excellent. The opportunity is very, very good, and we could share with them some thoughts. We will hear them, and after I think we have the opportunity to discuss and to express our concerns, our thoughts. I will do as Cristina, that is an excellent moderator before me, and I introduce first the first speaker. I will give the floor, and after the second, and after the third, and after I think we have some time for hearing the questions from the people in streaming, and also the questions from you in the room. So please be thinking what do you want to ask them. Well, Adriana Blanco Marquizo is the head of the Secretariat of the WHO Framework Convention on Tobacco Control since March 2020. She's a medical doctor with a master's degree in policies to prevent addictions in children and adolescents from the Latin American Center of Human Economy. Over the past 2 decades, Dr. Blanco Marquizo has worked in the region of the Americas, supporting tobacco control activities in many countries of the region, including her home country, Uruguay. And before joining the Convention Secretariat, Dr. Blanco worked at the Pan American Health Organization as Tobacco Control Regional Advisor, and later as Chief of the Risk Factors and Nutrition Unit in the Department of Non-Communicable Diseases and Mental Health. So, Adriana, the floor is yours. Thank you.
Okay, well, thank you very much. Let's see if I can find my slide. No, because I touched something. Impossible that I can do that by myself. Well, thank you very much for inviting me to be here. Again, as I said before, it's very important for me. Okay, can I screw something else? Okay, thank you. Well, so let's again, thank you for allowing me to be here. I think it's very important to this discussion, very pertinent, and especially representing the one international treaty that has many obligations for countries. For me, it's very interesting to discuss, okay, what Ruth has been saying before, okay, what is tobacco control, what is endgame, and I think that we are in the path to do that. So just a reminder, and I know that probably everybody here knows very well about the contents of the Framework Convention on Tobacco Control, but still we have these measures on the side of the reduction of the size of the demand and measures relating to the supply. And usually the demand ones has been the one more implemented, basically probably because we also have the support of WHO in this with the Empower package that they developed as an entry point for the implementation of the FCTC, but we need to remember that the FCTC need to be implemented in its entirety in order to have the synergistic effect that one measure has with the other. But really, in the area of supply reduction, it still is one of the places where we have more work to do. So this convention has 182 parties, that means 181 countries, and the European Union, okay? And that covers approximately 90% of the world population. So we have had 18 years the treaty into force, so we are happy, no? Mm-hmm. Cover all the world. These 18 years, we are very, very happy. No, we are not that happy, okay? Because why? Because of this. One thing is to have parties, another thing is parties implementing their obligations under the convention. And unfortunately, if we can play, and I discussed with my colleague, Dr. Perua, if what is the half is half empty or half full.
And we can take one of the, either of the position and be very happy because we are far from where we were when this began. But still, in the half empty part, we need to be really clear about how much we need to do. Because if you see, these are usually the most implemented measures. And I put here, let's say, the percentage of the parties that have implemented all the key measures of each one of the articles, okay? Because sometimes parties reported that they have been working in an article, but they have not implemented the article at the fullest with all the measures. For example, when we talk about Article 6, we are showing here only those countries that has a percentage of the total taxes that is about equal or more than 75% of the total retail price. That is the benchmark that WHO has developed. And I'm sorry, I'm going to take out the mask because I don't want to drop because I faint because of lack of respiration, but I am not really being very easily for me to breathe with the mask. Sorry for that. But then when we look at Article 8, for example, smoke-free environments, okay, and this is data that is provided by the parties. This is part of our global report, our last one of 2021. And we see that when we combine, while we see that 88% of the parties respond that they have been working in some measures of Article 8, when we go to see and we put all the measures, you ban smoking in hospitals, education, universities, bars, restaurants, indoor offices, when we combine all together, we see that scarcely at 32% of the parties are implementing the whole measure. So there is still a lot of things to do. And I like to talk about the end game policy as a marathon, or even perhaps an ultra marathon, okay? So I'm a runner, I want to run, and I want to run an ultra marathon. Can I run the ultra marathon today if I have not been training? Well, probably not. Probably I'm not going to succeed in the ultra marathon if from being a couch potato, like it's me today, like being a couch potatoes, I wanted to become an ultra marathon runner, okay? So no, we need to prepare. And I agree with Dr. Malone, of course, because she is the pioneer in this area, that one thing is tobacco control and other thing is endgame. I look it more like, let's say, a continuum, okay? And you need really together, when you are thinking to your goal, that is the ultra marathon, you still need to prepare for your first 5K, to your first marathon, because if not, it will be very difficult to run the ultra marathon in just one go, okay? So let's think about a process, and let's think what things need to be in place before we are, let's say, full in capacity of really running the ultramarathon. So we have no problem from the point of view of the Framework Convention on Tobacco Control. Things are okay. We have a door of opportunity here for going beyond, because we need to think. The whole treaty began to be discussed many, many years ago. We say it was before the end of the last century that the discussions begin to take place, and the treaty was adopted in 2003. That means that it was laying on research and on evidence that was before that. So now they were very, very clever, the people who drafted the convention, in leaving a window of opportunity for the changes that inevitable will be as the implementation and as the reality evolves. So we have Article 2.1 that says that, what is it there? That to better protect human health, parties are encouraged to implement measures beyond those required by the convention and these protocols, okay? So something that is aligned with public health, that goes beyond what is written in the convention, it's okay. And I think this is the case for the endgame. So there is nothing that says, oh, no, we need to follow the FSTC or the endgame solution. No, this is part of what you need to do for the implementation of the convention. And we have a second treaty, because don't forget that we as a secretariat, we are the secretariat of two treaties, no? We have the protocol that was created building on Article 15 of the FCTC, that needs to be implemented. It only has 66 parties in this moment. It's a much newer treaty because it entered into force in 2018. But this is very important because some people say, okay, now, but I'm in health, okay? I care about the convention. The protocol is another thing. No, because if you want to protect the integrity of the convention, you need to have also a view on the protocol side. Because usually this is what the tobacco industry used to undermine the protocol, and it's also what it used to tell you, oh, no, don't do the proven measures, for example, increasing taxes, because you're going to have illicit trade. They know, because they are behind the illicit trade, so they know what they're talking to, but we need to implement also. So I really call for those parties to the FCTC that are still not parties to the protocol to accede, ratify, or adhere, whatever is the figure that they need to do, to use this. Because when we talk about the criminal offenses, and that is part what Dr. Gallagher was talking in his presentation, sometimes it's easier to get in the criminal part following them when they work in this part of the illicit trade than in the common things that they do in the everyday lobbying activities. So, also not only we have lower number of parties for the protocol, but also the main articles are very, very low in implementation. And these are numbers of people who have, parties that have initiating the system. Because really, for example, tracking and tracing system, that is the core of the protocol, really are only well developed in some countries and not necessarily following all the requirements of Article 8 of the protocol. So, let's think a little bit when we try to think about the endgames strategy. For sure, and as has been said before, this is not a one-size-fits-all situation because not all the countries are in the same situation. And of course, disclaiming my conflict of interest with the convention, who I head, of course, is not an either-or. Okay, it's not either I implement the FCTC or I implement endgame. We need to implement the FCTC while thinking about extra measures from the endgame. Because the situation, how are you going to get the support that you need to do some more extreme measures, let's say, that implies the endgame, if you have not the minimum? How are you going to talk about, let's say, banning the sale of cigarettes if you can smoke in the hospital, in the schools, the advertising is everywhere? So you need to prepare the environment, and that was part of what Ruth was saying. And if you see the countries that are leading the endgame strategies are countries that have implemented the FCTC in a very high level. So you need to think. You need to think about your capacity of enforcement, because some measures that can be going very well in a country with a good capacity of enforcement, perhaps in your country, they are not going to happen. And really making promises that you cannot keep will backfire on you in tobacco control, because the industry will say, you see, they are unrealistic. They try to show us something that they cannot even make it happen, okay? So the other thing we need to consider inequalities, because also endgame can developed countries need to think that even if they go to endgame, the rest of the world is not going to endgame necessarily at the same point. It will be a transition, a stepwise approach, okay? So don't forget the rest of the world, and we need to still keep supporting and putting money in the development area of funding in order to help the countries that are lying behind in order to approach the situation of being able to come into an endgame situation. Of course, there are you need to be prepared to counteract a lot of, let's say, myths or things that the tobacco industry will throw. Of course, always there's a human right. You are depriving a full generation of the right to be addicted to nicotine, okay? But, okay, right, that theoretically for the tobacco industry, not a human right, of course. The nanny state, the country will tell the people what to do. Yes, well, the country must tell the people what to do, what is health, what is in the how we say in English, what is at stakes, okay? It will be a dereliction of duty if they don't do what they need to do, okay? So, challenges, of course, we are not talking, new products are a challenge, okay? And we in the Secretariat, more than any place, we know that we are facing, and probably soon we are going to have, parties need to have a big discussion on what is the way forward. Okay, tobacco industry has been, is, will be always the worst problem that we have. And when we work, and that is a word of caution that I would like, when we're talking about the end games strategy, be very careful on not being co-opted and taken out of context by the tobacco industry or the people who work to further the interest to see, we are aligned, you see? They want to stop combustible cigarettes, okay, we too. Okay, we are in the same game. No, we are not. Okay, so we need to be very clear that we are not in the same game. Okay, so lately I think that I still recommend that you need to strengthen the implementation of the FCTC together when you think to make end-game strategies. Consider being party of the protocol and strengthen the implementation of the protocol. Consider very carefully the options for your country, in your reality, with your capacities, okay? And remember, Article 5.3 is still one of the main and unfortunately not well implemented articles of the treaty. So that is all. Thank you very much. I forget to put thank you, you see, but thank you, I'm telling you, okay? So thank you very much.
Thank you very much, Adriana. Well, let me introduce the second speaker. Hebe Guda is a project officer in the Tobacco-Free Initiative Department of Health Promotion at the WHO headquarters in Geneva, where she has led the WHO report on the global tobacco epidemic since 2017. She has over 2 decades of experience in global public health policy and epidemiological research and capacity building in Papua New Guinea, Indonesia, and Egypt. She has a master's in public health and PhD in epidemiology from the University of Cambridge and is an adjunct associate professor at the University of Queensland in Australia. The floor is yours.
Thank you, and thank you everyone for having me here. I'm not sure why the title hasn't shown up, but that does say global progress on Empower and tobacco use. Have we reached the end game? Oh, here it comes. Okay. Right. So I don't obviously have to go into the Framework Convention on Tobacco Control. This was, to follow Adriana is always a difficult one. But this is obviously I have come to tobacco control quite recently after a career in global health, and coming to tobacco control from global health, you come to realize just how strong a position tobacco is in. And this is something I think needs to be emphasized in terms of, we are in a very powerful position in terms of making change and seeing progress in the world. So that cannot be ignored. I do not have to introduce Empower either to this audience, I'm sure. As you know, it's based upon the demand reduction measures from the WHO FCTC. But in case, sorry, do I need to be closer? Okay. Oh, yes. Yeah? Is that okay? Okay. Yes, but for those who need perhaps refreshing on the acronym, M is for monitoring the use of tobacco and the prevention policies. P is for protecting people from tobacco smoke, that is smoke-free environments. O is to offer help to quit tobacco use, cessation programs. W to warn, that is on the dangers of tobacco, which is the packaging largely and mass media campaigns. E is taps bans, and R is to raise tobacco taxes. We publish the WHO report on the global tobacco epidemic every 2 years. Our last one came out last year. We focused on new and emerging products. And the next one will come out in 2023 in July. And so this report monitors Empower progress globally. So do you want to know the good news or the bad news? Well, first, the good news. Since 2007, we've seen incredible progress in terms of Empower coverage. So in this graph, you can see the number of countries and the population covered in terms of at least one Empower measure at the highest level of achievement. And when we say highest level of achievement, we mean that the policy covers a certain set of criteria. So for example, smoke-free environments, those are the venues that Adriana mentioned earlier, bars, restaurants, hospitals, educational facilities, etc. So if they've covered all 8 that we consider important and meeting best practice levels, then they get the highest level of achievement. So 5.3 billion people are now covered by at least one of the Empower measures at the highest level of achievement, and that's up from 1.1 billion in 2007. So amazing progress. I really like this figure, which is 4.4 billion people are now covered by at least two. And also mentioned by Adriana is the importance of the synergy of the policies working together. So we're seeing more and more countries picking up more than one measure at the same time at the highest level of achievement, which means we can perhaps see more progress in terms of tobacco use. Here you can see a little bit more of a nuance here. So by measure, you can see the highest level of achievement in dark blue, and then those countries that have reached perhaps, reached 80% of the criteria will be in lighter blue, and etc. to the grays, which means that they do not have this policy in place. So as you can see, there's a big range across the measures with packaging, not plain packaging, with graphic health warnings on packaging showing some very reasonable progress over the years. But you can also see that there's been a lot of work in terms of, let's say, cessation programs, maybe not reaching the highest level of achievement, maybe missing one or two criteria, but there is a lot of countries that have progress. In this graph, you can see that progress over from the 2007 starting point to the 2020 data that I'm presenting here. And again, quite obvious is that graphic health warnings are really making a big difference in terms of making progress on the global scale. The monitoring is also looking good here, but there are some caveats here. Of course, monitoring can change over time. If a country doesn't conduct a survey, they will fall back. And in this case, we also gave a little bit of lenience given that it was COVID, and we allowed countries a little bit extra time to make up for the lack of surveys or survey reports. I haven't shown it here, but it's also important to note that low and middle income countries and low income countries are also really holding their own across Empower. The progress is very notable. And even outdoing high income countries in some cases, for example, TAPS bans. But progress has been incremental. Here you can see that those countries that started off at the highest level of achievement in dark blue, and how many of them have made it to the highest level of achievement in lighter blue, and how many countries have done something since 2007 in green. Okay, so they've done something, they might not have reached the highest level. So what I really want to emphasize here is this lovely quote by Baudelaire, which is, "Nothing can be done except little by little." So there is progress, but it's, we really work on those highest level of achievement countries. We're really proud of them. But we also really need to recognize that all of this takes time and it takes step-by-step progress. But perhaps in some cases, sometimes we're moving a bit too slow. So this is the progress we can see from the 2018 data that we collected and published in 2019 and the 2020 data. So as you can see, not much progress going on over that 2-year time span. And you can see over time that things sort of have steadied off depending on major moves, directives, for EU directives, of course, push our numbers up, and that's, you can see that over time. But here you can see that obviously with regard to smoke-free environments, cessation, advertising bans, and tax were a really slow couple of years, perhaps expected given also that we were covering a period of time in COVID, that covered COVID. And again, really important to point out that 49 countries have no Empower measures at the highest level of achievement completely. So that's a lot of unprotected people. So trends in prevalence. Here you can see the number of the countries all scattered across this graph, where on the right-hand side are those countries that are on track to reach the 2025 target of a 30% reduction, relative reduction in tobacco use. So we were very pleased to find out quite recently that about 60 countries are in this group now. But it is also really important to note that some of those countries, those in pink here, don't have particularly reliable data. So we'll have to see how that trends out. On the far left, you see countries that are where the prevalence is expected to increase. So again, this is not good news. There are still countries going up, including my own country, Egypt, is in this group. Overall, though, we're seeing males and females are reducing globally. Fantastic news. But if we look at numbers, and again, this is of course related to the fact that some populations are growing, the number of smokers can also be growing in some contexts, right? And so you can see here that we've got reduction in numbers overall, but because some countries are increasing, some regions will also show increase in numbers. So this is our number of male tobacco users on the decline overall. As you can see, that was on the increase up until about 2020, and now we're seeing some reductions. The only two regions that are going down in numbers are the AMRO region, the PAHO region, and Euro. All the rest are actually increasing in numbers, in males. Given the audience, I thought I'd give you a little bit of a closer look at Euro. As you can see, Euro is doing well compared to the global average in terms of policy development. Males are going down at the steady state like global reductions. Female reduction, however, is not going down as quickly as the global reduction in female tobacco use. Quite worrying. You can see at the bottom, it might not be too clear to you, but the power, minus M, the power progress. Again, dark blue is highest level, and the lighter blue are where there's been incremental change. And you can see W has made huge progress in Euro, largely because of EU directive. That's what we need now for P and E as well, because there has not been sufficient progress in those two areas, and it's something that can be achieved with the EU directive. And just so that we recognize that there's more granular issues here. These are the countries where you see rates and numbers increasing. That's the worst case scenario for males and for females. And the bottom of the table are those where rates are decreasing but numbers are still increasing. So you can see Euro here is one of our biggest concerns are the females. And we really need to take some stock of that. So I don't need to go into this either. We've heard so much about new and emerging challenges, in particular with regards to ENDS products, e-cigarettes, etc., and the problems of the industry involvement in this area. I will present, however, some data from 2020 again, which shows just the lack of regulation that we are currently facing. So 84 countries, which is 27% of the world's population, have no regulations in place at all for e-cigarettes. 1/3 of countries applied no excise taxes on e-cigarettes, and only 3 countries tax e-liquid at the recommended rate. Looking across income groups, you can see that actually there's quite an equal amount of countries in each of the income groups that have chosen to ban e-cigarettes. But the gray in the low income group shows you just how little regulation there is in terms of providing any other kind of graphic health warnings, prohibiting the use indoors, etc. Minimum age of restrictions, etc., are not applied across those sort of gray zones. So you can see low-income countries have the least regulation. Looking a little bit closer at those specific policies, this is a slightly difficult one to interpret, but if you look at the lightest blue, those are countries that have tobacco control laws, but do not include e-cigarettes in them. And then the darker blues have either some or full coverage of e-cigarette restrictions. But the point being, all the lightest blue and the gray have no e-cigarette regulations. And again, I do not need to point out the particular danger of e-cigarettes being targeted to youth. We know that the flavorings are an issue, and that they are used to target young people. Only 3, at the time of this data collection, which was 2020, only 3 countries had adopted a ban on all flavors on e-cigarettes, and 6 other countries had some selected flavor bans. And only 69 countries had a minimum age of sale for purchase of e-cigarettes, compared to 90-something for tobacco. So our take-homes, oh my, that doesn't show up very well. Sorry. So our conclusions are that there is a lot of progress, both partial and complete, that we can all springboard from, but from a global perspective, we're far from the end. There is so much to do to achieve our goals of Empower coverage and the WHO FCTC implementation. So the game must go on, end game. It's not stagnant, but it's not fast in terms of progress. There has been a lot of work, and we can see that in the global trends of tobacco use reductions, which is wonderful. But there is a huge cautionary note here, which is that, in particular when it comes to how the industry can undermine progress and where we're going in terms of protecting what has been already achieved in order to start to really see the vision of the end game and what that really means in terms of all these various factors. Oh, it does show up. Okay. There you go. Yeah. So I'll give you that. And so yes, and finally the steps. And incremental steps are good steps, I think is ultimately the message here. We've been making those incremental steps, that we're going somewhere, and we need to continue. So the end game is not game over for what we are, our approach, our strategies. We need to stay focused on the WHO FCTC implementation and Empower adoption and the work that we do with countries in order to help strengthen those. We must be careful of the carve-outs that are being enacted and prevent any carve-outs for the new and emerging products and all the complications that come with that. We really want to invest more in sort of more innovative approaches, including, for example, digital cessation aids. And we do see an important role in engaging closer with fiscal, the finance sector, et cetera, in order to really push, of course, fiscal policies and ensure that there is support for them, but also to better engage policymakers on the economic costs and benefits, costs of tobacco use and the benefits of tobacco control, of course, which we think is a very important aspect of gaining further political support. And I'll end there. Thank you very much.
Thank you very much, Hebe. And now we give the floor to Konstantin. Konstantin Bardavas is a medical epidemiologist with specific postgraduate training at an MPH, PhD, and postdoc level on tobacco product regulation and science. He has been the principal investigator or co-investigator on a number of tobacco regulatory grants in the European level. And he's currently the head of the technical group responsible for the assessment of tobacco product flavors for the European Commission. He is an internationally recognized expert on the role of ingredients, electronic reporting of tobacco products, and their association with adverse health outcomes. So, there's the floor.
Thank you very much. I'd like to thank you for the very warm welcome and the speakers before me, and thank you, Esteva, for your invitation to join. Dear friends, dear colleagues, so what I want to try and do in a very difficult position of being the last speaker before the lunch break, so I'll try and keep it, of course, to time, but also try and liven up as much as possible. I want to focus on the new challenges that we're going to see in Europe in late 2022 and 2023. What are the hot topics that we've been working on and the hot topics that we're expecting? I have no conflicts of interest to declare. I'm stressing that all positions are personal because I'm also the head of the technical group for the assessment of tobacco product flavors for the European Commission, and the contents and interpretation of these slides is my own. It cannot necessarily reflect the views of the European Commission. I have to state that. So, what are the new challenges in 2022, 2023? Let me go through a bit of an overview of what we'll be seeing. So, I've been using a lot of a parallelism between the epidemic and tobacco epidemic and COVID-19 epidemic, except that we've been doing this parallelism since 2015, before the COVID epidemic. So is it possible, and we first discussed this with another exceptional colleague, Israel Agaku, on are we looking at a different virus, a different epidemiology for nicotine-containing products. Now, this slide has been prepared in 2015, and on purpose I put it up there to show that whether we keep COVID coming into us as a thought, we should use that in sort of like parallelism for tobacco control. So nicotine-containing products have evolved over the past years and are continuously evolving with different subcategories. Just think of it like COVID. Different epidemiology, different high-risk groups, different modes of transition, different, for this case, risks or benefits, infectivity, and different routes of contagion. So think of that as an infectious disease more than anything else. Of course, tobacco product design, its constituents, these have been evolving, most likely and predominantly due to the industry responses of perceived either health, social, or regulatory concerns, and also other practical industry concerns of their better understanding of nicotine dosing, the complex chemistry of nicotine, and of course development of flavor niches, which is one of the aspects I want to talk about today. For instance, this is data using the EU SEG, which I'll talk about a lot, which is the European Union Common Integrate data, which means the tobacco industry submits their information to the European Union member states, and then they have it in a parking space at the European Commission. This is an analysis of what it looks like, not the flavor part, the tobacco part. So for instance, when we talk about the tobacco in a cigarette, we have not only the leaf, the inner circle, the reconstituted tobacco, the cut stems, expanded tobacco, but then each subgroup has a further subgroup, whether it's Virginia Oriental Burley, is it flue cured, air cured, sun cured. Now this is all the complexity of just the quotation, natural parts. What about all the additives? So this is the biggest aspect of the evolution of the actual product itself. Of course, the association between youth perceptions and reduced harm and product design is very clear. Menthol cigarettes, flavors such as spicy and fruity, shapes, sizes, whether it's organic, whether it's marketed as additive-free. These are all aspects that are related to product design, but of course to the youth perception of reduced harm or not, which means one leads to the other. Indeed, there is this cascade, as we discussed previously, of the difference between product design leading to product disease, as we say in clinical practice, the phenotype at the end. So the tobacco product brand, it has its own type, as I mentioned, its blends, its physical properties, its additives, its flavors, in other words, emissions, the topography of the user, the puffing topography, of course, all that together with the marketing, sales, the pricing, the taxation, the illicit trade, and all that leads to, at the end, if you take it down the very tight rope of tobacco use, to the disease phenotype and severity. Of course, as regulators, the regulators can intervene, and as scientists, we must provide the evidence for the regulators to be able to have the evidence to intervene, either the population use, at the brand use, or at the tobacco product itself. So this product design and the additives, predominantly additives, they're a primary industry tool for these innovations, this evolution, which may, though, undermine severely the public health programs and support tobacco use and dependence. So what are the two main challenges for 2022 and 2023 in Europe? It's heated tobacco products and what's going to happen with them, and tobacco product flavors. So let's look first at regulating tobacco product flavors in the EU. Now, the EU Tobacco Products Directive is an exceptional framework. It's a roadmap. It's an activity plan of what to be done at the European member state level to be able to regulate tobacco products. And it stipulates and says that cigarettes and roll-your-own tobacco are not allowed to have a characterizing flavor. Question is, what is a characterizing flavor? So a characterizing flavor, in quotations, is a clearly noticeable smell or taste other than that of tobacco. So, in a long story short, we have a technical group that's been set up to use a combination of smelling and chemical analysis to assess what are the flavors in cigarettes and roll-your-own tobacco across Europe. So, one of the first activities we had to do before I just talk about the panel is we had to first separate the panelists, the training on what are the attributes. So we have an exceptionally trained panel of between 30, 35 experts that can identify, as I said, I think over yesterday, 50 different aromas, 50, 51, 52, depending on the type of product, and 10 different concentrations by themselves individually and together. So these are noses. The human nose is exceptional. It's exceptional, the human nose. So we're using the smelling properties of tobacco to be able to do, as you'd go to an espresso bar and have the sommeliers of coffee or the sommeliers of wine, we have the sommeliers of tobacco products. So these are smelt, and they can actually provide a complete profile. I'll provide an example. So there's some odors that, of attributes that may potentially originate from tobacco, such as the peppers, the sweet corn, the smoky, the burnt coffee, prunes, raisin. These are all the things that can come from the tobacco aspect of the product. Not that they cannot also be added. But there are also other odor attributes that we've trained our panelists on, like fruity odor attributes, artificial apple, artificial cherry, banana, coconut, grape, green banana, mango, orange lemonade, lots of flavors, mint flavors, 4 different mint flavors, sweet attributes, confectionery odor attributes, butter, candy floss, marzipan, spicy, and floral. So all of those, these are the different Lego bricks, as I say, Lego bricks of being able to create what is a flavor profile. So these then, when a member state says that we think we have a product that is flavored, it goes to the independent advisory panel. The independent advisory panel gives us the green light to do the testing, and we start in testing. So each sample of a tobacco product is evaluated using a 0 to 10 point scale with 12 assessors, 3 replicates, 36 identical samples, decoy references. There's a whole methodological aspect that's publicly available and can be downloaded. So what happens? We have the end comes up to something like this. It's a spider chart that shows the different flavors. If you look towards this area here, it's the mango-y here, there's orange lemon, peach, prune notes. Anything above a 1 means it's noticeable, and then each time you have a magnitude, each time you increase by a 1 to a 2, you're jumping in a magnitude of concentration. So they're able to identify what a product looks like. So a flavored product, for instance, this is an example of a real flavored product that has gone through the regulatory process. In the top 10 attributes, there's artificial apple, mango, peach, grape, orange, lemonine, and raspberry. So all these indicate in the top 10 flavors out of the 51 assessed here that they are most likely not originating from the actual tobacco plant. So they are additives. But of course, what you need to do is that when we go and perceive something and we say that I'm going to have a chocolate with strawberry, this is lovely in Greece, a candy bar that's chocolate and strawberry together, and it smells very classical childhood chocolate, for instance. When you smell it, you know, okay, that has a composition of strawberry and chocolate. Of course, what happens is the same thing happens with tobacco. So what we do is the next step is called rank rating. So for the purpose of determining if it is actually a composite, then we look together and we sort of like build the Lego bricks of, if you put all the different aspects like chocolate and mint together, is an after 8, for instance, chocolate. So all those aspects are used to create this construct. And this construct, for instance, is a fruit flavor, and that is then clearly noticeable according to comparison with test products. So that's the first aspect of 2022, and for 2023, though, we have the regulation of heated tobacco products entering now the aspect here. Of course, we know from previous studies that we've had seeing an increase between 2006 and 2008 using, for instance, Euros Plus data that we had together with ICO, exceptional collaboration, and ENSP, University of Crete Imperial, many other colleagues in the room, cohort studies showing that between 2016 and 2018, we've seen an increase in heated tobacco products. And these have been assessed and related to perceptions of risks, but also member states. I'm flagging this. So then we came in 2021 with Anthony Laverty and Philippos Philippidis, which you probably both know well. And we looked at the prevalence and reasons of heated tobacco products in Europe. And we're seeing that most are concurrent users of other products. But more importantly, the reasons for using the products are either the belief they're less harmful, friends using it, to stop or reduce smoking, and then like the flavors, or find it cool and attractive and cheaper. Of course, without going into all the detail of what is a regression analysis in here, one of the interesting aspects that of course pop up is the age. We're looking at a young age group. So what happens here is that I would like to present this slide. Unfortunately, I'm not allowed to present even more further details. What we're finding is that when we look at the heated tobacco product as a product itself, they are different both within products and across countries. So it's like having a different virus, a different target organs in the different EU member states. It's a different virus and different mutations of the same virus in different member states, different compositions. Now, this is actually research that's literally 2 days old of a USEG analysis. They're different compositions. So, to move to the last phase, we now enter a change of circumstances in 2023 for tobacco products. What does that mean? A substantial change of circumstances happens. It's a TPD regulation saying that if something happens, these two criteria, then stricter regulation appears. So first one, there's an increase in sales volume by product category by at least 10%, and the sales volume of that category must exceed 2.5% of the overall sales in the European Union. And heated tobacco products jumped, if you can see down the corner, by over 2,000%. Remember, the cutoff was 10%, 2,000%. And then it also exceeded the sales volume by about 3.5%. So what happens then? We have von der Leyen signed in June the directive that member states have to adopt and publish by July 2023. Within the next 8 months, they have the laws, the regulations to change the regulation of heated tobacco products. And these would apply from the 23rd of October 2023. What are these changes? Heated tobacco products had text-only warnings and have text-only warnings. I've got one in my pocket. For instance, they've got the text-only warnings. That's changing. From October onwards, of course, they have a pillow period of acclimatization, I'll call it. It's going to graphic warning labels that cover 65% of the surface, and flavorings are allowed. Currently, flavors will be banned, which means we're going to have to do a lot of work on the heated tobacco products. This is, for instance, a flavored tobacco product. We have to do a lot of assessment to see what products are allowed on the market and which ones are not allowed because they have a characterizing flavor. So, what is the future, though? The future is, then just to parallel what you mentioned, Adriana, is that what is an end game and what is a smoke-free generation? This is an industry research slide by using the Wall Street industry submissions and industry research for investments, and they clone and they're going to hijack our end game terms, and when they say smoke-free, they mean combustible-free here. So they're saying they're going to become smoke-free and hence hijack the end game in this aspect, but they mean combustible-free. But of course, if we look at that from the share of profits, and I find this extremely alarming, look at the share of profits that come from heated tobacco products over the years, 2017, 18, 19, 20, and 21. So we know what's at the gates. There's a lot of information coming forward. So take-home points. The TPD may influence and does influence product evolution. I'm not saying it's an asteroid that's going to change the evolution of the planet, but it does influence the evolution of the products. Characterizing flavors can be assessed using scientifically calibrated methods, so you'll be able to assess what is a characterizing flavor. The USEG data is extremely helpful in actually mapping and identifying these epidemics and these mutations of these products within the different cells of the member states. Of course, the industry, as we said, now is heavily invested in heated tobacco products, which means we're going to have a lot of battles. And the heated tobacco products in 2023 in the EU will have to have new, larger graphic warning labels, which is a great success, and a ban on characterizing flavors. So I'd like to thank, of course, all the researchers, co-investigators, friends and colleagues of everyone who's been working on these many, many activities, and thank you for waiting just before lunch for me to wrap up. Thank you very much.
Thank you very much, Konstantin, and thank you very much to the three speakers. Well, I think we are in a very interesting point, because now we know, we have been discussing, we know where we are, what's been happening, and probably what should be the next. I think we have the best tools that we could have. The FCTC is clearly what we must use to reach our goals. The Empower is also an excellent tool. But, as we have said, if we don't implement these measures, we will not go forward. So what's the key? What can we do? Well, I think in this point we should join, or we should mix this session with the previous session. Why say that? Because I think that, you remember please the title of the previous session. It was something like all together towards the end game. All together. Why I say it all together? Well, because who must regulate these things? Politicians, of course. And we have here some politicians before talking about this. But politicians They have also their small world, every one of them. We have the Minister of Agriculture, who is more concerned about keep the tobacco crops. Many times they don't think in alternative crops, they are thinking in their small world. We have the economic ministers, the tax ministers that are very happy getting the taxes from tobacco. Sometimes they don't think that the expenses that cause the tobacco in the health of the citizens are probably much higher. And we have also the ministers of health, that usually they should be on our side. They should be defending in this balance of the governments, where we have the ministers who depend the health and the ministers who depend the agriculture or the taxes or other things. They should be on our hands. And we have found several times excellent ministers of health in Australia or in France. I say Marisol Duén, for instance, I remember. But sometimes not. And Raquel explained what happened in Spain. We had excellent ministers of health with two excellent laws in Spain in 2005 and 2010, but we have now stopped dramatically in Spain. I'm talking about my home country. And it happens also in other countries. But what's the key? What can we do to change this? Probably to go together. The politicians look for the citizens, what citizens can, they are who vote them. They are who vote for them. So we have the power. Citizens and NGOs must make a lot of pressure, we should do that, to remember the responsibles of health in the governments that they must defend the health of the citizens. This is the key point, I think. We must join all of this because in other case, we will not go forward. So I don't want to talk too much, but please share our comments. I don't know if first of all, some of you wants to say something or regarding the presentation, or if maybe we give the floor to the audience here in the room. Maybe it can be interesting to discuss about this. So we give the floor to our...
There are no questions in the chat, only congratulations for the excellent talks, but I have a question. Yeah. Question to Dr. Blanco. It was very nice, and I believe that miracles happen in those who believe in miracles. And in particular, for the tobacco endgame is something that we have to dream for it. So my question is that how can we dream that this will happen, this 5% in 2030? Is there something that, for instance, the COVID-19 pandemic is a pandemic that overlaps with the tobacco pandemic? Do you think that the pandemic of COVID-19 has helped or has damaged the endgame?
Thank you, because that is a very interesting question that I don't know if I can answer it, because I think that we have things in both sides. There were some countries in some area, for example, in EMRO, in the Eastern Mediterranean region, that they used the pandemic to increase the bans on shisha, for example, use in public spaces. Many of them have kept them. I hope that all of them kept them, because if they come back, they will be losing something that was very important. In other countries, obviously, the emergency of the situation of the pandemic have, let's say, stopped other things going on. And we know that happened since the health of an individual, and I can imagine here in a cancer hospital how much you have suffered that, to the main thing that we were not considering anything in the policies that is not just trying to go against the pandemic. So it's difficult to say. From our perspective let's say in the convention secretariat, well, it caused 1 year delay in one of our meetings, the conference of the parties, and the meeting of the party, but mainly in the conference. And since it was virtual, there were some important discussions that couldn't be done in the last COP, and we are going to wait until the 2023 to have that. For the protocol, it was even more damaging because we delay 1 year some decisions that we need to put things working, let's say. So I cannot tell you. In general, I would say that it was damaging in the fact that make people think that this is the big problem. And I used to say when I began talking in the period of the pandemic, 8 million people a year were dying before the pandemic, were dying during the pandemic. I will keep on increasing, more than 8 million dying after the pandemic. So while I know the pandemic is not ending, but it still is much more controlled than the tobacco pandemic, I think that in that sense we were damaged from the political perspective.
You want to add something? Well, I think, let me say something regarding this, because I think it's very interesting. For instance, we have a very clear example in Spain, and we have seen it this morning here in Barcelona. For instance, in Spain, we had during the pandemic the ban on smoking in terraces. And it was absolutely accepted by all the citizens. There was no problem. Moreover, I think people were surprised when after the pandemic we came back. But we have seen this morning, we have heard this morning to a Minister of Health in the region of Spain, in Catalonia, who has said that this will be kept in Catalonia. That's an excellent example for the rest of the country, because, well, so we have politicians who really are defending what they have to do, health, and others that not. I don't know. So the pandemic sometimes has been positive. People has understand, despite what the tobacco industry said in the beginning, that people regarding COVID and so on. But I think people understood that smokers were in a poor condition, and they were really worse prepared to fight with COVID. So, well, I want to be optimistic in that sense. That let's see if now all the citizens can push our politicians to keep these advantages that we got with the pandemic. Well, we have another question in that side. Please give your one. I think we know who are you.
Anybody else was going to ask something? Or it was me?
It was
well, I have a question mostly for Constantine. I love your presentation. I think it was so needed regarding heated tobacco. But now we need something else. We need the same thing, but with e-cigarettes and vapors. Here in Spain, we're having, probably in all Europe, a huge problem with this. We have like 11 years old using like one-use vapors that are being selling next to candy in anywhere. So we are in the very beginning of another epidemic, and obviously we're going to need another directive, European directive, to ban either, I don't know, the best will be the sale of these, especially one-use vapors, like in other countries like Panama. But if not, at least if we could, ban the flavors from them, it will probably be the ending of this product. So I don't know if you plan to have another research on vapors or flavored vapors.
So thank you. Indeed, that's a very interesting topic, the regulation of flavors in e-cigarettes, of course, because it's a bigger product category, it's a bigger product class. We're not looking then at 50, 100, 200, 300 products, we're looking at thousands of products. So it's a very big, different approach. Speaking in a personal capacity, because I can speak within a personal capacity, we currently, the regulations cover cigarettes, roll your own, and as of 2023, a huge success of having additional regulation on heated tobacco products due to this exponential increase. From my understanding, there's not written in anywhere in the TPD that of impact of regulation on flavors for e-cigarettes. So I know from a personal perspective, we have done research on that, and the flavors are substantially more intense. But it's an area of research. There's a few groups in the European Union that are working on e-cigarette flavors, but it's not something predominantly that we've been working on, because we're contracted to work on roll your own, cigarettes, and now heated tobacco products. So I can speak for those predominantly.
Hi. So I wanted to add I'm Ariadna Feliu from the International Agency for Research on Cancer. And I wanted to add on your comment just now, because here we did a study, and another problem are water pipes, as Adriana just mentioned. And what about flavored tobacco for water pipes? Because this is another issue as well. And as they are tobacco products, because we know with cigarettes sometimes they skip this definition, how can we also use this opportunity to address this increasing problem?
Indeed, the assessment of water pipe tobacco in Europe is something that we have everyone's relatively left untouched. Even if you look at the PubMed, the manuscripts that work on water pipe tobacco in Europe, very, very few, you can count them on one hand. So indeed, it's an area that we need, I guess, further research. The framework for regulation is there, but remember, you must meet at least the criteria of a substantial increase in percentage of use, substantial increase in sales volume. which I have to say from a personal perspective, again, how easy the water pipe tobacco would be to meet that criteria. But in any case, the Tobacco Products Directive is going through revisions over the next course of years. So I think it's a bit of the importance of civil society, academia, and international institutions to be able to provide evidence that would set the base for a feedback into the process of creating a revision of the Tobacco Products Directive.
Any questions here? Okay, I have like a doubt or an embarrassing question for you, Ariana and Hep, but and also to Constantine or Francisco. We have a different situation right now with the tobacco epidemic. We have new products that go very fast. We have new flavors that are very attractive to kids. Do you think it's time also to, like have a different framework convention or a different, at least, empowered strategy that can introduce all this kind of reality that we are facing right now in order to tackle in a more effective way the problems that countries are facing? I mean, probably it's an embarrassing question, but it's something that is in my mind. I don't know, you guys, if it's in your mind.
Look, it's not embarrassing because it's a question that is in everybody's mind, or what we should do in order. And I like a lot of what Alan said about being in a battle that we are just reacting, and or in a war when we are proactive. But this is something that the Conference of the Parties has the work to do. This is their job, let's say, to keep the framework convention updated in a way, and that is what they have been doing through decisions. Okay, so that is their job, the parties' job, to discuss among themselves what they want to do, for example, with the new product, what they have been doing, because there are reports basically that after scientific report from WHO of what the parties has recommended. There is a decision on COP6 and on COP7 and in COP8 about this new product, and probably will be something in COP10 now in the next one, because that was one of the themes that were not discussed in COP9 because of the virtual way of conducting it. But I think yes, and I think that is what the Conference of the Parties is doing and has to do in the field. Electronic cigarettes is a little more complicated what was said. Sometimes it's not in the definition as the parties has interpreted it in the convention. But still, they are talking because of the relation that it has, because it's a nicotine product, and the relations that have with smoking, and there has been following e-cigarette even from before I think in different reports from WHO. So the answer is yes, and something is going to be done probably by the COP in the next one.
I would just add that the last report, the last WHO report on the global tobacco epidemic, did highlight the issues around e-cigarettes in particular, and recommended that Empower be applied to e-cigarettes in the same way that it's applied to tobacco. Of course, we don't necessarily have the exact criteria mapped out in terms of what is best practice in some cases, like taxation, etc. But we know that they should be applied. The taxation should be applied. Graphic health warnings and the nuances around that need to be figured out by countries, etc. But yes, apply Empower to e-cigarettes.
Good. Yes, Laurent, the last question, please.
Laurent Hubert with ASH. So I have a question for Adriana then in context of Article 2.1 and the decision. And maybe, I don't know if you can publicly say anything, but what would be, in your opinion, what would be the best outcome that we could get out of COP10 with the 2.1 decision?
Well, really, it's difficult for me to say, Laurent, what the parties should do. That is not our part. But the important thing that I can say is Article 2.1 is going to be considered because it's a request of the parties to be considered for a decision. And I think that the best result is that the parties can articulate a very clear path, let's say, to what is part of now what they should consider under 2.1. And I think that is the best thing, when the parties set a roadmap, or whatever the form that they can use to set a roadmap, just taking a decision now, just putting a working group or expert group to decide what needs to be done, whatever is, that is a decision up to the parties. But I think for me, as a head of the convention, will be to have a mandate to say, okay, this is what we want ourselves to do in the future in this part. That for me is the discussion itself, and a decision is for me a good result.
Okay. Thank you very much to all of you. And so I think we have now the break. And thank you very much. We'll see you in 1 hour. Thank you.
So, thank you very much for conducting the session, Francisco. Right now we are going to have the break, and we have a lunch outside of the building. So please follow people who have like a blue badge, okay? Who are going to be the people who are going to walk us through the other building. And what else? At 1:30 we are going to be back. Those that you are following online, we will be back for the rest of the session in the afternoon, okay? This room is going to be closed, so you can leave your belongings here. They are going to be safe.
Because one big concern for me is that
We will be going to the dinner place in 5 minutes. So if some of you want to take profit of the restrooms here before walking, so we will be in this corridor here. And you know that there are some restrooms near here. Thank you. Okay. Because, okay. Okay. Bueno, gracias. Muy bien, pues está bien. Y la tercera buena.
Muy buena.
La primera buenísima y esta
Esta
buena
igual, sí,
también.
sí, sí, sí.
Bueno, me ha gustado más la primera.
Bueno,
pero antes que
The session. So please, those that you follow us online and those that you are following us here, take your positions and we are going to start with this third session or table, okay?
Good afternoon, everyone. We are getting ready to start. Let's give a minute or two for those who are coming in. Let's take our seats and I think we are ready, right? Ready or not, we start. Dear all, it's my pleasure to chair the session. Our session is called People for Making Things Happen. And today we will have three presentations from three very experienced speakers. My suggestion is that we have questions at the end. We started almost on time, so we should have plenty of time for discussions. So please write down your questions, and then at the end we will take all of them. So we will start with presentation from Dr. Angela Cerbanu, WHO European Office for the Prevention and Control of NCDs. Dr. Angela Cerbanu is a medical doctor. In early 2018, she started working for the WHO, the Republic of Moldova, as National Professional Officer, coordinating the prevention and control of non-communicable diseases. In 2018, she moved to Copenhagen, Denmark, in the position of Technical Officer in Tobacco Control of the WHO Regional Office for Europe, where she's currently working.
Lila? Yeah, it's a long career, and I also started not from tobacco control because many of you, as I see, as a researcher, but I started with the control of communicable diseases. Therefore, I really like how Konstantin was also comparing the tobacco control with, or tobacco epidemic with pandemic of the communicable diseases. And I think that also I'll take out because it's difficult to speak and breathe. Yeah, in terms of their, who are these people who make it happen? Because it's practically everyone knows that WFCTC is really a great tool, and it's quite comprehensive and includes many areas of work, many areas. And also in terms of the people who have to implement it, it have to be also variant. And we'll go through the presentation and I'll try to prove it through. But I would like to start with the general obligation that is set up in Article 5 of WFCTC, that countries and parties are obliged to develop, implement, periodically update and review comprehensive multi-sectoral national tobacco control strategies, plans and programs. That also, they also have obligation to protect these programs, legislation, from the interference of the tobacco industry, and frequently when the legislation is put into place and when countries are developing these programs, they forgot about this obligation as well. But it's a very important one and we should not forget. In order to develop these comprehensive programs to cover all the areas, the people with the good capacity is very important, because it's practically, if you don't know how to do, what to do, it's practically difficult to put on the paper, and it's also difficult to transpose into national legislation all of these provisions. And not only transpose, but also to take care that should not be the loopholes that practically the tobacco industry is exploring at the maximum level. Therefore, as an outcome, there is necessary of the activities and that obligation also have to be in place the comprehensive strategies and legislation. And capacity building is practically crucial within this part. Here are listed there some of the key articles of WHO CTC and also listed the relevant ministries who are involved directly or indirectly in the implementation of these articles. And you can see that practically that entire government and entire society have to be involved in order to put in place comprehensive measures. But all these measures, if it will be not well coordinated, it's very difficult to see to see where we are and who does what, when, how, in what way, and did they complete it or not. Therefore, the strong coordination mechanisms have to be in place. Also put the slide about the Empower that we discussed about the Empower that is also that was introduced in 2008 by WHO. And just briefly, it's not like completely, but just how many specialists we need in order to put in place all these measures. And I will start with the first and to put in place, but also we need a knowledgeable, skilled, and effective workforce to meet the diverse needs of the tobacco control. And we'll start with monitoring of tobacco use and prevention policies. And not only monitoring, but also, as Hannah mentioned, that monitoring is good, but if without evaluation, it's also not so effective. Because I'm trying to compare also the monitoring and evaluation with the work of the physician. You know, when the people coming with some illnesses or some own, you have to check, to do the checkup and to establish the diagnosis. Therefore, it's also very important in the tobacco control to see where we are with the implementation. To put in place the good monitoring, it also have to be because countries should have the periodical and the comprehensive monitoring system for both adults and youth. And they have to have valid data because only with having strong data you can can evaluate. It's not easy and it's not cheap. It's very expensive. But also countries can can find different ways. For example, some of the countries, they use the capacity of the statistical office of the medical universities who can be involved in the process of the monitoring and evaluation. And also with countries that have very limited capacity and resources, WHO has also the collaborative center of the in America, is practically CDC, who are helping not only with their financing part, but also with technical part to build the capacity in the monitoring, in strengthening the capacity of the countries to monitor and evaluate the tobacco control policies. In the European region, we are quite good, and practically 42 out of 53 countries have recent, representative, and periodic data on both for adults and youth. There's quite limited number of countries who have more comprehensive evaluation of the situation, analysis, and so on. There's really, it's have to have good capacity to put in place. Protection from exposure of tobacco control, everyone mentioned, but this really, to put in place the measures require also changes at the individual, at the institutional, and social, and society level. Because, and I'll try to come with some examples, and I'll use the steps that have to be put in place for the implementation. Because first of all, to implement this comprehensive smoke-free legislation, there have to be really strong legislation with clear definition, with designated institution for the enforcement, and with also there have to be fines, or who will be applied, who will monitor and how to be applied fines for those who are violating the legislation. And for sure, we need the strong political support and champions also to promote it. Non-governmental organizations also need to have good capacity to enforce, because without them, it's very difficult to put in place. Educating of the people and increasing awareness of the danger of secondhand smoke. Without this, we also, and the support of the people to put in place, because they have to understand about it, but also to respect it. And therefore, to put in place, there is also need to be supported by strong communication campaign before, during, and to be maintained as well. And also, we need capacity of their communication persons that will help to adjust the messages to the population needs and so on. And also, we need the strong capacities of the enforcement agencies, and in some cases hospitality sectors, and those who have to respect this. There's two countries. I also start with Georgia, and you also heard about the story of Georgia. This also really had a strong political support. They have comprehensive act. There's only few loopholes in the legislation, but in any case, there's a comprehensive approach for the smoke-free. They developed the guideline, they train their trainers, those who have to enforce the legislation. Usually there's police, but in Georgia, what is the local legislation, because they also involved in the enforcement mechanism, officially the NGOs, that is also very important. And they also strengthen the capacities of NGOs who have to monitor, to put in place. They also have the site visit of the high officials to put in place communication campaign, and it's really going well. And now the enforcement is quite good. And after 1 year, they reach more than 90% of the places who are really complying with the legislation. And hopefully they will keep it like this, because I'm showing another case of the Republic of Moldova that at the beginning they have the same pathway. They have strong legislation, very comprehensive legislation that covers all types of the products, trainings, materials, clear division of the responsibilities, because between the Ministry of Health, because there's health inspectorate who are responsible for some part of the enforcement, and the policemen who have involved media, communication campaigns, so on. Very well done first year. More than close to 90% after the first year there was complaints, and really good enforcement. But after some period of time, just because of the limited capacity, there's not continuous training, there's a reluctance on this. The last survey that was conducted, a step survey that will be published in a few days, they show the decreasing of their compliance of the smoke-free provisions. Therefore, I want to mention that the capacity building and all these pieces that put in force have to be like a continued process. It's not just one moment. Yes, we do at the beginning. If necessary, the strength capacity at the beginning to put in place, to train them, but have to be continued, because otherwise we will turn not at the same point, but in any case it will be decreased and not be at the same level. Offer help to quit tobacco. Also, there is practical is obligation and also of the health sector to offer at all the levels, to offer the brief advice and to help tobacco users to quit. And there have to be a comprehensive tobacco cessation training program for the health specialists, also the university level, but also post-training and continuous training. And there's not so big issue, because there's have to be there's up to 1 day training that have to be, but also have to be reinforced and updated periodically. In the European region, only 9 countries have a comprehensive approach to tobacco cessation, and 41 have only some level of support. in even the health sector that have obligation to do is not doing so well and what is expected. Therefore, and another point, because also we discussed about the, what about the physicians who are also smokers and also they have to offer the cessation services and how they will be trusted and also have to be inside within their service in the health sector to work with the different with the ministry and in the ministry to help medical workers to quit as well. And the WHO also offering the online training, and this is a program for the primary healthcare physician. There's a lot of guidelines developed and put in place. And also forgot to mention that just because we receive also a number of requirements from the country about the how to enforce the Article 8, we developed, and we are developing, we didn't develop, but we are developing, and hopefully next year will be published the online training tool on the, at the basic training for the health inspectors, for public health specialists on the implementation and enforcement of Article 8. There's total ban on advertising, promotion, sponsorship. One of the most difficult measures that have to be put in place. It's easy to write and to include. It's not easy. It's easy to write, but to put in place is very difficult a measure because it have to be also in many countries they have even the not many, but only 9 countries have comprehensive measures, but in only limited countries, they have good enforcement. Practically, there's unicums countries that have more or less good enforcement. Therefore, without authority that have to be put in place, capacity building, continuous capacity building of these persons, it will not be able to enforce these measures. Tobacco taxation, I put it just because some of the countries, there's they try to use the resources or the taxes that from the tobacco to use for the implementation of the tobacco control measures. It can be like a funding that can be used in the countries. Even if there's not a specific tax on this, but some of the countries try to negotiate with the Ministry of Finance to allocate some funds for this, and it can be used for surveillance, for training, for cessation, and for other issues. It's just a possibility. It's just a list of the key strategies to strengthen the national capacities, and we already mentioned about the national coordination mechanism, about the need to analyze and monitoring the national tobacco control situation, and many other issues that have to be put in place to strengthen it. About the key lesson, I also mentioned that the capacity building have to be continuous process. It's just not at one point of time. And just because everything, the evidence is evolving, there's new information, the training materials have to be also permanently updated as the new information come in place. It have to be adjusted to the countries, and of course there is necessary the leadership and political will also is crucial for this. The WHO have also the crucial role, first of all, to put the evidence that exists, the facilitating assistance to the countries, in also the implementation, the tobacco control measures, to do the capacity assessment, and to promoting partnership at all the levels. And this is it. Thank you very much. If you have any questions, I'll be happy to respond.
Thank you, Angela. Write down your questions, and then we will have a Q&A at the end. And now I would like to invite our next speaker, Lauren Huber. He is the Executive Director of Action on Smoking and Health, a US-based non-governmental organization fully devoted to supporting global health and international tobacco control efforts. Laura now works to strengthen the link between the global tobacco control agenda and the work on the UN human rights and environmental bodies with the aim of advancing globally agreed health, human rights, and environmental objectives. Lauren?
Thank you. Thank you and thank you to the Institut Catalan d'Oncology for inviting me to come to this session. So I will talk about this topic about how do we work together to achieve endgame? How do we achieve a whole of society engagement? For example, we're very fortunate to hear this morning from Hanna about the Finnish, for example, where we do have a multi-sectoral approach. But that is not the case in every country. For example, just a few weeks ago, I was in France, and again, some parliamentarians, for example, have never heard about the FCTC. So we have some work to do in that area. So how can we use other mechanisms and other institutions in order to create a whole of government approach and support for endgame as we move forward? And a key one is obviously human rights. And it's one that, and I'll get to this, we can start hearing a bit more and more about it, given that we know that tobacco infringes on a number of rights. And that can give us quite a lot of opportunities, and we're just focusing on the right to health, for example. A right, and when we talk about human rights, jokingly, Adriana talked about earlier, the right to smoke, which there's not such a thing. When we talk about human rights, we talk about the rights that have been recognized at the highest level of international law and codified through international human rights treaties. And if you think about the right to health, it's included in a number of human rights treaties that most of our countries have ratified. So the Universal Declaration on Human Rights in its Article 25, the International Covenant on Economic, Social, and Cultural Rights, and I think most of you have heard about this right to the enjoyment of the highest attainable standard of physical and mental health. But also the treaty that deals with racial discrimination in its Article 5. And that's important, for example, in the context of the United States, a country that almost ratifies no human rights treaties, but they have ratified this treaty, and that was a strong, powerful argument to push for menthol bans, given that African Americans are high users of menthol products. The Convention on the Elimination of All Forms of Discrimination Against Women. So that's, again, a link then to women's rights. The rights of the child in its Article 24, the right of the Covenant on the Rights of Persons with Disability in its Article 25, as well as numerous regional human rights treaties, including some European human rights treaties. And I think that's important because it's true that, as Hebe said earlier on, that we're very fortunate in tobacco to have, in a way, we're very fortunate to have a treaty. We have our own treaty, the Framework Convention on Tobacco Control. But again, the whole of government engagement in it is lacking in a lot of countries, and that's one of the reasons why we still have very high prevalence in so many countries. So those human rights treaties can provide an opportunity to engage with other sectors outside of the tobacco control community, because we do have a bit of a tendency sometimes to talk too much just among ourselves, and that provides an opportunity to expand to other communities. And it's not something totally new. So, for example, just already in 2000, so that's on the year where we just started the FCTC negotiations in earnest, when the first NB1 started. The International Covenant on Economic, Cultural, and Social Rights, the committee that monitors the implementation of this treaty and promotes the implementation of this treaty, developed the general comments. And the general comments are a little bit like the guidelines that we have for the FCTC. And in it, they mention tobacco, and they discourage the use of tobacco. They said that the violation of the obligation to protect, and it's basically they stated it's a failure to protect the right to health of your citizens by if a government doesn't discourage the production, marketing, and consumption of tobacco. And also, it would be a failure for a government to protect your right to health if they do not intervene when third parties, which include corporate actors, become an obstacle to your right to health. And so there is a tremendous amount of human rights language that could be helpful to us in the context of helping accelerate the implementation of the FCTC. And that includes obviously also Article 2.1. And as we mentioned earlier, as everyone knows, it made it very clear at the FCTC that the articles in the FCTC are the floor and not the ceiling. And one of the problems we have with the FCTC is with the exception of Article 15, which deals with the illicit trade of tobacco products, and Article 16, which sells to minors and by minors, the supply side is quite neglected. So the FCTC is very focused, has been very focused on the demand side. And what Ruth Malone said this morning is that we need to address the supply. We need to address the retail environment, something that the FCTC had not done. And that is something that we have an opportunity now also because it is on the COP agenda for COP10. Another interesting thing is like a few years ago, the Human Rights Council also started to pay attention on obviously the issue of the right to health and the UN Sustainable Development Agenda. And they adopted a resolution in 2017 which recognizes the right to which basically urges countries to implement and work towards all of the goals and targets that are health related in the SDGs. And they do mention the accelerating the implementation of the FCTC. So as you can start to see that within the human rights community, they're starting to see a bit of a recognition about having to address tobacco in the context of protecting the right to health. And you probably all remember this conclusion taken by the Danish Institute for Human Rights after terminating basically a relationship, an agreement with Philip Morris International, where what they did an audit of the value chain through the entire value chain of their product. And this is what their conclusion was, basically that there can be no doubt that the production and marketing of tobacco is irreconcilable with the human right to health, and for the tobacco industry to basically align with the UN Guiding Principles on business and human rights would require the cessation of production and marketing of tobacco. So very, very supportive of an endgame concept. Again, when we're starting to talk about endgame, we maybe not even inventing much. I mean, to some extent, there is already a human rights framework that would support that. And on that same year, the last time there was a World Conference on Tobacco Health pre-COVID, civil society agreed, and there was the Cape Town Declaration on Human Rights and a Tobacco-Free World, which was adopted unanimously by all of those attending the World Conference on Tobacco Health, agreed that the manufacture and tobacco marketing and the sale of tobacco are incompatible with the right to health. And one of the advantages that we have, that the human rights treaties have that we do not have in the FCTC, is they have a very strong implementation review mechanism that allows for civil society and the public health community to participate in the reporting process. And that can be a powerful tool. So for example, in the United States, we used it in the context of a lawsuit, where we used human rights arguments in the lawsuit because in the United States, the FDA was not moving quickly on banning menthol products from the market. And so simultaneously, we had a lawsuit against the FDA to take action, but we also submitted a report to the Committee on the Convention on Racial Discrimination, which did get a fair amount of media attention. So it's a way also of elevating the issue. And in Germany, and as you know, the rights of the child, also the Committee on the Rights of the Child, which is the committee that also supports the implementation of the Treaty to Protect Children, they had also developed a general comment, which is, again, similar to our guidelines with the FCTC. And with that, this general comment, they do remind countries that states are required to introduce international law, implement and enforce national legal standards concerning children's right to health, including the WHO Framework Convention on Tobacco Control. So as you can see, there's a number of communities that we could take advantage of or could work with in order to help accelerate the implementation of the FCTC, and including considering Article 2.1 and endgame strategies. And in this context, we did use it, the Convention on the Rights of the Child. We worked with Unfair Tobacco to submit a parallel report to the Committee on the Rights of the Child. And we had success about 2 or 3 months ago. The committee made recommendations to Germany to do more to protect the rights of children in Germany. I would suspect we'll hear soon who's at the bottom of the tobacco control scale. I suspect it's going to be, again, between a toss-up between Germany and Switzerland. But as you can see in this case, we have a committee of an international human rights treaty making a recommendation to Germany to do more to protect the right to health of German children by doing more on tobacco. So I'm going to shift gears now. So another thing that I think would be quite important for us in order to support an endgame movement is the fairly recently recognized right to a healthy environment. The Human Rights Council first last year approved the right to a healthy environment, and the UN General Assembly approved in July of this year that basically we all have the right to a healthy environment. And then the same year, the UN, this year, the UN Environmental Assembly adopted a resolution that gave a green light for a treaty to address plastic and to end plastic pollution. And as you all know, cigarette filters are made out of a plastic. And this provided a unique opportunity for us because we've been able to basically able to work with not only with UN agencies, but we've been able to participate in this treaty process, which is actually being negotiated right now. That's one of the reasons why I was on the phone call during lunch, because the negotiations are taking place at this moment. And we have been able to have way more influence on the process action than we expected. So we've been able to raise the issue of cigarette filters, and we're getting support from a number of the civil society members who are present, that basically cigarette filters should be included in any single-use plastic ban and should be phased out. And I consider that basically the phasing out of cigarette filters as part of the endgame strategy. And you will see that also thanks to our intervention in an international environmental treaty, there is a recognition of Article 5.3. And this is basically a newsletter put in support of during the treaty negotiations. And if we had not engaged in this process, there would have been no mention about Article 5.3 of the FCTC and industry interference. And as you know, in environmental treaties, there's been a lot of concerns because of the over-industry influence from fossil fuels. So the presence of the tobacco control community is helping tobacco control, but is also helping other environmental agendas. Going backwards here. And even the High Commissioner for Human Rights tweeted yesterday and released a PDF report in support of this plastic treaty, where he also mentioned Article 5.3 of the FCTC, reminding basically that corporations have an obligation, have a responsibility, and reminded all of the negotiators of Article 5.3 of the FCTC. And I think this is important because, again, very often when we go to in countries outside of health ministries, sometimes there's not even an awareness about the FCTC. Sometimes you talk to a parliamentarian, they'll tell you, oh, tell me more about this treaty. I've never heard about the FCTC. But they do pay more attention to UN environmental treaties. So it's a way to make the connection. So I think that that could be an opportunity for us to use those human rights and environmental treaties to not only help accelerate the FCTC, but also push for endgame. And to conclude, I'm going to use this quote from an article that was, some of you may know, some of the authors here who've worked on human rights and health. But basically, human rights can be a strong unifying framework for global health governance, which can also help national whole-of-government engagement and help advance endgame policies. And the last thing I want to remind you all of, it's one of the things that Ruth Malone said in her presentation is a lot of things seemed impossible a few years ago and are become totally not only accepted, but the norm in tobacco control. Luke, who's sitting right there, will probably remember that during the FCTC negotiations, NB 1, 2, 3, 4, the concept of smoke-free policies, Article 8 of the FCT, seemed absolutely radical and impossible. The FCA would not even get consensus on it. We were not basically a very small group of NGOs had to push for it because it was considered way too radical to push for smoke-free bars and restaurants. That was in 2003. It did make it into Article 8 of the FCTC. 1 year later, it was one of the most rapidly embraced articles of the FCTC. So what had seemed just a year and a half earlier totally impossible, then became the most popular article in the FCTC. So I think it could be also similar with Endgame. I think it's important for us to obviously support the acceleration of the implementation of the FCTC, because as Adriana mentioned, we need to have the base. If a country has very high prevalence and has not implemented the other measures, we cannot do that. However, in order to really achieve an endgame and achieve the targets we're looking at, 5% and below, we will have to address also the supply side and do more on the supply side, including the retail environment for tobacco products. Thank you.
Thank you, Lauren, for the excellent presentation. And now I invite our last speaker, and then we'll move to questions. Armando Peruga, he is a physician and a doctor in public health. In 2015, when he moved to Geneva as the coordinator for the capacity building unit of the Tobacco-Free Initiative at the World Health Organization. Now, Armando is an associate researcher at the Biomedical Research Institute of Belvitge in Barcelona and the Center for Epidemiology and Health Policy of the University of del Cerrado in Chile.
Hello, everyone. Are you awake after lunch? Okay. Okay, that meant more or less, okay, for those of you who were still asleep. Konstantin was saying that he had the worst spot, but I don't know, it's right before lunch, and it's indeed not a very good spot. But now he agrees, keeping you awake is going to be a challenge. So, hello to everyone. First, thank you very much to my colleagues in the Institute Catalan of Oncology, all my colleagues for inviting me to talk about this topic, for being such a supportive team. Part of my thoughts come from interchange with them. We have heard during the presentations issues like words or phrases like comprehensive approach, whole government approach, and I want to talk about research capacity for policy change as a whole policy change approach or process in which research is sometimes forgotten as an important element of that whole process. So talking about the contribution from different parts of government, different disciplines and different processes, sometimes we forget about the role that, or the important role, in my opinion, that research can play. By way of introduction, I would say that many times when we talk about capacity for research, whether in tobacco control or other things, we tend to think about more researchers. We don't have enough time to research, we don't have enough researchers, or the researchers that we have don't have the skills to do certain things, so therefore we have to train them. And so the first thing that we think about when we talk about capacity for research is about training researchers, more researchers, or even produce a little bit more resources for research. But I would say that you can have 1,000 very well-trained researchers and still, as a society, don't have the capacity to do research if they don't produce the results that are needed for, I would say, policy change. Part of my points would be that capacity for research is not only a potential to do research, it's actually an ability to realize that potential into things that are of value for policy change or for the goals that we set for ourselves in tobacco control or in other areas of research and political action. Therefore, as you can imagine, research capacity is not only, I'm not saying that skills are not important. What I'm saying is that it's not only an attribute of researchers, It's not a capacity of a specific researcher or a group of researchers. Is a capacity, is an attribute of the whole research system. And therefore, in the next few minutes, I would like to talk about a couple of things. One is to define what we should understand, what I think we should understand by capacity for, or research capacity, specifically for tobacco control, and then talk about what I think are 5 key elements of that capacity that go beyond the traditional thinking of providing more skills to specific researchers. But before we do that, or I do that, I would like to highlight a little bit the importance of research in tobacco control, because I said that research is important, but why? And I would like to say that research traditionally, historically, has been essential to progress in tobacco control. Why do I say that? Because at least I can think of 3 things that research have done for tobacco control that are very important. One is that it has identified the kind of diseases tobacco produces. Today we are very clear about that, but 60, 70, 80 years ago that wasn't that clear. So there's been a whole research going on, and it's probably some more are needed given the new products that we have. That's one thing. The other thing is that it has helped characterize the extension, the distribution, the patterns of use and harm, which are a population level thing that are important in order to guide your policies. You may have something that causes cancer, but if it causes cancer only in one person in the whole world, it's not that relevant. And we have a case here in which the research has proven that tobacco has impacted on millions and millions of people, not only in terms of diseases, but millions in terms of deaths. And third, I think that it has also helped measure the effectiveness of an impact of tobacco control measures in design them and evaluating them and all that. Now, the problem that I see is that most of that research until now has come from high-income countries. And I would say even more, from a few high-income countries, because I live here in Spain, which is considered a high-income country, and I wouldn't say that is a beacon of research in the whole world. So it comes from high-income countries. Is that relevant? Well, for certain things, it's not that relevant. For, to explain biological mechanism, it doesn't matter if you do a research with the Spanish people, with Chinese people, with Peruvian people, because more or less, except for some context issues, they will react the same way. A cancer, lung cancer is produced in Spain more or less with the same mechanism that is done in other countries. But there are other research that are very context dependent. And that's where we need other countries to come on board in order to give us all that experience that we don't have yet. And that is important for the other 2 elements that we have in characterization, the extension and patterns of use, given that use of products may vary by region, countries, or farms, and all that, and especially not so much to identify which policies work that we know, but how they can be improved. How can we better understand the intended and unintended consequences of the specific measures that you are applying in a very specific context. So expanding, I finished this thought with the issue of expanding research capacity is crucial to continue reducing tobacco use. If we have time, I'll go with that, but I think that the important thing here is to define capacity. And everyone agrees that capacity in research is important, but defining it is a little bit complicated sometimes because of the issues I've mentioned before. And lack of capacity sometimes is understood as people, researchers more specifically, do not know how to discharge their functions properly for lack of skills, and therefore we have to add some skills through training, and that's obviously important. But however talented the person might be, however much training they may receive, research capacity does not materialize if the overall systems inhibits that capacity. I tend to think that research, like many things in life, is 10% inspiration, thinking about the genius researcher, and then what you need to have is a genius researcher that provides some ideas. I would say that inspiration, so to speak, is about 10%. The 90%, the rest is perspiration. Is working hard, and those who do research know exactly what I mean, that it's not, sometimes working alone many times in front of your computer or in front of your subject to do that. Therefore, I think that research capacity, in terms of definition, as I want to transmit that to you, is the actual ability, is realizing the potential of a community of practice researchers to investigate a subject, and that's important, not any subject, I will go that in a minute, and produce results that adequately inform practice and policy in a manner that is timely and practical. So that's what I mean by capacity, and the 5 questions or 5 elements that I think are important in order to assess whether we have enough capacity and we need to develop capacity is, in the first place, resources. That's the simple thing that I said before. If you think of research like a little business in which you produce something in order to sell it, resources is kind of the capital of that business. And obviously, the capital refers to human resources, to physical assets, to financial resources. That's very good. But it also refers to processes of attracting that. You need a process to attract and maintain that physical assets, that human resources and financial resources. And that's why in this area, other things before having enough researchers is also having a good pre- and post-graduation system that offers enough research training opportunities, is having a career development that allows present researchers to continue and produce long-term results. It's also having an adequate support for access and management of funds, because how many of you go crazy trying to access and manage funds? And I know that working where I work with ICO and IDIVEL, we are privileged by the support we get from in that area, which relieve us from very, very cumbersome processes. So that's resources, I was saying, is not only the human resources, but also the processes that allow these human resources to work. And I think the most important thing is, what do they work on? I said that researchers is a community of practice that work on a subject. And here you have a cartoon that we scientists hate, because sometimes we are classified. The cartoon says, I'm just a scientist. You need to ask someone else if you want to advise, if you want advice about the real world. And that's because sometimes we do not research on matters that really are relevant to the world. And we have to avoid that. And most of us have some contribution. I know I'm exaggerating now, but it's aligning our work with priorities of policies in a way that we have a route, a process in which whatever we do, we know is going to produce some result that's going to help people improve. If you think this as a business, the priority is the product. I mean, unless you have a good product, you're not going to be able to sell it. I mean, you can have all the marketing you want. If the product doesn't satisfy certain conditions, it's not going to help you. And what is a good product? According to marketing, there's 11, 12 characteristics of a good product, but I will take a couple of them. One is they call it the marketing proposition value. That is the promise of benefits that the product that it has to be, and that's why it's important to align with the priorities of a country in terms of policy. And the other is that it has to produce a change. It has to help someone. If it doesn't help someone to satisfy a need, then it's not going to work. So aligning the research priority with the overall tobacco control priorities is another element of that research capacity. I don't think I'm almost without time, but I have here some examples of research priorities. This is from 2000. A group of people in 2000 got together, and as you can see, they decided that mostly they had supply issues were the most important for them for the most part. Then you have here an institutional priorities from FDA. Obviously, their goal is product regulation, and so they have issues of toxicity, addiction, health effects, and all that. And then you have a little bit more, and this is just to give you an idea of what we need to do as a community in order to have research priorities. This is the research priorities that Berg and a few others decided that could be important for the whole world, and they mentioned four that I think are very useful for us. One is diversity of tobacco products, and I think some of you talked about it, Konstantin specifically, and there's an important thing. The other thing I think also we mentioned is the diversity of populations. We even said in endgame we may have a overall prevalence of 5%, but a group with 25%. That means that there are specific groups that we need our special attention. Then we need to evaluate policy and policy impact. And by that I mean not coming up with the idea that taxation is a great thing. We already do not know that. But we need to evaluate intended and unintended consequences of specific policies that are determined by the specific context in which it's done. And finally, I think many of you also mentioned before, is that the need to inform our advocacy efforts. Provide empirical evidence that a salient policy argument or counter-argument is useful in order to address a commonly used argument by the tobacco industry, for example. Illicit trade, smoke-free environments, there's many things that we still need to do. My last 3 minutes, I want to also talk about different capital, which is the social capital, in which it's also important that we have a capacity for researchers to have relationship among themselves in order, because through usually affiliations or meetings like this is an important thing. It facilitates innovation by exchanging. It facilitates accessing expertise that sometimes we may even don't know that it exists. And it helps through this network in the social capital, or working together, accessing gatekeepers, which are very important in most endeavors of life, influencers, decision makers, and stakeholders. A fourth element is knowledge dissemination, is the distribution of a business. You may have a great product, but if you don't get it out, you're not going to be able to do anything about that. And we have some specific issues in tobacco, in research specifically, but also in tobacco research, and has to do, for many of us, is language. You know, most of the journals out there are published in English, and many of us were not lucky to be born knowing already English, and so that's an important issue. Writing barriers, most of us didn't were born knowing how to write brilliantly and communicate that. Publishing is an experience. You learn with time, from selecting the journal to writing correctly. Access to funds to pay for publication, open access, is one issue that impacts more on certain researchers than others. And also institutionally, the availability of institutional and career support mechanisms for research dissemination. For example, here in ICO, we have a communication with the communication group, because it's already well understood that they are already available for us to make us make research known to the public and to others. Finally, the very last point we have, I'm over my time, but I want to have my last point about research translation. This is somehow the centripetal force. We need not only to get information to our colleagues, which are fine, and to policymakers, that's fine, but to civil society as a whole, and that is something that requires special skills and training and a system from research to provide that. So just to end with a summary, and I promise Lilia that with this I'm done. I wanted to remind you what I said, building tobacco control research capacity is not only, it is, but it's not only developing research skill of individual researchers or providing some essential resources to specific researchers, is producing results as a group that improve tobacco control policy. And for that, we need to do at least 5 things beyond the training or specific skills. One is align research topics with prioritized policy options. In Spain, we are waiting for this famous integral plan of tobacco control that our friend, thank you, Joan, he's everything. Especially for those who are following from home or the other side of the screen. I said, you know, it would be good, and in this country it would be different, but when you have a national plan for tobacco control, that it has an element of research that should be developed. And I think that's one of the comments that was produced from ICO to this policy document. Support with structural resources to allow mostly a long-term career for a long-term production of results. Strengthening the social capital of researchers, improving knowledge dissemination, and finally, improving research translation into policy and practice. So thank you very much, and I'll be waiting for your questions.
Thank you, Armando, and now we are ready to move to the discussions. And I would like to open the discussion part of our panel today with a quote from Max Himmelmeber. He was the German inventor, and he said that yesterday cannot be repeated, but tomorrow cannot be simply improved form of today. This is kind of summarizes what we've been discussing. When we talk about the end game, it's not just the tools that we have right now. It's not just about the things that we know that needs to be done, such as comprehensive and complete implementation of the FCTC measures. We have to go beyond. And many of the tobacco control conferences and discussions are kind of focused on that. So what else can we be doing to make sure that we are making the progress that we want, but not just an improved version of today? Because if we look in the future, in the 30, 40 years ago, will we achieve, those countries who already set the end game deadline, will they achieve it or no? Will they have to adapt and to reinvent the concept of the end game? This remains to be seen, but again, as some of the other speakers pointed out today, we have to try to predict what will happen in the future. We have to have several models of what we will be doing, how do we address of the new potential threat that will be coming from the industry. But coming back to the topic of our session today, it is about the people who are in this room, who are making the tobacco control the priority, who've invested their life, their knowledge, skills, expertise, their energy and passion in tobacco control. You've stayed in this field despite of, well, I'm guessing many challenges. You went through, some of you maybe even went through the burnout. You had many disappointments. You had maybe some disagreements, but you've stayed. So one of the questions that I want to address to our panelists, how can we retain people in tobacco control, but how can we also attract people in tobacco control? We are in the bubble. We are trying to sometimes escape the bubble and speak the language of policymakers, speak the language of the media. We are trying to be appealing. We are trying to make sure that people understand us, young people understand us, smokers, non-smokers. It is a challenge. We are making progress. But to a question to our panelists, if you could prioritize few things that we as a tobacco control community and beyond could do to make sure that people who are in the tobacco control would stay, and that we would ensure knowledge transfer, which is important, but that also new people, new blood would come.
Not that I have anything more profound to say than the other two panelists, but well, actually, one thing that's surprising I find in tobacco control is the longevity. I remember when I started, it was with the FCTC negotiations, and I thought, I'll do that 3 years, and then after that, this treaty will solve the problem, and I'll move on to something else. And it's over, over 20 years, quite after 20 years later, and still on it. But I think the attracting talent, new people, absolutely, that's critical, and making tobacco a really relevant issue. What I've heard sometimes, a definition which I don't like at all, when in environmental movement, for example, oh, tobacco, it's a soft issue. It's important, but not that important. It only impacts some people. So it's really, and this is why I think it's making it relevant to already agreed global goals. This is why, for example, I was very, very involved in getting the SDGs, the FCTC and the SDGs, because we thought, oh, this is really going to, that's going to really increase. And it didn't. I mean, we did manage to get it in the SDGs, but it still hasn't attracted enough people. So I do think it's important then to use those other platforms, like the human rights ones or the environmental ones. I was very, very pleased by the reaction and the welcoming from in the plastic treaty at least, to the tobacco control movement. They were really, you guys are heroes. You managed to address a consumer good, no, well, it shouldn't be called consumer good, like a non-good consumer product. And to get also industry interference addressed in the treaty, et cetera, et cetera. So I think we have a lot to do we have a lot to build on to attract a new generation by showing the successes we've done and showing the interconnection with other, global priorities such as environmental issues, climate change, human rights issues, and so on and so forth.
Thank you, Laurent. Yes, Armando.
Yeah, I would agree totally with what you say, and I would define those factors that may attract new people and retain people with two words. One is success, and the other is unity. Success, and I think you were referring to the fact that that a lot of people thought that we were doing a good job, because I think there's been some success in changing policy. Obviously, there's not enough, as Adriana and others have pointed out, but it's probably more than I expected when I started before that. And I'm a whole empty, and what is it? Not an empty glass, but a full empty, full. Okay. Thank you, Adriana. Although I would say that, as I was reading a very bad joke the other day saying that it doesn't matter because a scientist, a half-empty glass will see it one half full with liquid and the other half full with gas. So it's always a full glass. No, I mean, jokes aside, I think success is a very important thing. And part of the problem that we have in right now is that there's a certain feeling that there's a slowing down of that initial impact. And in order to succeed in retaining people and attracting people, we need to change that dynamic. And linked to that is precisely the unity. People don't come to where there's infighting, okay? And especially the novel products have created this situation in which they portray us as a group of people that have inside fighting that is not resolved. And I think that, sorry, the tobacco industry knows that very well, and they're promoting that in the sense that there's very good people that have very strong disagreement and they have very personal issues. So I think there's two issues that we need to solve in order to retain and attract. One is to continue providing that sense of success, and we need to solve as much as possible that sense of unity that was very clear until 5, 6, 7 years ago, and it's not that clear now.
Thank you, Armando. I think we might have questions from comments, unless, Angela, you want to say a few words.
Just few words, because I also fully sustain what was mentioned before, and along with the point that mentioned by Armando about the success is unity, and also a few points about the diversity of work, because in the tobacco control, you can have really very diverse type of work. If you're an economist, you can start to write for taxation. If you're a public or the epidemiologist, as Hebe mentioned, that prior to their data, evaluate, research, it's so varied, and we have to interest people. But also I have to mention that in the tobacco control, I meet most devoted people that work not only just for the salary order, but by heart. And also Raquel, that was mentioned that she even doesn't have any finances, but is continue to work in the tobacco control. Therefore, I also agree that unity, supporting, and I never meet such community that is really supporting each other.
Thank you, Angela. And the questions, first
Yes.
Online.
Lilia, the people on streaming are very thankful because your panelists, they thank their enthusiasm. They said that they are having no siesta and no football today. And even they are saying that Armando's tie is a trending topic in Twitter, and that Amazon enlarged the Black Friday offer for Dr. Peruga's tie. There is also a question by Sean Semple again. He's saying, I agree with Professor Peruga, who is wearing a wonderful tie, that we need to ensure continued development of research capacity in our countries. As mentioned earlier, policymakers regularly change because of voting, and often the national policy expertise is retained only in academic and NGO organizations working on tobacco control. Meetings like these are so important to build capacity. Any comments by Dr. Peruga?
Well, the first comment is about my tie. I think I already explained to you, Joan, that one of the few things I've learned in my life is that I was never remembered by my intelligence, and so I decided to be remembered by something, and now they remember me by my tie, and so that's something. The second, jokes aside, I think it's important. I said it in my presentation, but I think it's important because the developing of research capacity is not only, it's most needed in low-income countries, certainly, but high-income countries also have a great necessity to develop research because still research is, in tobacco control and in many other areas, to tell you the truth, is an afterthought. And therefore, in order to I had to demonstrate that research has an impact on policy change and that we need the contribution of research to maintain that success and that unity that I was mentioning just a few seconds ago. And from many areas of this cycle of policy change in which many intervene. But I think I completely agree with, I think it was Sean Sample who said that he knows probably much more about that than I do, so I completely agree with him.
Any other question? No? We have another, yes?
A question or a comment or a bit of both. I think, like Angela was saying, I mean, I'm... Yeah, it's on. Okay. Yeah, like I just mentioned, coming to tobacco control, I think that there's people who have been in tobacco control for 20 years that quite often I feel very new, even though I've been in it now for 5 years. So I think there's great retention, and there's so much work to do. And I think that's part of the issue. The thing is that there's constantly more to work on. But what I feel most of all about tobacco control is that it requires so much patience and tenacity. And I was just looking at the graph that I presented about prevalence decline and thinking, how many of these countries can realistically make 5% when they're not making 30% reduction, relative reduction, right? And so what is the timeline we're talking about? And in that case, how much patience do we need? Yes, we want to accelerate, and we should be accelerating, but that strategy needs to be, I think, thought through with regards to capacity, with regards to what is it that we're going to do bit by bit to get there, and have that sort of understanding. We've got to be patient because this is going to take time. But we need that energy, and we need to keep that energy going, and that's what the end game should be inspiring. Is that energy. And in some sense, I wonder whether retention is really the issue, because in some ways we want people to leave tobacco control and bring tobacco control to everything else, so that it's not just kept in our bubble, that people everywhere are, going through, learning from here and taking this inspiration and taking it to other fields and other sectors and including research capacity.
Yes, Armando, please.
May I complete the thought by Heve? Because I think you mentioned the issue of patience is related to time. And Adriana also said, we have the FCTC for 18 years, and there's some frustration that I see that not everyone is speeding up to do that. But I want to transmit also that perhaps our times and expectations should be adapted. I'm not saying that we shouldn't go as quickly as possible, but if you look to other areas, for example, the control and the elimination of smallpox, how many years do you think it took? Because the program of smallpox vaccination by the WHO was started in the 60s, I believe, and we tend to think that it was eliminated in some areas at the end of the 90s. But there were already 2 regions that had eliminated the smallpox when that program started. If you begin to look one when was the smallpox vaccination started until the complete elimination, it took approximately 200 years. Okay, I'm not advocating to wait for 200 years for tobacco control, but I think also we have to be reasonable in expecting when you try to move millions and millions of decision makers and people and change behaviors that are related to addiction. I mean, it's not an easy task. So sometimes related to patients, I say, yes, we have to move as quickly as possible, but we have to take examples from others areas of public health in order to understand that this is not going to happen in 10 years or 15 years, because in other areas in which there was no an industry against promoting smallpox with a very effective preventive mechanism that was like vaccine, and with an era in which at least we didn't know too much about anti-vaxxers, it took 200 years to do that, okay? So again, I'm not saying we should wait 200 years for the FCTC to go into full mode, but we have to bear in mind that we're dealing with human matters, and that sometimes takes some patience.
On the other hand, on the other hand, Armando, you know, we have the vaccine of the COVID in only 1 year. So whenever we have the join of people that work together, everything goes faster. So in this regard, sometimes I have the impression, this is a thought I want to share with you, that many of us have made tobacco control as as our main topic, and we are fully devoted to the topic. And probably we have not engaged some colleagues who are like oncologists, respiratory doctors, nurses, other colleagues from the clinical field or from the research field who can join efforts with us. And so we need to be a bit more attractive to them and also make this topic part of their day-to-day life, I think, in my opinion. Because some of us, we are working full-time, but many of other people, they are working very little, and we need to engage them. Raquel, who wants to say something?
Well, to keep going in that thought, Cristina, I think the difference between, what's the name of the disease in English?
Smallpox.
Smallpox and COVID is that in COVID, we have the media every single day saying how many people died for COVID. So this is very important, media. It's key. If we have the media in our side, if we hear in the media every single day how many people die for tobacco, same thing with car accidents. You see how many car accidents campaigns we have, and the amount of people dying from them are quite small compared with tobacco. So we really have to work with the media. We really have to get our message there. We have to be blunt. The media sometimes are tired of like, well, obviously they use like research that are published to get their news, but some media like something that is quite impressive. So sometimes we have to look for that thing that the media is looking for and take it into our bands and use it. Sometimes something happens and we can say, okay, we can use that argument to put that other argument in the news. So just, I think that it's something we could keep in mind, just a thought.
We have, yes.
Just, I was making the argument of patients not so much to justify to be slow. I think the COVID is true, there's a lot of people vaccinated, but there's also many, 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 many cases out there still. And my argument was going to these, especially those people in harm reduction that are saying, oh, this thing, the traditional policies embodied in the FCC don't work. I'm sorry, they started a few years ago and you haven't given them a chance. So that's what I'm saying, that sometimes we need to give them a chance, not 200 years, obviously, but a little bit of time. Sorry, Luke.
I think we have another comment and then a question.
On this, so on that point, I just will follow up on this a little bit, because on this issue of patients, I've heard from funders who fund tobacco control a frustration that we're not going fast enough. That, you know, for example, oh, you increase taxes. We look at countries like France, for example, they've done really good with their tobacco control overall, but their prevalence is still at what, close to 30%? So there's this frustration that we're not progressing fast enough. So in this, I want to go back then to the media comment that Raquel just mentioned, because I do think that the end game message could be, again, those, how do we create a vision that inspires and motivates the general public? And I think in a way framed well, maybe an end game message and a way of ending an epidemic that's commercially caused and could be addressed, maybe that is a way that could get things in the media, maybe accelerate things.
Thank you. A question. Oh, there is a question from Luke.
No, it's a comment. So the comment is, what are you complaining about? So Laurent was saying, comparing the situation of 20 years ago, I would compare the situation with 40 years ago. 40 years ago, when you look at the situation of tobacco control and alcohol prevention, we were at the same level, nowhere. 40 years later, there is progress, and you can see the results. It's going slowly. For instance, in Belgium, it took us 20 years to have an advertising ban, but it's going there. You should not complain. It's one of the things where you see some results. It's going always slower than you would expect, but it's efficient.
You know, and I agree with you. We have a lot to rejoice, but there's an equity issue. We've made a lot of progress among the higher socioeconomic strata, but in the lower socioeconomic strata, not as much. So I agree, we have a lot to rejoice. I remember 40 years ago, in universities, people were smoking. I remember, you know, in Spain, I remember, you know, attending university classes and having to get out because I couldn't breathe. And I even knew people who quit university because they couldn't stand the smoking classes, so that would never happen today. But I think there's still an equity issue because I'm not so sure we adequately protected the entire population. But you bring a good point.
Quick.
Yeah,
Yes.
just quickly, because we mentioned about we start already discuss about the barriers and why we are not going so quickly. And there's many barriers, and we also mentioned, good point, Raquel, about the communication, because really the tobacco use is also, I think that it's communicated diseases. And we have also to raise awareness of the people and not to do just 1 point or just one in a year, the All Know Tobacco Day, some communication information, but also continue to inform. And about the barriers, about the tobacco industry interference, we practically every day, and during the last month, I received the information from the country on everyday basis that the tobacco industry interfere with the legislation. You already mentioned about the Georgia case. There was recently a case in the Kazakhstan and others. And the tobacco control forces in the country have also deal with litigation, with the barriers, communicate, and also implement. Therefore, it's very difficult. If you put in place strong mechanisms to protect the tobacco issues, to have the leadership, it will be much easier. But also we have to deal every time with many challenges to go ahead. Thank you.
Thank you. Adriana, please.
Hello? Yeah? Okay. No, I think really with all due respect, Armando, I don't think that comparing with something that began in 1796 is very fair because it was a different situation, okay? I agree that probably I'm more there is a lot of impatience around and we perhaps are not recognizing as much as things move. But this is something that can move quicker, okay? Because things are not moving because one main thing, that is the tobacco industry. So I don't think, and we have been changing. I remember still when we were beginning to pass a legislation and we say, only Article 8, don't put Article 8 and 11 together because it's going to be so difficult. And now we are passing vast legislation with the whole convention in them. So things have changed. So we expected also things to change more quickly. But really, my impatience is not because of what we get. It's because I cannot, personally, and that is not even as a head of the convention, personally, as a person who worked in tobacco control for more than 20 years, I cannot accept that just because one industry is stopping us, the rest of the world need to keep on paying with 8 million people each year. So that, my frustration is that point, that we should move faster because we can move faster in the 21st century now.
Thank you, Adriana. We have 4 minutes. There is one more question, I guess, and then.
Thank you. One new question from the chat is from the Spanish chat by Laura. The question is, congratulations for the symposium. Do you think that the tobacco industry has any role in the withdrawal of Champix Zintabac, that is varenicline? Anyone could answer this one? The question is, do you think that the tobacco industry has any role in the withdrawal of Champix or Zintabac, that is varenicline, from the market? I guess it's a very speculative question regarding a black hand. If no, just skip the question.
Then I guess we are ready to close. And as for the closing, I just wanted to make a last remark about the time and being patient. We do know that time is a concept, and nowadays this concept, everything is moving very fast because of the technologies. But I remember myself when I started working in tobacco control back in 2015. We were working with the previous government, and we didn't get the bill, we didn't pass the bill at where we worked on that bill for 6 years. And I was so devastated. I thought 6 years, it's such a long time. I was so tired, the team was exhausted, all of us. So for us and for me, 6 years was such a long time, because when you are working very hard on something, and as we said, the science is there, the arguments is there, and we know people support us. Most of the politicians support us, but then of course there are the industry and the forces and the lobbies, so we know. But at that time, it felt like 6 years was such a long time. But then, of course, we started over with the new parliament, with the new government, and we got the new bill in 2 years. And that was very fast. That's what we wanted in the first place, but we just had to start over all over again. So I guess now we do achieve the results relatively fast, but I think we should dream for more, ask for more, and well, and then that's how we evolve, and that's how we get the changes moving on even faster. Thank you so much for your time and for questions. And thank you to all of the panelists, the round of applause for the panelists.
I ara ja li poso amb ell?
No, posa aquesta primer i després quan l'introdueixin, no? Potser?
Sí. Escolta, em falta un.
Sorry, that's on me. We are going to finish with the latest session of this symposium that is dedicated to the presentation of a tool that most of you already know about. And that is very well located in the time frame that we have today, notably because it's a good opportunity to sum up a lot of the tobacco control policies and the possibilities for, and also really to assess where we stand across Europe in terms of the implementation of tobacco control policies in order to achieve this tobacco endgame, which is kind of the final process, as was discussed by Ruth and Luc just before. So on this, we have our first speaker, which is Luc Jossens, our special advisor at the Smoke-Free Partnership. So Luc was previously an advocacy officer at the Association of the European Cancer League. He is a tobacco control expert. He was a tobacco control expert within the Belgian Foundation Against Cancer and an international expert on illicit tobacco trade. So since 1994, Luc has published several scientific articles on cigarette smuggling, and he has advised the World Bank, the European Commission, the World Health Organization, the US Surgeon General, the International Union Against Cancer, the Association of European Cancer Leagues, the Framework Convention Alliance, the Bloomberg Initiative to Reduce Tobacco Use, and many organizations about smuggling. So I am going to pass it out to Luc.
So thank you, Chloe. So according to the Spanish chat, people like this seminar because there is no football and they will not discuss about football. Well, I'm coming from Belgium, and since yesterday, I don't want to talk anymore about football. So I'm sorry, we'll talk about tobacco control, which seems not to be efficient, but we will see. Okay. So it's my pleasure to present the tobacco control scale on behalf of the 4 authors of the tobacco control scale. And the tobacco control scale is 16 years old. I guess it would fit in the definition of Armando that it's policy, that it's article which could serve the results, that the results serve tobacco control policy in relation to that. So we have tobacco control. The first was article in tobacco control in 2006. And we have a report in 2007, 2010, 2013, 2016, 2019, and now this one. The article has been quoted quite a lot over the last 15 years. These were the results of the tobacco control scale in 2019. It involved 36 countries. So you had some leading countries, and then countries with a bad score. Here you see in red, and the 3 countries with a bad score were Germany, Switzerland, and Luxembourg. So the whole question will be who will be leading again the tobacco control scale and who will be in red. The first question, one of the questions is, okay, you have the tobacco control scale, which describes tobacco control policies in now 37 countries. It is an efficient tool. Yes, we have Ariadna, who did some research in relation to that, and countries with a higher tobacco control scale score in 27 EU countries have lower prevalence of smokers and higher quit ratios over the last decade. So it works. This morning, you had already the presentation by WHO, by Heber Gouda, about empower policies. And empower policies, if they are well implemented, lead to less smokers and to less deaths. So the most efficient one in the period 2007 and 2014 is taxation. The second one is smoke-free, then health warnings, advertising ban, and smoking cessation support. So it's important that both in the tobacco control scale, we see the same policies, and we see also the priority. The priority is taxation smoke-free. So the tobacco control scale is based on 6 defined effective tobacco control policies by the World Bank, Empower, WHO. And at the beginning in 2006, we had a group of experts. We have to define which policies are the most important. We know that all these policies are efficient. Which one is the most important? And the group of experts agreed that the most important was prices, 30 points out of 100. Smoking restriction bans, 22 points. Tobacco control funding, 10 points. Advertising ban, 13 points. Smoking cessation, 10 points. Labeling, 10 points. Last time we added some additional points, which was not based on to some extent to the World Bank policies, but still linked to the work of the FCTC and the World Health Organization. 3 points for combating illicit trade, 2 points for tobacco industry interference, and we want to punish those countries who didn't ratify the FCTC. In Europe, it's not that difficult. There are not that many who loses 1 point. So that's the scale. So for this, this is now the 7th time that you have to listen to me for the tobacco control scale. And we looked at the legislation which was implemented on the 1st of January 2022, cigarette prices of 2020, the tobacco control budget of 2020. So if there was some legislation enforced after the 1st January 2022, this is not included. We made some changes in relation to prices. So we looked at, for prices, we looked at the weighted average price in the EU countries, and then we take a correction for purchasing power. Previously, we used the gross domestic product per capita expressed in purchasing power standards to take account with affordability. But there is some problem with the gross domestic product in the sense that it's very good to define the wealth of the country, but not always the income of its citizens. And it might influence, for instance, in some countries where it's artificially transfer of profits generated in other countries. So we have to look at the income of the smokers, not at artificial transfers of money. And for that reason, we used for the purchasing power the international standards in the same way as the WHO report, the Global Tobacco Epidemic 2021. So what are the results so far? 11 countries in the region have implemented plain packaging, and the highest score goes to Turkey. Finland will also implement plain packaging next year, but not yet for the 1st of January 2022. We have in the 7th ranking of tobacco control scales in 37 countries, because we added this time Bosnia-Herzegovina. We have in total 9 leading scores, 11 satisfactory scores, 17 unsatisfactory scores, and 5 problematic scores. So let's look at the countries which made the biggest progress, the 2 countries which made the biggest progress over the last 2 years. And the last 2 years were rather difficult in the sense it was 2020, 2021, it was COVID years. During these 2 years, 2 countries made a big progress, and that's the Netherlands and Denmark. If you see, for instance, the tobacco control scale ranking of the Netherlands and Denmark between 2005 and 2021, it's interesting. Let's take the case of the Netherlands, the blue line. In the 90s, the Netherlands was a problematic country because they were part of the blocking minority to block the EU tobacco advertising ban, together with the UK and Germany. These three countries blocked in the 90s any effort in the EU. At the end of last century, he had a very dynamic Minister of Health who changes, and the Netherlands was doing rather well and 10th in the ranking. 10 years later, in 2010, the new health minister was defined as the Minister of Tobacco Industry. So the Netherlands was not doing very well. And over the last 3 to 4 years, have a new government with a dynamic Minister of Health who wanted to organize the COP and the MOP in the Netherlands in 2020. They failed as a result of COVID, but they introduced generic packaging. They banned smoking rooms in restaurants at the workplace. They increased prices. They increased the budget. They ratified the illicit trade protocol. They banned the display in the shops. So they have been doing lots of things. And so it's a clear example that if you have a political will, if you have a Minister of Health who's determined, you can make a difference. And that's the message, what we learn about the Netherlands. Denmark has been doing also well. It's a country which has introduced plain packaging, which has banned advertising at the point of sales, a display ban. So they mentioned also different measures, and they have been made a big of progress. So the lesson of this is, with political will, you can change things, and with an action plan. So now the question is, who are the 5 countries with the lowest scores? What are your opinions? So during the last score, Germany had the lowest score. We presented the results in Berlin, and when you were in Berlin, you could see still advertising ads on billboards. So will it be Germany again, or will it be Switzerland? Switzerland is the only country which has not ratified FTC and has the worst law on tobacco advertising in Europe. So these are the 5 scores in 2021. So the lowest score goes to Bosnia-Herzegovina because it's doing not well on most policies, but there is some positive news about Bosnia-Herzegovina. They have adopted new legislation, and that will come into force next year. So I expect that in the next edition of the tobacco control scale, Bosnia will not do as bad as this one. Then we have our usual candidate, Switzerland. Remains the favorite of the international tobacco companies. They had a referendum in February 2022. A majority voted in favor of the referendum, and which approved restrictions on tobacco advertising, but not a ban on tobacco advertising. So Switzerland, over the years, remains problematic. The third last country is Serbia. Probably it's as a result of COVID has not implemented major new initiatives. And then we have Germany. So the last time Germany was at the lowest score. And we have to say the score of Germany is still low, but there is some progress in Germany. So we have the advertising ban on billboards, which was introduced a year ago. The advertising for heated tobacco is still allowed until the 1st of January next year. They have also this strange thing, which is similar to Switzerland, that they allow advertising in cinemas aimed at adults. So that's the new thing in countries with a lot of tobacco industry interference, the difference between aimed at adults or not. The last country which is not doing well is Bulgaria. cigarette prices in Bulgaria are the lowest in the EU. Of course, if you take the price of a pack of cigarettes is 4 times higher in Ireland than in Bulgaria. And even if you take account with affordability, the pack of cigarettes in Ireland is twice as high than in Bulgaria. So Bulgaria could do also better. So that's the 5 lowest scores. Which are the scores which are below 50? We have, in the first place, Ukraine. But Ukraine is a little bit special because they had introduced a very extensive law in the beginning of the year. And for instance, what they do is to tax heated tobacco products in the same way as cigarettes. But then since February, the situation has completely changed. Slovakia is not doing well either. But recently they have increased the price of cigarettes over the last 2 years. But since we take account with the price of 2020, the score of Slovakia remains low. Portugal, the score remains low. There is a new law on smoke-free legislation in bars and restaurants. It still allows smoking rooms, but it's not implemented the 1st of January 2022, so it's not taking account. Luxembourg has profited of the change of measurement of affordability, but despite the fact that with the new measurement, the price of cigarettes in Luxembourg, taking account with affordability, remain the lowest. Cyprus, the score remains low. Austria made some big progress in the last tobacco control scale, but it's just a little bit less than 50 points. And then we have Latvia. We have also 5 countries which have a score of 49: Estonia, Croatia, Czechia, Poland, and Sweden. Sweden, that's a surprise. That's the first time that they are in orange. And their neighbors, their closest neighbors, are doing very well on prices. Norway, Finland, Denmark, but not Sweden. Sweden has not plain packaging, so the score of Sweden is also disappointing. What is the rest? We have Lithuania, Russian Federation, Italy, Slovenia, Malta, Greece, and Israel. They have scores between 52 and 55. And we have the scores of which almost reach 60. Denmark, but Denmark made a big progress. Turkey, 58. Spain. What about Spain? Now I have to be cautious. So they made some progress on smoking cessation, but they are not doing very well on prices. I'm collecting data for WHO on prices of cigarettes, and each time when I see Spain, it doesn't increase. The average pack of cigarettes in 2020 was for less than €5. In neighboring country is €10. So certainly on prices is something wrong. There's also no progress on plain packaging. And the last country is Belgium, 59. So there's something special about Belgium that they introduced an advertising ban at the point of sales for cigarettes, tobacco products, and e-cigarettes. And Belgium is one of the countries where there is no heated tobacco. You cannot buy it online, and there is no way to promote its products, so it's not attractive for ICOs, and I think that's very positive. So that's the satisfactory countries. And now we have the 9 leading countries, and so the question is now, who is the winner? Ireland, Iceland, UK, Norway, France, Finland, Netherlands, Hungary, Romania, and now. Okay, that's the new score. So the leading countries are Ireland and the UK with the same amount of points. The third one is France, and then the Netherlands is a surprising fourth, fifth Hungary. Then we have Norway, Finland, Iceland, and Romania. So these are the 9 leading countries. If you want to study tobacco control policy, this is the most important table because it's simple. I've been hearing a couple of times that results have to be simple. This is simple. If you show this to a politician, even a politician will understand this. So I only one politician who I insulted now, but so let's take the example of the Netherlands. They made progress in different areas. How can they improve their score? Well, they can improve their score because they have 15 points out of 30 from prizes. So if the Netherlands want to improve the scoring, they have to do something more about pricing. The same with Spain. They should do something about prices. This, of course, or Luxembourg or whatever. So you have a clear overview of the different policies, and you can clearly see which policy you have to improve. If you want to have more results, I hope it should be now on the website. It's on the website, okay. You will see this map, and you can search the results and the report at this website. That's the reference, and so it's available at tobaccocontrolscale.org. The final slide is the thank you slide. Thanks to Martin Rowe, with whom I developed the tobacco control scale in 2006, to European Cancer Leagues, who supported the tobacco control scales over the last 10 years, to ICO, Institute Catalan of Oncology, to the health program of the European Union, which co-funded this research, which are not responsible for the results, and to Smoke-Free Partnership, because it's a report of Smoke-Free Partnership. Thank you very much.
Yeah, okay. Thank you so much, Luc. And I also wanted to, on behalf of Smoke-Free Partnership, return this thank you, because we know firsthand how much you committed and you dedicated a lot of your time, energy, and notably, really, like we know the commitment that is needed to have such, a useful tool for policymakers and also us, the tobacco control community, for keeping and creating this tool alive. It's been years long and more than 10 years long commitment, as you rightly said, and we're very happy that you're here continuing delivering on this. So I'm going now to introduce our next speaker. It is Ariadna Viladiu. So Ariadna holds a degree in biomedical sciences from the University of Barcelona, a master in public health at the University Pompeu Fabra, and the Autonomous University of Barcelona, and a PhD from the University of Barcelona. So she was a predoctoral researcher at tobacco control units of the Catalan Institute of Oncology, and she did her PhD at the University of Barcelona on the evaluation of the impact of tobacco control policies in Europe and on smoking indicators and socio-economic factors. So her main area of research is policy evaluation for cancer prevention, and she has a special focus, of course, on tobacco control. Now, Ariadna, it's up to you.
Thank you, Chloe, for your kind introduction. And I would like also to thank the organizers, Deva, Christina, for the opportunity to be here and to be back home. And so today we want to present to you the tobacco control scale website a bit more in depth because, as Armando has said before in his presentation, knowledge dissemination is key, and research and advocacy need to go hand in hand with communication, of course. And we think this website offers this opportunity to spread the results Luke has just presented. So the tobacco control scale website that you have now on the screen was started as a shared initiative between the Association of the European Cancer Leagues and the Catalan Institute of Oncology, and it was launched in the European Conference on Tobacco or Health in 2016 in Oporto. And the main objective behind this website was to gather all the information regarding the tobacco control scale together, since till then the information was spread across different websites. So the website, as you can see, well, now, first of all, just to say that here you have the information of the 2021 tobacco control scale report. You can download it here, and you also have a press release with the highlights of the results that Luke just presented. But this website also explains the history of the tobacco control scale, how it started and how it evolved over the years. Also summarizes the scale rationale and its methodology, including the changes made over the different editions that Luke explained before. But what we think is most important is that it compiles all the reports together, and also all the available PDFs. So here in the report section, you can go over all the editions, the latest one and the previous ones. And if you click inside, you could also see the main results, as you can see here, because it presents the main results in detail, not only the total score presented by Luke, but also how each of the domain individual score, and also recommendations for each specific country, as you can also find in the physical reports that my colleagues Anna and Marcel have just handed out to you. But today, what I would like to present to you is two new features that we have recently, well, relatively recently added to the website, that is a graphic creator and a repository of publications. So the graphic creator is an interactive tool that allows users, first, you can map the country's thesis scores for each of the years. So as you can see here, countries are colored in green or red depending on their total score, depending if it's over 50 or under 50. And if you hover the mouse over the country, for example, Russia, you could see the table with the individual scores for each one of the policy domains. So we think this is a nice tool to also prepare presentations, or when you meet with policymakers and other advocacy stakeholders, to show them a bit more interactively how to compare countries in one specific place. Oops, well, you can make it bigger if you want to. And you can go through different years. We also have the results a bit more in a bar chart for every report year, in which you can compare the countries and also the total scores, but you can also break them down according to each of the policy domains. And if this graphic is not clear enough, you can also choose to compare only price or smoke-free laws, for example, and also change year by year. And finally, one of the features that we think is most relevant is this evolution charts that we can prepare, because, for example, for the ranking, as Luc presented for Denmark and the Netherlands, you could, for example, choose, as we are in Spain, let's choose Spain and some of its neighbors like France or Portugal, for example. And here you can see how the different countries have changed their ranking position over the years. So from 2003, that was a first pilot study, to 2021, that is the most recent one. And not only we can see these results for each year, we also have a summary of the ranking score to make it more easy to see. But if we can see this not only for the ranking, but also for the total scores, in which case we can see this bar chart comparing the countries as well as before. If you hover the mouse onto the different years, you see the comparison of the exact scores, but you can do the same for different policy domains, for example, advertising bans. The second feature, well, and we can also maybe compare the top living countries to have another one, United Kingdom, for example. And here you see that it's more or less similar scores over the year. And I think it's a nice tool also to prepare your presentations and to make your lives a bit easier if you want to prepare some materials for advocacy purposes and also for research. And finally, the second feature I want to introduce to you is the repository. So this tab, what we've done is compiles all the peer-reviewed publications citing the tobacco control scale included in PubMed and Web of Science. And here you can find the latest publications in 2022, 2021, and 2020. And for example, here you could also find the adaptation of the tobacco control scale that we did for Latin America that was published in 2021. And you also can have previous publications that go back to the first tobacco control scale report, that is the last one because it was the first one, of course. And so I would like also to invite you all to send us your publications if you want us to include them in this website, because of course we are checking PubMed and Web of Science repeatedly over the year, but there are some publications that must not be included, or if you want them to be ready after publication here, you can send us an email. In the email, you can find it here in the Contact Us tab and topcontrol@iconcologia.net. So I would like to invite you all to visit the website and use these resources both for advocacy and research purposes. And finally, before ending my presentation and let you ask all the questions to Luc and to us, I would like to use this opportunity to have a bit of an advertising break to encourage you all to cite the PDFs of the reports from the website when you reference the work on the tobacco control scale reports, to help us also reach wider audiences and to spread the word about this work we've done. And that's the end of my presentation, and thank you all for your attention.
Thank you. Thanks a lot, Ariadna. So yeah, we know how important communications and visually appealing data are to make the case for tobacco control policy and change. We discussed it previously, and indeed it's super important that everybody here is involved in sharing the data we have and helping each other to increase our outreach. Also, thanks a lot, because I know the personal commitment that you had in this work, and this is not something that is so common, so thanks a lot for this. So now I'm going to open the floor for questions. We still have a bit more than 20 minutes for this, so we have some time to have some interesting discussions. I just would like to open the floor with one question for our speakers. So you've been working on this data, both of you. You've been researching for years and you've been analyzing the trends on tobacco control policies across Europe. And probably you have identified some tobacco control programs that are more easy or more easily advanceable, so that help advance more easily than others. And so I was wondering if, as before we were mentioning the situation 20 years ago and 40 years ago, so how do you assess the situation taking this into account in 20 years up to now?
What is striking that you have some, if you look at the situation of tobacco control over the last 40 years, you see that some issues, some policies become a main target in a specific period. At the beginning, in the 90s, it was all advertising. And when we discussed negotiated the Framework Convention on Tobacco Control, there was only one major agenda. It was to have strong obligations on advertising. That was the 90s. Then from 2020, you had labeling, and you had smoke-free legislation with Ireland being the first country to go completely with a smoke-free legislation. So you see, if you look at the history, you have always leading countries. The leading countries on advertising was Norway. The leading country on smoke-free was Ireland. The leading country on pictorial health warnings was Canada. The leading country on plain packaging was Australia. And the leading country, perhaps, on taxation are Australia and the UK. And they follow the example of those countries. So it's important to have leaders, that it's feasible, and then you can make some efforts and progress on policies.
Thank you. Thanks, Luc. Ariadna, you have anything to add?
Yes. Well, I have a less broad perspective on this than Luc, of course, because I've been here for less time. But I would like to add also in the perspective of research a little bit. So we've been looking at evaluation of the impact of these policies. And as Luc showed, we've learned that they work. They are getting us to the reduction of prevalence and also engaging smokers to quit. So, but we see that these policies are having different impact on different populations, and there are some populations that are being left a little bit behind. So what I see for the future, because you asked this, is also engaging countries to have a more targeted or more directed policies for these groups that are a bit left behind, like also have presented about females not being increasing their prevalence, or also lower socioeconomic groups. And we need to have this in mind to think not only of population-based interventions and policies that we know that they work, and I agree with Luc that we have had progress and we need to continue with this line, but of course we also need to think of these groups of population that are having more difficulties to get impact from these policies to be able to bring everyone to this tobacco-free generation that we've been talking a lot today about.
Thank you. So now I'm gonna open the floor to the questions we might have in the chats.
Yes, we have another question by our most influential influencer, is Sean Semple. He's saying, great to see this new TCS data, thank you. Are there any plans to provide individual data for the 4 separate countries in the UK? I think Scotland would perhaps be at the top of the league.
Luc.
Listen, it is already so difficult to have data from 37 countries. If we want to have data from the different regions of countries, of states within countries, Then I would see a similar request from Spain. So, of course, well, it could be interesting, but it's a little bit difficult to get data. One surprising thing about this one is the collection on data on tobacco control budget. So we used specifically the data of 2020 to use the data of the Global Tobacco Epidemic Report. And then you have already the prices over there, and we have already also the tobacco control budget. In the 2021 report, no country in the European region reported their tobacco control budget for 2020. No, but that was as a result probably from COVID, and there was some other constraints. But anyway, that's complicated. And for the first time that we launched the tobacco control scale, we asked, that's the only country where we asked the UK to have the data on the budget in the 4 regions: England, Scotland, Northern Ireland, Wales. The first time none of the 4 didn't reply, even Scotland. So I asked the data for Scotland on the budget, and they said we will put a parliamentary question, and had no reply. So it's a little bit, so we did an effort to take account with the specific situation of Scotland, but if they have all specific data and scorings for different regions, I don't talk about Belgium, then we would have the Flemish region, the Walloon region, the Brussels region, and in the Brussels regions you have the Flemish part and the Dutch French-speaking part. So it would make things more complicated.
Thank you. So are there other questions either? Yes, so we have Laurent to start. I see there's several people. So let's start with Laurent.
So I have a question relating to given the topic of the symposium today, and the first presentation that Ruth made this morning, addressing the retail environment and the supply side. Is this something that will be included possibly in future tobacco control scales, to have another indicator that looks at retail environment or licensing of new tobacco stores? I'm quite upset with what happened in Spain, where there's been the authorizing of new licenses for tobacco retails, and a lot of them along the French border, and you know the price differential between the two. So that goes against EU objectives, global objectives, et cetera, et cetera. So is this something that will be included in future tobacco control scales?
I have to admit something. When we discussed the advertising ban in Belgium, we had almost a complete advertising ban except at the point of sales. And at that time, I thought, is that really important? Smokers go to those displays. Well, you have to accept something. But what I could foresee was that if you ban it in advertising in all media, and there's only one media left, then it will become more important. And so the point of sales has become really important. So we take account with the tobacco control scale, the display ban, and the advertising ban at the point of sales, and we increased the scoring over the years from 1 point to 2 points. So in total, it's 4 points for things. If it comes to the distribution system, so the one of the interesting ways to control tobacco is in Hungary, where you have a limited number of shops, and you have to find where they are. In the Netherlands, they want to reduce the number of shops, but in 10 years' time, honestly, that's a little bit slow. It's difficult. So that's the limitation of the number of outlets can be important, but it's difficult to judge, and I don't know to translate in points. For instance, France has a system where the tobacconists are almost the only place to sell. It's not on supermarkets. It's has to be seen in the total policy. So it's a little bit complicated. It's certainly an area which is important. I think what Hungary has done is quite remarkable. To translate it in points could be interesting, but not so easy.
Thank you. Yes? So I'm going to ask, sorry that I didn't say it before, but if speakers could just introduce themselves before they start talking, that would be great.
Yeah, sorry. This is Raquel Fernandez from No Fumadores in Spain, and I was going to comment on the point of sales advertisement. I don't know if this is happening in other countries, but now in Spain, one of the things that's happening is like the point of sales here in Spain, except in the Canary Islands, you can only sell tobacco in tobacco stores. And so now they have these big windows, and there are big screens. You know, now it's not a stationary advertisement. Now there are screens where they publish from ICOs to all kind of e-cigarettes, but also tobacco, which can actually be seen from the outside. And not only that, in those tobacco stores, there are minors coming in because they also send stamps, and now they are amplifying their products. They sell candy, they sell magazines. So it is really important to ban and to introduce in the scale the ban, the advertisement in the tobacco stores, in points of sales. Actually, from my point of view, actually, even the package should be hiding behind curtains or something, because that's another way of seeing the tobacco advertisement. It's just common.
But
Thank you. Yes, look.
it's in the scoring. There are 2 points for advertising on point of sales and 2 for the display ban. And I was recently in Latvia, and they have, for instance, a display ban. And what I said already in relation to Belgium, it's important. What we see now is ICOs all over the place. At the airports, so it's not cigarettes, so it's okay, and things like that. So it's important that you have the display ban or the advertising ban at the point of sales, both for the tobacco products and the new products, and that happened in Belgium, and so we don't have ICOs. So that's when you go to Lithuania, you see these fabulous ICOs shops in the most luxury states. You see them all over the place, and I guess the novel products and the way they are promoted, also typically for Germany, that they allowed the advertising on billboards for heated tobacco still a year later. That's also important. So we will be confronted with the advertising of the new products more and more clear.
So regarding the ICOs that you mentioned, maybe it should be interesting to enter in the index countries that consider the ICOs device as tobacco, and the ones that who doesn't consider, in the sense that this is the thing. If the ICOs per se, the device, is not considered tobacco, that's why we see the advertisement all over the place. If we're considered a tobacco product, its advertisement and publicity should be banned together with all tobacco products. So that's I think it's quite interesting there.
Thank you. Anyone else has something to add? Yes, Lilia.
Thank you, Lilia Olivier, Smoke-Free Partnership. Thank you so much to Luke and everyone, and the co-authors and those who presented. My question was about one of the major concerns, according to the report, and that you already mentioned, Luke, the lack of funding. So what I was wondering, if we compare now to 40 years ago, how was it with the funding? And the second part of the question is, can we interpret the lack of funding as a sign that, we've been just discussing in the previous panel that there is a feeling that the process has slowed down. On the contrary, there is another feeling that the job is done. And this could be probably one of the explanations that, well, we are doing well with tobacco control, right? So then maybe we are not dedicating funding to that. We are just giving funding to NCD. Well, tobacco is part of the NCD, but still. So there is a remaining big question, because if the trend remains and there is no funding for tobacco control, it means that there is no funding for people, for research, and the broad community of tobacco control experts who are working in the field will not have funding to continue working. What's your perception on this matter? Thank you.
Well, 40 years ago, the funding of tobacco control was very, very, very limited. So in most European countries, you had some countries where you had an ASH type of organization, and this was normally 2, 3, 4 people, and they were very active, and they obtained some result, and they were active in a couple of countries, but there was almost no funding. What has changed, at least in the European Union, was with the first cancer plan. Then there was some funding and for projects and things like that. So things improved over the years. But on the other side, you see a country like the UK, which at the beginning was known also for the media campaigns. Now nothing is happening in the media campaigns. And the UK is still number 1. That's a result because their price policy is, together with Ireland, among the best. But there is no funds for media campaigns. So they would need a new action plan, and they are discussing also the funding which should come eventually to a levy on the tobacco industry. That's the idea they proposed. That's also being discussed in Belgium. So we have to see new ways to have funding, and a levy on the high profits of the tobacco industry could be a way out of it.
Thank you, Luc. Up to you, Francisco.
Yes, Francisco Rodríguez Lozano from Spain, and more specifically from the Canary Islands. Let me say that. Well, congratulations for the edition, and congratulations for the webpage, excellent. But allow me to say something regarding the difficulty that I understand to have different consideration in different regions. I understand. I know Belgium, and I know the crazy that is the differences. Even in Brussels, you can find that's crazy. But of course, there's strange examples like the Canary Islands. We know in Spain we can agree with all what has been said here, except in the Canary Islands. That is a very, very critical exception, because it's absolutely different to the rest of the world. It's the paradise of the tobacco industry. It's the paradise of the weather, but the paradise in several aspects. And I would like, and I'm sorry for maybe the Ministry of Health of my country will not be happy with what I will say, but I would like that my country will be punished by this, by allowing these differences for the health of the people who live in the Canary Islands. I think in a positive manner, of course I don't want to be, but I think it will be very positive. We live from the tourism in the Canary Islands. We live from the image that we are giving in Europe to the European citizens that are our main customers in the Canary Islands. If we are able to present an European tobacco control scale where we say that this is the hell, this is terrible, this is unacceptable for the European level of levels of health that we are accustomed, we are used to, maybe you could make us a great favor. I don't know if it's possible, but of course you can count with all the help from the people who live in the people who live in the Canary Islands and are devoted to tobacco control to help in this, because I think it will be excellent, excellent. I'm sorry for my colleague from the Ministry of Health, but I think it's unacceptable that in the 21st century we have a part of Europe where it's allowed to sell tobacco everywhere, to make all type of propaganda, all type of promotion, of sponsorship, everywhere. In the cultural events, in the official museums, you can see the tobacco industry promoting everything. when you can go to everywhere to buy tobacco, and children can go there and see all the propaganda, all the advertisement, and that's, for me, is unacceptable. I know it's not a problem, but it would be great if you could make this effort. Thank you. Sorry. Sorry for this.
Yes, Luc, just please all be aware that we don't have much time left, so I will let Luc answer, and then our latest question, and we will close. Thank you. So, Luc.
Well, Francisco, of course you are right, so I cannot disagree with you. If you see the price of cigarettes in the Canary Islands, that's problematic. But where do we end by that? The next question will be on Gibraltar, and so we, of course. So I don't know what to do with your question. Next question.
Well, it's just the comments, and just to reinforce how important it is to Sofia Lavada from Portugal. We have the same problem in Açores, because Açores is not only a producer, but has a fiscal benefit like this, because it's considered, it's an island, it's a less developed region of Portugal, and the tobacco taxes are very low. They call it a tax benefit. And again, research is important, so we did with our fantastic colleagues from University of Santiago Compostela, we analyzed smoking attributable mortality in all regions of Portugal. We are a tiny country, we have 7 regions, but we are a very diverse country, and it was really interesting to analyze the difference that show that once more tobacco is reinforcing health inequalities in the regions. And Açores, because it's a local producer, so the cause is rooted in the region and has this fiscal benefit, had a devastating death rate for all, in the 2 genders, because there are also many differences in genders, and as you know, there is a delay in mortality regarding genders, because women, they began smoking later than men. But in Açores, even in women, they always top, they rank in the top regarding mortality in all groups of diseases. So I think we could also work together and show to the EU that this is completely against fighting health inequalities and social inequalities, which is actually a main concern for EU and for sustainable development. And we have to ban these fiscal benefits and these measures by region. Thank you very much.
Thank you. Okay, so we might have a leader room for the last question.
Olena Tegova from Catalan Institute of Oncology. Thank you very much for your presentation, and congratulations for your great work, because we saw beautiful graphs today, but there is a lot of work receiving reports from each country and putting it together. I will stick to the geography questions we had here. I was wondering, because we can see that every year we have a few new countries that you add. We're expanding a little bit towards East, I think, Europe East. I was curious, the new country you add, usually it's country itself that volunteer to be included into the tobacco control scale, or you sometimes approach them and offer? Because I think it's a great tool to inform policymakers, general public, and use it. It's a very useful tool. Question first is, what is the process to add in new countries? And second, if you would like to expand, what would be your next steps? Thank you very much.
Luc?
Well, so the discussion about new countries is, in the first place, you need to have an expert who is willing to provide some information. If you don't know anybody, it's not feasible. So, for instance, in the case of Israel, the last time it was a proposal of the people of Israel saying we would like to be part of the tobacco control scale, and we are willing to provide the answers. In relation to Bosnia and Herzegovina, we approached them and they were willing to provide the answer. But that's not enough. problem is you have to try to control the answers. So it's quite a lot of work. I know we had a discussion with Estebe and one of more countries, but you have to control all the information to check. We have to check with the data from WHO. That's the reason why we use the Global Tobacco Epidemic Report. We look at legislation, at tobacco control laws from the US. So you have to check the information. So it's and sometimes you need to have the price. So it's more work. So the initiative sometimes is from there, sometimes from us. But the idea to have suddenly 5 or 10 countries more is a source of complication. But I was yesterday discussing about Georgia. Georgia could be a useful country in the sense that they have active people, they have the plain packaging, I hope, if it's not postponed. So that could be useful. I think we will find the right persons to do so. But I'm reluctant to add too many countries because it's not just we sent a survey questionnaire and there we add, no, you have to at least to do some checks, ask for more specific information, things like that. So we are doing it slowly at their request, at our request.
Thank you. So we are ready to close. Just one last word. I think it's very interesting to see that finally we always get back to what should be prioritized to really optimize our fights, and also to question and open the door to always questioning the way the messages are framed. Of course, this tobacco control scale, when countries are in green, that doesn't mean that everything is acquired, everything is okay. And let's just take these countries as an example. It's good to question and to feed into these debates to increase our outreach and potential. So thanks a lot for these discussions. We could have continued going over and over again. I encourage us to just continue afterwards. And I'm now gonna just ask you a final round of applauses because this was really an important work that was carried out by these two speakers. And now I'm passing it over to the closing conference.
Thank you, Chloe. This has been already an excellent day. And before presenting our last speaker, I'm told that I should give you a small announcement. At the end of the lecture, there will be a family photo. So call your hairdressers, call your makeup artists, because, and also the ones in the streaming, if they come here, they will be in the photo. If not, they will not be in the photo. It is my great pleasure to present the speaker of our closing conference. Surprise, surprise, is our beloved Professor Esteban Fernandez. You all know that Esteban is everywhere. He's at the ICO, he's at the university, he's at WHO, he's at the everywhere. And everywhere that he goes, he does things well. So congratulations already, Esteban, for a wonderful symposium and for also to your team. I didn't prepare anything to introduce Esteban, but the only thing I can say is that we have shared many things. Some of the things I can say in a microphone. For instance, we shared an office at the IMIM when we were conducting our PhDs. Also, we share a passion for football, especially a particular football team. It's not Barca. We share a passion for scuba diving. He's a master, I'm a learner. But also we share a lot of time doing research and writing. And I hope that this will be for many years to come. So the title of his closing conference is Achievements and Open Challenges in the Tobacco Control Policies in this Century. Please, Esteban.
Okay. Hello. Good afternoon. A problem. No. Oh my God. Oh no. No, no, no. No. Who can help me? Oh. Què faig? Què faig? Hands off. Què ha passat aquí? Cancela, cancela.
És que si cancel una obra.
A veure. No, no mostra les imatges. Podem connectar
el teu ordinador
al meu portàtil? No sé. No sé, si hi ha HDMI, sí, si no, no. Thank you very much to all the survivors of the symposium, this late session, yes. And well, 2 hours ago I was thinking to myself, why did I accept to give this, this talk at the end of the session? A colleague of mine told me, no, you have to talk, you can do a summary, and provide some perspective and so on, and you never talk in the symposium you are organizing for the 10 past years. So I said, well, why not? But I was very worried because after hearing, listening to all these terrific talks that you have been providing and the clever thoughts and questions, I was more worried about this. But now when Joan has introduced me, I was very happy. So let's not take into account the technical problems, and I will try to provide a more or less fresh view of tobacco control policies now in the 21st century. In fact, this is a work that we do with Armando Peruga and Maria Jose Lopez and Cristina Martinez, and we published a few months ago. And my intention was to try to have a summary of the different topics that have been addressed during the symposium. And I was a bit surprised because there are many coincidences, well, not surprised, but you will see again several of the slides that our colleagues have been presenting without any previous agreement. This is not strange. This kind of agreement is good. And also perhaps some new slides. So thank you very much for being here. I will try to explain you these achievements that I believe more or less all of us already know, and what we think that can be challenges for the future. All this stuff begins 60 years ago with the publication of the Surgeon General report. You know it. It's even boring now, see this. But it was 60 years ago, on 11th January, that the report was released, and a few days later, it was sent to American doctors. And this makes a break with what was happening with tobacco control at that moment. So I believe this is important. All we know that the burden of tobacco on health, but the thing is that, yes, at the end of the past century, we had about 100 million deaths. And we all know that tobacco is the most preventable cause of death and of morbidity too. So, at that moment, governments and public health organizations became to be aware of the globalization. This word has been in the air during all the day with different synonyms, and the severe consequences of the tobacco epidemic. So, this is our starting point, but I wanted to refer to the 21st century. What we have lived during the last 20 years started with the FCTC, and this is not the first time we see this picture also in the conference room. So the FCTC marks also a milestone, or perhaps it's the starting of a new way of doing things. The global community recognized tobacco use and also as a global health threat, a social and economic problem. And it called to a joint international action. This is clear, and now it's easy to say this, but I imagine that people trying to promote, that some of them are here in this room, to promote the FCTC at the very beginning, in the late 90s, well, they were enthusiastic people and they believe in what they were doing, but I also think that they were a bit worried about the fruits of their work. FCTC, as you know, was adopted in 2003 and entered into force in February 2005. Well, the objective now is, I will try to highlight the achievements and in these 20 years of the 21st century and try to provide some elements for discussion, if you are here at that moment, about what can we expect in the future. In fact, we have been reviewing a lot of things that can be expected in the future. I believe that the previous sessions have given us a lot of ideas, a lot of concepts, and, well, the wish to continue working on tobacco control, or should I say, on tobacco endgame. Well, the achievements during the first 20 years can be summarized in galvanizing the global political will around international law, increasing the number of people benefiting from at least one cost-effective tobacco control policy since 2007, reducing the prevalence of smoking, and also reducing the prevalence to second-hand smoke exposure, and also one of the other topics that has been raised today, tobacco plain packaging. That has resisted the challenges under trade and investment law. I will quickly go through these points. Well, I believe that parts of this information has been also shown today. 90% of the world's population has adopted or live in countries, in states that have adopted the FCTC, 181 at this moment, without including here the European Union as a party, I think, or Adriana, correct me. Okay. And also the protocol for illicit trade products, tobacco products, that was introduced in 2018, with now, if I'm not mistaken, 62 parties have become a part of the 66, okay. It's very good to have this audience. So, there has been a redefinition of the role of international law in preventing disease and promoting health. And this is a change that we have experimented during the last 20 years. Yeah, there is a consolidation of a global, again, global governance of health. Health matters globally. Even now, we are talking about the health of the planet, and we are talking about planetary health, global health. Now we have journals in global health, beyond public health. And this has provided foundation for countries to work nationally on tobacco control measures with the international, the global support. And this is important too. Well, we know very well this slide. The number of people benefiting from cost-effective tobacco control policies has increased during the last 10 years, or 13 years in this case. There are now 146 countries with at least one empowered measure at the highest level. This means almost 150 million people in our planet. Not bad, not bad. These are the achievements. And also, the improvement is terrific. Between 2007 and 2020, all the empowered measures have increased. Some of them reaching 50%, like pack warnings or monitoring. So, we are not doing bad. Perhaps we were in green, light green in the scale, perhaps, using the tobacco control scale terminology. And several of our measures, policy measures, have increased, as you can see in this other table, in which, well, the percentages of population covered in 2018 are higher, fourfold, and even more for many of the strong policies needed. We also have reduced the prevalence of smoking and exposure to secondhand smoke, and this is the almost typical slide from the WHO global report on tobacco. And well, we can be happy about this. We can be happy I was also happy when I saw Hebe showing this same slide. Well, Hebe is more responsible of these slides. I'm just a user. But it is very important to notice that the prevalence of daily smoking decreases with the implementation of empower measures. We also have demonstrated this with the implementation of the policies considered in the tobacco control scales. It's not bad, between 0.39 and 0.50. So this is important, doing the things that FCTC is promoting at the national level prompts changes in the prevalence. Another of the good things of this century is plain packaging. Not only plain packaging, but the fact that it has resisted the challenges under trade and investment law. So you all know what is plain packaging. It was launched 10 years ago. This is the reason I put a tweet from my colleague and friend, Simon Chapman. So 10 years, and relatively few countries have done the same, in part because plain packaging was treated by the tobacco industry. We know. In fact, I'm wearing an Australian tie also, not as trendy as Armando's. Because of this, I thought, which tie today? I use ties perhaps 1 or 2 days per year. So this Australian one is, I love it very much, and I always refer to it when talking about plain packaging. So plain packaging, soon after implementing it in Australia, and we have also Australian people, correct me, Marita, if necessary, big tobacco companies filed a lawsuit in the Australian High Court. Philip Morris Asia also sought the Australian legislation because investment reasons that I haven't understood today. And 3 countries helped with this: Cuba, Dominican Republic, and 4 countries, Honduras and Indonesia and Ukraine, 5 countries, filed a dispute through the World Trade Organization. So this was very heavy for the Australians, for the Aussies, and also worldwide, because many countries were observing with detail what was happening in Australia. Something similar occurs in Uruguay, as far as I remember. Not exactly the same, but the case is that it's a pleasure to show this slide in this way now. The lawsuit was dismissed in August 2012, 1 year later, and the other problems were rejected in 2015 and 2020. So not only having plain packaging was a good thing 10 years ago, but also resisting the attacks of the tobacco industry. Which are the immediate challenges for further reducing the burden to tobacco attributable diseases? We have been talking about this. So, in our opinion, accelerating the decline of smoking prevalence. Smoking prevalence declines, yeah, but we have to accelerate, to prompt more work to make it decline faster. Positioning tobacco control in the global health and development agendas. Also overcoming the false health versus economy dilemma. We need a whole government approach, and also countering the tobacco industry's tactics. Well, we had good news. It is projected that for 2025 there will be about 30 million less smokers in the world. Good news at all. But there are buts. Okay, which is the but? The but is that We are reducing the prevalence in the Americas and in Europe, but there is a net increase in smoking in males in the African, Eastern Mediterranean, and Southeast Asian regions. So overall, we have a decrease. I am not going to show the figures by age groups and by gender, but the reality is that there are inequalities in how are we tackling smoking according to the different regions in the world. We have to strengthen the normalization, smoke-free environments, plain packaging with larger pictorial warnings, as larger as possible, but other additional measures can be prompted. Increase real prices, significant increases of real prices, because more or less all countries are increasing prices, but a few cents of euro, of dollars, of the currency. So significantly increase real prices of all tobacco products. And now we have more diverse tobacco products than 10 and 20 years ago. We have to prompt disrupting strategies applied to engineer the attractiveness of tobacco product. And we are talking again, and I believe that Constantine referred to this, about additive and especially characterizing flavors that in some regions are being banned. Okay? And also another of the loopholes that we should try to overcome is the tobacco industry's corporate social investment responsibility tactics, interventions, initiatives. So banning this in a strong manner is very important, because it's one of the last resources that the tobacco industry has at this moment. Also, positioning tobacco control in the global health and development agendas. Well, after hearing some of the talks here by Laurent and others, you have been referring to this. It is in the objectives for the sustainability development. Okay? In goal 3, we read, strengthen the implementation of the WHO FCTC in all countries, as appropriate. I don't know what does this mean. Okay. But, well, this was a clear victory for the tobacco control movement. However, some doubts were clearly expressed by some colleagues, and the reality is that tobacco control can remain merely a health issue instead of a development goal, and this is the real change, to put tobacco control, perhaps tobacco in the game, in the global agenda, in the development agenda. Tobacco control, as well as NCD prevention, involves the regulation of other industries than tobacco, industries that produce goods that can affect human health. So we are asking for a global consideration of what tobacco represents. There is another point, overcoming the false health versus economy dilemma. So we have to position tobacco control within the overall and mainly economic, and this is a scary place also, among the economical priorities in the agendas of the governments. And this is a challenge. And well, the parties of FCTC themselves recognize these critical challenges when implementing the treaty, the weaknesses of the multi-sectorial coordination, and also the insufficient support for the implementation from sectors other than health. It's a health topic, and it continues to be a health topic. Otherwise, we are able to change this, and this is necessary too. And I believe that this message has been also been considered during the symposium. Well, I also expected someone showing this picture, a classical one, because we have to counter the tobacco industry's tactics to undermine tobacco control measures. Or I suppose that most of you remember this picture from the tobacco industry advocates and leaders, those who were saying 60 years ago or 70 that tobacco was not harmful for health, that tobacco was not addictive, that they were not targeting youth, and we can share a lot of things. So, these people who now are committed to a smoke-free future, okay? Very committed, yeah. The tobacco industry continues to fight proven policies and programs that reduce smoking. This is the reality. And this is the case, very, very likely, of the strategies of harm reduction prompted by the tobacco industry itself. So it's better to erase things. And, well, they are doing things and they fail. And, for example, the case of harm reduction of ICOs. So the tobacco industry misrepresents the regulatory agency's decisions. The case of FDA and heated tobacco, it's very, very clear. And our colleagues from STOP have explained it very well too. But the tobacco industry prompted the confusion about this, and many people believe what they were saying before the FDA clarified. Well, going to the conclusions. Well, the conclusions, in fact, are these 5 challenges with the other components that we have been talking about. And taking profit of my situation of chairing the symposium, I have brought to the screen a cocktail of slides. I haven't had time to choose the best slide of any of our presenters, but, well, all of you visually will recognize them, and you were thinking now again about all the thoughtful things that have been shared in this symposium. So this is all. Thank you very much for your attention, and we will be closing in a few moments. Questions? Yes, questions. I understand if there are not questions. Pero cambia ya.
Yes, so...
Pero la Carmen también se ha puesto.
Ah, la Carmen, ok.
La Carmen no está.
Ah, vale, pues... So before the closing, no, that our Secretary of Public Health of the Government of Catalonia is going to do, we want to do like some, a summary of the take-home messages that we will bring home after this conference, after this symposium. I think it has been a very short but long day altogether, because in a few hours we have talked about how to move from tobacco control to the tobacco engagement strategy. In fact, we started with Ruth Malone talk, who reminds us that the tobacco epidemic that is produced by a particular agent, that is the industry. And she gave us like powerful arguments to have into account and to introduce in our argumentary in order to start to think about how to introduce the end-game strategy. I think that we can bring these powerful arguments with us, and also it was like also in the several sessions that we had review also how these ideas that Dr. Malone have given us have been introduced too. For instance, in the table in the session 1, we review how together towards the end game that we have like the possibility to work together between researchers, policymakers, and also watchdog representatives. We have seen that it's possible to introduce these kind of policies in the roadmap of several countries. We have seen the experience of Georgia and Finland. So if they have done that, we can do it also. So Raquel, we can do it. So don't lose your faith on it. But it is true that we need several things. I mean, for instance, it has been said, according to Dr. Ariana Blanco, that FCTC is a very good roadmap, but it still is very not implemented fully in many countries. Even we have like this is the basis of some of the policies that can be implemented, but of course, endgame can be like the future aim, but still we have many things to improve in the implementation of FCTC. In addition, in Europe, we have the tobacco product directive that is helping us in how to study and also how to introduce policies regarding the novel products that we have that is still maintaining the business of the tobacco companies. So we have to continue with research, we have to engage policymakers, we have to engage journalists and other sectors in order to move forward with our initiative of the endgame. It has been saying many things, but I don't know if probably Joan can help me in summarizing everything that has been said so far in the symposium. Probably I will say that we have a lot to continue to work, and this is our 6th symposia here at ICO. Hopefully, whenever we see each other in 2 years, in 2024, we will move forward all these policies of the game, and we have better situation. In fact, the tobacco control scale probably is going to be run again, and probably Spain and the rest of the countries will have better marks. But the fact is that in 2 years from now, we have a lot of things to do, to work, and also it's good to have this community, the tobacco control community, but it is important to enroll and also join the efforts of the rest of the society, because together we join and we get better results. So if you want to say something, Joan?
I will just add one thing. During the entire day, we've been using war. During the entire day, we've been using war terminology. The enemy is strong. We are losing or we are winning the battle. The war is not yet finished. I think that the enemy is actually very powerful, but we are already dreaming the end. When Ruth Malone in the morning introduced herself, she said that 2 decades ago, they said that that goal was crazy. Well, now we know that at least for some countries, the less than 5% prevalence will be reached in 2030. So if we can dream it, if we can imagine it, we can change the future. So the force is with you. And now that I have the microphone also, I have to tell you that Uruguay and Portugal are doing well in the World Cup. Uruguay is going 2 goals ahead. Portugal is 1 goal ahead. So far, still the symposium is very promising.
So, Joan, thank you very much because you gave us like a summary about the things the remarks that we need to think about the future. It's possible to make changes if we dream the changes. I'm completely agree. And thank you for giving us the report about the football World Cup. I'm going to pass the ball to your colleague and also football router of Español, Dr. Fernandez, who wants to say final words.
Thank you. Thank you. No, my only intention is to introduce to all of you Dr. Carmen Cabezas, Secretary of Health of the Public Health Agency of Catalonia. ¿Lo he dicho bien? Sí. Okay. For me, it's a pleasure to have Carmen again here, now as Secretary of Health. This is very important because I was telling someone this morning, she has been working in tobacco control during the last 30 years, 40 years, I don't know.
30.
30, it's enough. Yeah, because before 20 you were not working on tobacco control. And she has been working with us, supporting us from different places because we started to collaborate when she was not at the Department of Health, when she was in primary health care with different responsibilities, and now from the Department of Health in her current position, we feel quite comfortable and happy to dream that changes are changing also in Catalonia, and that perhaps these changes will prompt changes in other territories of Spain. So thank you very much, Carmen, for being here. No, sorry, for continuing being here with us. Thanks.
Thank you. Thank you, Esteve, Cristina, Joan, dear colleagues, good afternoon. Just a few words to remark on important things for us regarding to tobacco control or maybe tobacco and game and this symposia. And I think that it's very important to remark that a very good job has been done for many decades, and that the situation is different from some decades ago. This morning, Ruth Malone said that, and I think I agree. And this situation that is different is related with the work of many people that is in this room and in other rooms, in other facilities in all the world. And I think that from a public health point of view, is one of the big challenges or the big successes that we have achieved, and that is very important. But still, there are many things to do, many things to do. I think that it's very important to make tobacco a very important issue. I think that I don't know who explained that it's very important to relate with the other big agendas. For instance, the agenda of the SDGs, the agenda of the human rights, the children's rights, the agenda also for the right to a healthy environment. I think that is very important for all of us. And also it's related with the One Health point of view. It's not only the planetary health, it's the health of all beings is related one with each other. And it's important to see that it's impossible to work for the human health if we don't work for the planetary health or for the animal health. And everybody and every being is connected. And we are living in one planet that is the only one, and we want to work on that. And the thing that the plastic issue in the cigarettes and so on is very important, and we are trying to put these things in the agenda. And also it's very important that whole of the government, but also the whole of the society approach. That is a matter for all of us. the NGOs, all the entities are very important in this agenda and are asking us for doing many things. And it's very important, this task of No Fumadores and the other NGOs that are related with that. And also it's very important the topic of the issue to attract new people, to attract talent, to fight, to tackle the tobacco issue. And I think that is very important in order to make strategies and activities, but also in research. I think that is very important, and the lecture of Armando Perua was very interesting, and also the Thai, but the things too, that is very interesting to attract people to make the research that matters, the research that influence in policies and in strategies. And we are working very close with the people in the Tobacco Control Unit here, and their research and also the research in the Agencia de Salud Pública de Barcelona is guiding us in some aspect and is putting a good research that guides our policies and our strategies. And I think that we need a vision that inspires, and I think that the end game motto is very interesting, because we need to see the end of the situation, and less than 5% is okay. And I was looking for the prevalences a while before, and we are, in Catalonia, we are very far away because we are in the 22% of the population, but the most part of the countries are very far away also of this 5%. But also, it's very important to consider the fact that 5% is not the goal, the final goal, because we need to arrive to the 0%, but also we have this issue of the inequalities. 5% maybe for the all the population is maybe 15 or 20% for the people with low socioeconomic status, and that is very important, because also tobacco is an issue of social justice, and that is very important. And only to say that the team of Catalonia, we have here Jose Maria, Araceli, and we have many people that is working in the hospital network of smoke-free environments, and also in the primary care smoke-free centers, are working in many places of Catalonia, trying to help people to give up smoking, to prevent the initiation of smoking, and also to make strategies to end smoking. And I want to thank you to all the people that is involved in that in Catalonia, and also the people in the managerial and other issues. I see Antonia here in the room, as always, because Antonia is always in all the tobacco control initiatives. And to end my words, as always, I like to thank to all the people in the tobacco control unit here in the ICO, Esteve, Cristina, Mercè, Adriana, Montse, Laura, and so on, and many other people, sure. Anna, I didn't say Anna, yes. Anna, and everybody. And also for all the people coming from outside Barcelona, enjoy Barcelona, enjoy Catalonia, and enjoy Spain. It's a very nice city, a very nice country, a very nice people here. And okay, thank you.
Thank you. Let's have the picture. The speakers can come here. The speakers here and everybody here. Everybody who wants to be in the picture, of course. And then the speakers will take another one.